Once again, more officially, thank you for taking your places in the room. We are ready to start. Thank you so much to everyone who managed to come here in a timely manner. We start the conference, European Integration of Ukraine, Healthcare, which is conducted by EU Commission and the MOH. And it's dedicated to the Euro integrational path of Ukraine, and we are grateful for the support. We are very grateful to the EU project support in development of the up-to-date healthcare expertise funds, as well as other partners who are joining this very event today. It's important to mention that today is a very unique day when, in the course of one conference, we are going to discuss European integration in healthcare with such an extended circle of participants, because we have high-level international guests, international experts, representatives of EU and the representatives of EU commissions, powerful representatives of business, experts of research and development, and our future healthcare professionals, meaning students. Today we are going to speak about Euro integrational achievements of Ukraine. The country already has in the area of healthcare, medical services, public health, and maybe you've seen the photo exhibition as you were entering the room. Some interesting moments in time were captured on those pictures. And we are going to discuss the potential contribution of Ukrainian healthcare into the EU and bilateral cooperation with other EU member countries, financial prospects for Ukrainian healthcare within the framework of Euro integrational process, as well as our Euro integrational future through the lens of Ukrainian youth. And I would like to invite the participants of our first panel discussion. We are going to have two blocks. It's called Political Dialogue, Healthcare of Ukraine and its Way to European Integration. And this is my greatest pleasure to invite the first participants, Marina Slobodnichenko, Deputy Minister of Health on the issues of European integration, Alexander Inko, Director General of the EU Office for Euro-Atlantic Integration and European Integration, and Olha Stefanushina, Vice Prime Minister on the issues of European Integration, Euro-Atlantic Integration, Minister of Justice of Ukraine. Please join us here, and greetings to the first speakers. Dear friends, and before we give the floor to our dear speakers, we will start with Ms. Marina. Please let us have a look at yet another important video, because Ukraine is moving towards the EU, but the process of European integration would be the effort for many, many years, and would mean profound processes inside the country, but also inside the European Commission. So, before we start our discussion here in Kyiv, I would like us to have a look at the video greeting words from the European Commission on Health and Food Safety. Stella Kyriakides, please, attention.
Honorable Minister, dear Victor, ladies and gentlemen, I'm honored to address you today and underline our firm commitment to support Ukraine in all respects and for as long as it takes. Health is, of course, no exception. Our support to Ukraine as regards the healthcare sector includes immediate needs like medical evacuation. To date, more than 3,500 patients have been transferred to EU and EEA hospitals. In addition, we provide support through the EU Civil Protection Mechanism. Another area of huge needs and close cooperation is mental health and psychosocial support. We have given financial support to the International Federation of Red Cross Societies to support people who have fled Ukraine or been internally displaced. We are also helping Ukraine to strengthen access to mental health services for children. On rehabilitation, we have supported improved services for wounded civilians and veterans. In addition, we brought Ukraine into our EU for Health funding program, which opens many possibilities for cooperation. In June last year, we concluded further arrangements for deeper cooperation on health with the Ukrainian Ministry of Health. Ukraine's work with our European reference networks enabled additional financial support for the Ukrainian Hub for Rare Diseases at the Children's Hospital in Kyiv. And we are delighted that Ukraine has joined the board of the Health Emergency Preparedness and Response Authority, HERA. Together with WHO Europe, we have launched a project to build capacity in Ukraine to address chemical, biological, radiological, and nuclear threats, an area where we must continue to work and prepare together. Ladies and gentlemen, on these issues and on all others, we know that the future of Ukraine and its citizens is in the European Union. We are working hard to support Ukrainian authorities to meet accession requirements. Ukraine's alignment with EU standards will improve economic resilience, create new supply chains, and strengthen sectors such as pharmaceuticals. Negotiations will require leadership, determination, and focus. Getting reform rights will be key. Our support for Ukraine in this process is a given. These collective efforts reflect our profound commitment to supporting Ukraine. We stand together in your fight for freedom and democracy, and we will work together towards a future of stability, resilience, and partnership. I wish you a fruitful day discussing the integration of Ukrainian and EU healthcare. Thank you.
Дякуємо, пані.
Thank you so much, Ms. Stella. And Ms. Marina, we are going to start with you. And actually, you've heard the name Victor. They meant Victor Leshko. But Ms. Marina, you also know what's happening, what reforms are happening in Ukraine, no less than Mr. Victor Leshko. Tell us, is it really difficult to reform healthcare in Ukraine in these difficult times and approximate our standards to the standards of EU? And how can you explain to the internal users that this is something really relevant nowadays as well? Thank you. Well, in the first place, I would like to greet everyone on the side of MOH, Ministry of Health, and on behalf of Mr. Minister. I beg your pardon, Mr. Minister had to start this conference, but there is one vital reason for that. In several minutes in the Parliament of Ukraine, they are going to introduce the victory plan of Ukraine by the President of Ukraine, and Mr. Minister of Health is attending. We need to understand that each and every one of us actually has a lot to do with this victory, because each and every one of us is taking a niche in order to achieve this victory. And we are approximating the victory, and we are trying to implement all the necessary changing. We are reforming our system of healthcare, and we are bringing ourselves closer to the victory. And we are, I believe, on our way to the membership in the EU. Speaking about the healthcare, we are modernizing it, and let me provide you a few examples here. I'm not going to go into all the details, but let me mention some separate aspects here. Can we have a look at the present? Yep, I have to click it, right? Great. So, 4 key areas are there in our Euro-integrational processes. That would be public health, medical services, pharmaceutical regulation, and medical education. These four services within which we are implementing reforms, we are bringing our legislation into compliance with the EU acquis, and Ukraine is already at the front line of the digitalization of healthcare. If to be brief, while describing our achievements, how did we do that in public health? Thanks to participation of the Parliament and MPs, we passed the law on public health, on the system of public health. We've developed the emergency response plan, and such plans are of paramount importance for our country nowadays. And Ukraine has already passed the cancer countering strategy, and we constantly increase the volume, the scope of our assistance to the patient. We expand the program of medical warranties, and uniquely we continue with the reform of financing of medical services. In pharmaceutical sector, one of the most powerful in the European area, our pharmaceutical sector, we've achieved significant changes as well. We started reforming pharmaceutical sector in Ukraine, and we are moving along with it. The format of electronic documents have been already launched, but we will go into more details today at the dedicated panel discussions. And we are also trying to make so that our medical education complies with the EU standard, because high-quality healthcare professionals would be our better future. And we wouldn't have achieved it all, and I need to answer the question, how come we are achieving this? This is the only answer: powerful support of international partners, great coordination and cooperation with the countries of the European Union, with our international partners. And as of today, maybe you know that the president of Ukraine has signed 26 security agreements. And for sure, one of the clauses of these agreements ensuring the safety of our country would be the healthcare, which includes the Euro-integrational processes, among other. And actually, yesterday, we signed a technical agreement on implementation of such a security agreement, and we are very grateful to Ms. Minister for that. The same with Latvia. We have to sign the same agreement with Finland, and we have close cooperation with the European Commission. And this is of paramount importance, because without support of the European Commission, directorates of the European Commission, it would be very difficult for us to move all these processes forward. But have a look, within just 2 years since the moment of gaining the status of a candidate, we have huge achievements. We joined Euro for Health, EU for Health program. We have close cooperation with HERA board. We joined Critical Medical Alliance, which allows us taking part in various pharmaceutical initiatives. We already have such cases as tax twinning, which helps us strengthening our potential of our healthcare professionals in Ukraine. And for sure, cooperation with directorates. HADEA, SANT, European Medical Agency. This would all be something that allows us developing. We have a very powerful regulation in the negotiations process. Out of 37 negotiation sections, the healthcare is represented in 23. And this is a really really important topic. And And what would be the future of our country? In what way we want Ukraine to be developing in the European Union? And that's for sure. Resilient healthcare system that would be accessible, medicines for patients that would be our strong regulatory pharmaceutical policy, and we will achieve this all together with our international partners. And I believe all the speakers who joined me at this panel share all these values, and we affirm in one that we are going to European Union together with the state, with business, with the public sector, with international organizations, and with the huge support of the countries of EU and the world. Thank you. Ms. Lorena, may I ask you a clarifying question? When you speak about security agreements signed by Mr. President with various countries that they partially pertain to healthcare, what do you mean by this? Because when we speak about security agreements, we think of weapons, protection from the aggression. But if to speak about healthcare, well, I can mention three key things we are always highlighting whenever we discuss development of healthcare and security. First of all, development of international medical partnerships, which will enable our doctors or physicians to get new knowledge abroad. Then, second of all, reintegrational cooperation with the countries of the EU, because this being the case, the countries help us approximating our legislation to European Union acquis, and for sure that's MEDEVAC program continuation. This is something that helps our patients getting healthcare beyond our country, and we are very grateful to those countries that are welcoming our patients in their countries. Thank you so much, Mr. Alexander. I would like to give the floor to you now. On the 25th of June, the negotiations with the EU officially started. And in what way do you assess the progress achieved, and what's the greatest challenge? Where can't we meet the expectations towards Ukraine as of now? Yeah, hello, dear colleagues. My greatest pleasure to see all of you at an event like this. Right you are. We started the negotiations process with the EU. We started it in the very great brief time framework, and not a single country had such a short cut to such an achievement, and now we find ourselves at one of the most important stages of this negotiations processes. This is actually official screening of Ukrainian legislation. It's going to take place within all 35 negotiation sections. On one hand, this is a very technical process. On the other hand, it's very important because actually the results of this screening would define what the Ukrainian path to our accession, because the bottlenecks and the priorities are going to be identified in the course of this very process. So the issue of public health, of healthcare, would be one of the key negotiation sections, and actually section 28 is combined with the consumer protection topic, but you know, a great share of the EU legislation actually covers these issues, including healthcare and public health. And you know, we were thoroughly preparing for our negotiation process. We had the health screening process, and almost 140 agencies of Ukraine were involved, and they were self-checking their preparedness to this negotiations process. And in healthcare, actually, we've identified that something like 200 acts of the EU have to be implemented in Ukraine.
And that I would describe as quite a substantial piece of work that has been done and accomplished in order to sustain transposition of such regulations. One of the most important objectives was to make sure that translation of all of those regulations is done smoothly for the further review and deliberations both in the parliament and the government, covering different areas. And respectively, all of those implementation areas when it comes to legislation also require some institutional reforms, creating new institutions, new linkages and networks between them, and of course respective funding to support all of that. And with that, flipping the page to the challenges that we do have and we are facing at the moment, while at the same time having substantial experience and success record of implementing respective legislation, starting with the association agreement, and as of today, it's been implemented by almost 75%, and looking at the public health sector, that would be almost 80% of the agreement clauses have been implemented. And looking into the further course of negotiation process, definitely we will have to continue intensive efforts to sustain the progress achieved so far, including additional efforts to be made by the government, authorities and institutions, as well as by the parliament. At the same time, we clearly understand that we do have some advantages if compared to capacity and progress of other countries. But first and foremost, that would be the existential choice made by the Ukrainian people, Ukrainian nation and the state, because Europe is the key, and thus unification of different branches of our executive and legislative power. We are all aimed at clearly striving towards European integration, although we do that in the context of the war. And this is unique case scenario because Ukraine is the only country which is heading towards European integration while being at war. Definitely there are other priorities. Maybe some of them are equally vital. So finding the right balance between preservation of our independence, recovery of our territories, but at the same time never halting or pausing on our pathway towards European integration is important. Mr. Alexander, you mentioned 200 pieces of legislation, and I've seen some ironic smiles. I understand this number is huge. Each of those legal acts is complicated. So are there many uncertainties and unclarities regarding that? Yes, difficulty is there. Some of them are difficult, others are quite new, and I also could describe them as such, that do require some new approaches to implement them. Some of those approaches are not available in Ukraine at the moment, but as Europeans describe their legislation, they have some moving targets, which means that this is a live process, ever-changing environment. Member states have to adapt to this ever-changing legislation, making sure they can keep up the pace with the rest of European Union, including some of the latest legislation. But that would be on the one hand, while appreciating that this challenge at the same time is an opportunity for Ukraine, because we appreciate that as part of this negotiation process, one of the questions raised during the screening was whether or not Ukraine is interested in intensified integration process, thus opening some programs, EU programs, making them available for Ukraine, remembering that earlier these would be limited to the actual EU member states only. And as Madam Marina emphasized, this is important that we take part not only in harmonization but also development of some of such legal acts, because one thing is being an observer, and quite the opposite thing is to be the active member and part of the development processes. And this would be one of the advantages in favor of Ukraine. Again, remembering all of the circumstances, our resilience would be the key feature manifested by Ukraine on the one hand, and which is inspiring among our European partners on the other. And in that context, Ukraine can also make a very tangible contribution to development of this new legislation, including the health sector. Thank you, Mr. Alexander, Madam Olga. I believe you also, just like myself, listened to the previous two speakers, and the number of times when legislation was mentioned exceeded dozens indeed. So representing the Ukrainian parliament side, the respective executive committee, do you see and believe that our political will, respective commitment and manifestation of them both would be sufficient to make sure that our EU accession initiatives and ambitions can be matched by capacity? Warmest greetings, dear delegates, and I will have to apologize immediately because as soon as this opening session ends, I'll have to go back to the Parliament building to attend the presidential address, which is a remarkable event. But on my way here in the morning, I was recollecting October 2013, when I was one of the youngest activists. At that time I was working in a civil society organization, when I came to Maidan to manifest my position, namely in support of the European integration ambition of Ukraine. So again, that was ages ago, but remembering that autumn 2013, I do remember that we were young, we were not experienced, but we were confident that we have to move towards European Union, not appreciating how much that might take. Later on, I was the Deputy Minister for European Integration. Now at the Parliament, I'm chairing the subcommittee in affairs of European integration. So now I do understand this is not just a slogan, this is not a catchphrase, but that's a lot of work. These 200 acts, I know how much that translates into the number of sheets of paper and the piles of volumes respectively, appreciating how much effort should be invested both by the legislative and executives. But to me, these papers are not just documents. Whenever I visit European Union, I explain that my parents are 70 plus, and they feel old, they feel sick, and everybody looks at me with a surprise, because life expectancy in Europe is substantially longer than that in Ukraine. And being 70, even 70 plus in Europe, means that you can enjoy the best of your life. You can travel a lot, you can enjoy a lot, you can learn a lot. And again, this is nothing like feeling old and sick, staying in hospital and not being able to step out. So to me, European integration in the context of health means quality of life, long life expectancy with respective quality, accessible services, accessible drugs, accessible high quality services, and health education, of course, with high quality, which produces high quality providers, clinicians. And I'm confident this is one of our key objectives in the context of European integration, which is to make sure that Ukrainians can live a long and healthy life, thanks to strong health sector, of course. But coming back to 2022, when respective subcommittees were established at parliamentary committees to manage affairs of European integration, and I do believe that establishment of our subcommittee was a strengthening factor in favor and support of the Ministry of Health, and I remember meeting with Marina first and starting to work as a team ever since. At the same time, I do believe that most of those laws, which would be milestones in terms of legislation development, something like donor blood legislation or essential medicines law, they all serve as examples of very strong commitment and manifestation of our political will. But this would be equally important to monitor how those laws are implemented and enforce them respectively with via revisions of the committee under the Parliament. And this is exactly where and why the working group was established. In case you are not familiar with that, let me explain why such working groups would be important, additionally to committees and subcommittees, because those working groups serve as a platform to bring together civil society sector, international organizations, to discuss different matters which are important. With that in mind, please accept our open invitation to join such working group discussions on blood, medicines, health technologies, discussing all those implementation details which later on will have to be processed by the Ministry of Health towards the actual implementation. So with that in mind, let me wish all of you and us having a productive day, and also I believe that you will generate additional bullet points for discussion at our working group and commission, and we're happy to see that our audience today is full. And with that I really have to run. Before you have to run, is there any piece of legislation which got stuck in the parliament and needs a major push to have it advanced? I wouldn't say stuck, but some additional will would be welcome, including initiative on behalf of the Ministry of Health. That would be the law on medicines, which would benefit from some fostering and promotion. Again, we have to make sure that some of the laws will become effective and the second day following the end of this war. God bless, and hopefully we will live long enough to have that day coming, and that day coming soon. But again, this law on medicines, definitely it should be intensified and come into reality as soon as possible, not waiting for this war to end, and that would be one of the major promotional factors for other pieces of legislation, and also establishing the respective stringent authority in pharma sector. That would be also important. You mean this law which endorsed the electronic prescriptions, which was suspended, kind of, waiting for the war to end? I'm referring to this comprehensive law which covers a very broad area. It was amended, respectively, to reflect the European norms as well, but the expectation is that its endorsement date should be later than the date of the war ending. So definitely we should discuss that at committee, and if the resolution of this established meeting will promote that, we would be appreciating. Message clear. Thank you, dear Madam Olga, Madam Marina, dear Alexander. Thank you for taking part in this opening panel, and thank you for highlighting some of the milestones and key ideas and concepts to be covered extensively in our meeting today. And rewarding you with a round of applause, let me invite to come to the stage our panelists in Block 2. This will be international block regarding the global vision of Ukraine. Here we are happy to invite Stefan Schlonin, Head of Cooperation Programs of the European Union Delegation to Ukraine, Akko Johannesson, Minister of Healthcare of Sweden, and Bob Solm, World Bank Regional Country Director for Eastern Europe. Our dear guests, we know that some of you are working here for days and years, but some of you, like Her Excellency, Madam Minister, I believe this is your first visit to Ukraine, so thank you for making this. I understand this was a challenging trip, but you made it successfully. Starting with Mr. Stefan. EU is quite a milestone on the one hand, but a target as well. Also, that has been enshrined in Ukrainian constitution, but it would be very nice to hear what is the vision on the other side, on the side of the European Union. Do you believe that European Union is prepared to support Ukraine in such difficult times, with such difficulties that we are facing in terms of European integration progress?
Good morning. Minister, partners, colleagues, very happy to be with you this morning. And to answer your question straight away, yes, I think definitely we are prepared, and I think we are showing this for many years already. I think Mr. Ilkov said something very important in his earlier intervention, saying that Ukraine is unique in the sense that it's the only country where we are actually negotiating, discussing EU accession, while at the same time there is a full-scale war ongoing. Which means very practically when we speak about EU support, international support to Ukraine, we are talking about many very different things. We are talking about translating thousands of pages of legislation into English. We are talking about working with lawyers, with experts on very technical aspects of what we call the acquis, the body of EU legislation. And at the same time, we are talking about supporting veterans, children, families close to the front line in their daily survival. I think that is, it's sort of easily said from a stage in Kiev, but I think this dual reality is shocking and remarkable. I think it's remarkable, and I was in Brussels last week, participating myself in one of these what we call screening meetings. Where you have Ukrainian politicians, officials, sort of working with the EU officials on preparing for accession. We have organized that by chapter, cluster. I will not bore you with the details of that. We will have the health cluster in April. So last week we discussed public administration reform. So that's, our days of work of very detailed, comparison of legal texts. And you have a group of Ukrainian officials, politicians there, and the deputy speaker of the parliament was there, Mr. Kornienko, who traveled to Brussels, took them as all of us 24 hours to get there by train, by car, by plane, and who then engaged in this very technical, detailed work, while back at home, there is a war and there are air raids and their families are there. So I think that is something one can really not overestimate. I think we are, as the European Union, and the Commissioner said that at the beginning, we will be supporting Ukraine with all the financial, technical and political support that is needed to advance quickly in the accession negotiations. Of course, that's what we call a merit-based process. There is a lot of work ahead, a lot of reforms, legislation still to be advanced, but I think we are progressing very rapidly. And at the same time, we will continue with our international partners, the World Bank. We have WHO here, member states, France, Sweden, many others to implement, programs, projects, what we call Team Europe, both on the legislative side, but also, in the communities close to the front line, primary health care, mental, psychosocial support, mental health considerations, where we are working with UNICEF. So a whole range of issues. I think we are ready, politically determined to support Ukraine in that. And that's, I think,
Can I ask one question?
Please.
You mentioned all these challenges like translating documents, millions of pages, all these technical details. But apart of having the full-scale war, what is the biggest challenge for Ukraine now? It's on its path to European integration, you think?
I think the biggest challenge, as I try to say, is to do all these things at the same time. To find the time. Again, I mean, what does it mean very practically? And you, but also us internationals living in Kiev. What it means very practically is to work on translating a legal text while you don't have electricity at home. This is a big. This is a big challenge. It's also making, sort of the mental space and the energy in doing this work while, maybe, you have a family member at the front. So I think these things happening at the same time is a huge challenge. And again, I think it's absolutely remarkable that we are seeing the progress we are seeing in the accession negotiations. We are going through the screening meetings quickly. We hope to open the first chapter of negotiation pretty soon. So we are on a good track there.
Дякую. Я тепер хочу передати слово пані міністерці.
Thank you so much. And with that, I'd like to hand over to you, Your Excellency, Madam Minister. First of all, welcome to Ukraine. Thank you for representing Sweden, who is our standing and reliable partner for so many years, including reforms in the field of culture, in the field of health. Whenever and wherever you come, we are happy to see representatives of the Swedish Embassy to Ukraine. So we're happy to welcome you once again and thank the entire Kingdom and people of Sweden for offering this support. And again, speaking of the Ukrainian pathway to European Union, which do you believe would be the most important pieces of advice, observations, and maybe some experience and lessons learned to share?
I take the opportunity to use the whole floor. And thank you so much for having me. And I know Viktor Liashko needs to be in the Rada just now, but a big thank you to him for inviting me and for the good collaboration that we have and have had for a long time, really. I need to start with supporting Ukraine is Sweden's priority in foreign policy. That is our priority, our main task. So therefore it's important for us to be here and have a good collaboration. And we have had that for a long time, not only these few last years. We have started in the 1990s. So this is a long cooperation that we have had together. And the start of the accession negotiations in June was historic and a clear testament to the Ukraine's impressive reform efforts. So be proud of that. And I'm honored to be here today to discuss how we, as member state, can support you on your path towards the EU accession. And I am full of admiration to Minister Liashko and the whole government for all the work that is underway to create a stronger, more resilient healthcare system in Ukraine in the long run. At the same time, as emphasized several times this conference, at the same time, the full-scale invasion is ongoing. You are doing this in an excellent way, the both things. And the commitment by the Ukrainian government, as well as by the Ukrainian healthcare staff, make sure that the ones most in need of healthcare will receive that. And at the same time, you are working with a long-term reformation and development. And I'm glad that Sweden has been able to support the Ukrainian healthcare system with both donations of medicines and medical devices, such as anesthesia machines and ventilators, as well as generators to hospitals. That is also important to get the electricity there. Swedish support has also contributed to psychosocial support, rehabilitation, trauma care, medical assistance, as mentioned, and we will continue to receive, treat, and rehabilitate patients through the Medevac instrument. And I think about 200 patients has come to Sweden, mostly for cancer care, but also for rehabilitation after trauma, amputations, and so on. And I'm proud to have signed a memorandum of understanding last year with Viktor Liashko. And now, yesterday, we also signed this technical agreement to emphasize our continued work. And the memorandum includes support and cooperation, including training of healthcare staff in areas including psychosocial support and mental health, medicines, cancer care, trauma care and rehabilitation, and antimicrobial resistance. And last spring, the government commissioned the National Board of Health and Welfare to contribute to the support to Ukraine. And the agency has been tasked to develop a program for coordination of support in the areas of healthcare and social policy, focusing on capacity building and transfer of knowledge between public sector in Ukraine and Sweden. And I think this is a key component in realizing the commitment made through the MOU. And this support is a key part of the Swedish long-term commitment to support the development of the healthcare system in Ukraine. And I believe this will be an important piece to the puzzle in supporting Ukraine's EU integration in the area of healthcare. And I also want to highlight that the Swedish Medical Products Agency have signed a memorandum of cooperation with the Ukrainian Ministry for Health on cooperation to facilitate, as mentioned, the establishment of the single authority for regulations on medicine. And I think that will be an important piece in the EU integration, this work that we do together. Strong bilateral cooperation on all levels is important for the EU integration and for the ongoing reforms to be successful. But also hospital-to-hospital cooperation, such as between Karolinska University Hospital and Oshmadit and Clinical Hospital number 2 in Kryževice, creates an opportunity for mutual learning between healthcare staff. And this is a good example of how Sweden can learn from Ukraine's experiences and expertise, because you have expertise in a lot of fields that we need to learn from. And we believe that there is a need for multifaceted support to build a strong and resilient healthcare system, and to support cooperation between medical institutions, healthcare providers, universities, public agencies, private companies. That will be necessary in order to be successful. And therefore, the non-profit organization, SweCare Foundation, was granted funding from the government for a project on how private actors in the life science sector can support reconstruction and reform of the Ukrainian healthcare sector. And I am so grateful for the close cooperation between Sweden and Ukraine. And I must say, it is beneficial for both Sweden and Ukraine. Thank you.
Thank you very much. Apart from being a Minister of Health,
Дякую щиро. Але на додачу до того, що ви є міністеркою, громадянкою Швеції та громадянкою Євросоюзу, відповідно, у мене до вас особисте запитання в якості пацієнта. Який був би ваш перший критерій, за яким би...
Talking about healthcare, twofold. Because on the one hand, we have strong regulations. It's important for us to have strong regulations on pharmaceutical, medical devices, on human origins to order to work with blood and so on, but also on health data. It's important for the functionality of EU. But on the other hand, mostly healthcare is a question or competence for the national level. So your own government needs to decide about how to organize, how to finance, and how to work with priorities in the healthcare sector. And there is two things to do at the same time. Both work with regulations that make the EU functionality very good, and at the same time, it's a question for the national level. So what do we do except that? We have a lot of cooperation because we learn so much from each other. So we both decide a lot at home for healthcare, and we do a lot of negotiations on healthcare regulation. And just now, we are working hard with the regulation of pharmaceuticals. It's heavy work, I must say. We have working groups nearly every week in order to get consensus about how to do it. So welcome to these negotiations in the EU. It's important to learn from each other before we decide on the negotiations result to be on regulation, but then we follow the regulation, and that makes the whole EU a better place for everyone. So we both work on regulation, we work at home at the national level, and we cooperate a lot. And I think that will be very good for Ukraine to be a part of.
Oh, Mrs. Johansson, I am doubting whether I can ask you this question, but as a Minister of Health in Sweden, if you are sick, do you go to a private hospital or to a state hospital?
We don't have that. The whole healthcare sector is financed by taxes. So everything is financed by the government's grants or the regional level's grants. So, but we have private hospitals, but they are financed by the taxes. So we don't have that kind of question at home. But the doctor that I go to, the family doctor, that is the closest doctor in the primary health care, that's from the region's healthcare, so maybe I will call it the state doctor.
Great. Thank you very much. Дякуємо дуже. Пане Сом, тепер я хочу вам передати.
Mr. Som, and now I would like to give the floor to you. The World Bank is supporting Ukraine, as long as I remember myself, all the reforms and support to business, all the transformations happening in Ukraine. If to speak about healthcare and the World Bank, we understand that the World Bank is not just about support and assistance, it's also about high-quality assistance, about development of business, and in what way this all combines for you, all these your integrational processes of Ukraine, including in healthcare, and the requirements of the World Bank, the expectations of the World Bank you usually have from the country you work at and you are helping.
Great, thank you very much, and it's wonderful to be here today. I thought that the opening session was incredible. When we heard what Minister Lyashko, through the Deputy Minister, is doing with this extraordinarily complex yet important EU integration. Yet on the other hand, Olga sat here and said, all we want is to have long and healthy lives. On one hand, it's extraordinarily simple and very basic. On the other hand, I don't need to tell you how unfortunately complicated it is during this time of war. And I think this is when, from the World Bank's perspective, where we come in, because we recognize that healthcare reforms are not just for healthcare and for the ministry, it's for economic recovery. It's for human capital development. It's for poverty reduction. And this is why the World Bank exists throughout the world. This is why we have a long-standing relationship here with the government, with the people of Ukraine, and with all of our partners. We know that Russia's invasion has exacted both a heavy human toll, but also on facilities. Over 1,200 healthcare facilities have been destroyed. At the same time, non-communicable diseases, whether it be strokes, heart attack, other areas, are actually the leading cause of death here in Ukraine. And what I really admire about the work of the healthcare system here is the duality of it in responding to this invasion and to the horrors of the war, especially from a healthcare and medical facility perspective, yet at the same time meeting the needs of the population now and going into the future and getting ready for that. And all of this is very important when we look at the amount of the damage that has been done to the healthcare sector, over $16 billion of damage, and the needs in there are significant, and what it has done to the poverty in the country. So from this perspective, the World Bank is very pleased to be able to support both by financial support and support to good governance, supporting health to provide basic health care in this country, and with the support of our development partners. And at the same time, continuing to support reforms like this EU accession. I think when we talk about some of the priorities, then you mentioned from a quality perspective, when we look at EU accession, when we look at reforms overall, clearly learning from and adapting global and European best practices here to Ukraine is at the forefront of that. I would suggest that there's 3 areas of focus that we would like to work on and where the ministry already is doing. Firstly is strengthening primary health care. You know, again, this may sound like a given and a basic, but in the country, in this situation, doing that is extraordinarily difficult. 2 weeks ago, the minister and I were involved in a ceremony to hand over a whole fleet of vehicles, I think it was almost 200 vehicles, so that frontline healthcare workers could bring primary healthcare to the people. It was an extraordinary sight that the healthcare workers came here to Kyiv, and they drove those vehicles back to the front lines, because the people who are, a number of the people who are in the front lines, vulnerable, the elderly, the poor, they can't go to primary health care, or it's very difficult. So primary health care is going to them. So that's why primary health care is particularly important at this time. Obviously, then the foundations for going forward. Secondly is focusing on public health initiatives. And we've heard several mentions today about mental health. We've talked about disease surveillance systems, on vaccination programs, all of these that are considered basic public health throughout Europe, throughout the world. Ukraine has a strong tradition in this, but we also know that going forward, there are other areas on public health. Ukraine is already looking at the quote-unquote so-called sin taxes, whether it's on sugared drinks, on alcohol, on tobacco, and these type of areas that are also a standard, I think, when you look around the world, that are important in addressing non-communicable diseases, but also improving public health. The third area that we would suggest focusing on is the whole area around technology and digital. So whether that's bringing in, as the minister mentioned, high-tech equipment and high-tech medical devices, or whether it's the digital services. And all of you Ukrainians already know that Ukraine is so far ahead of the rest of the world on many things digital with the GIA system and all that you're able to do. Bringing this digital perspective into the healthcare system, and whether it's with the healthcare records, whether it's making data more easily available. At the same time, when we're now talking about how do we do the best recovery and reconstruction post-victory, I think healthcare is one of these areas where building back better is the theme. So we're already seeing that in the Ministry of Health, how they are leveraging new technologies today so that tomorrow is going to be a better healthcare system. So in conclusion, as we look forward from the World Bank's perspective and the way we're able to assist, we're committed to continuing our support, and whether that's learning from Europe, learning from other places, helping to bring that adaptation here through training, through support on implementation of these, the acquis and the standards. Second, we will continue our support for healthcare reforms, for good governance, for transparency, for supporting the National Health Service of Ukraine on strategic purchasing mechanisms, pharmaceuticals, all of this, so that there is strong governance and good transparency. The third area we will continue working on is encouraging and engaging with civil society. Civil society here is extremely important and extremely impressive. I recently met with a large group of the civil society organizations working in the healthcare area, and whether they are family and patient advocates, whether they are supporting patients so that the patients understand what should they expect when they go to a healthcare clinic. And to your question to the minister, what do you expect? What is free? What is provided? What do they need to possibly pay for? What type of services? And so it's very important that these types of advocacy and the transparency and accountability is there for all Ukrainians. So to conclude, this is a momentous time in Ukraine with the horrors of the invasion, but also the opportunities going forward. And as the World Bank, with all of our partners, we're pleased to be able to play a role in this. Thank you.
And may I ask you one question? You mentioned so many times transparency. So I wanted just to ask you to say once again, in terms of healthcare in Ukraine, what transparency means to you, a part of awareness of services that they can get? What else would you add?
Thank you. For us, when we talk about transparency in healthcare, the bottom line is, are people getting the services that they claim to be provided to them? To me, that's number one. Yes, we can talk about tracing the money and the grants that are made to the healthcare facilities. Are the doctors and nurses and others being paid? But most importantly is when somebody is in the system as having received a service, did they receive that service? And was that service of the quality and nature that is required? As simple as that. Again, to live long and healthy lives.
Thank you very much. So maybe as an American, you would add that for you, the best evidence of Ukraine's progress in healthcare, that in 20 years we have a candidate running for the presidency in his late 70s. Would you agree?
I wish everyone a long and healthy life.
Very, very diplomatic answer. Thank you very much. Дякуємо, друзі, учасникам нашого.
Thank you so much, dear participants of this panel discussion, and we are welcoming you to join the audience here in the room. Thank you so much. And we are now proceeding to our next panel, which is called Readiness to Healthcare Emergencies, Public Health and Blood System. And I invite Mohammed Farouqi, expert on the blood issues. And he represents the public health of the European level. Mr. Farouk, the floor is yours now as the moderator.
Good morning, everybody. It's my pleasure to be with you here today. Now we are shifting the gear a little bit to be more technical, and we will be discussing the emergency preparedness, specifically in the area of public health and the blood transfusion. It's my pleasure to invite the panel that will be with us today, Dr. Tatiana Skapa, Acting Director of the Department of Public Health of the Ministry of Health, and also will be with us online Dr. Yaroslav Valihora, Deputy Head of Health Security Unit, Directorate General of Health and Food Safety at the European Commission. Before we start, we have a short video about the public health system in Ukraine. It's only 2 minutes video, so let's start with this video.
From birth, the public health system ensures care and protection for everyone. We provide access to safe and high-quality vaccinations for every child, supporting their healthy development and learning. School nutrition reform promotes balanced, healthy meals, laying the foundation for a healthy future generation. Mental health is the foundation of resilience. We nurture individual and collective resilience. This is the basis of the all-Ukrainian mental health program. How are you? Ukraine is building a smoke-free environment. Youth are taking responsibility for their health and ensuring a safe space. Blood safety is a key priority. Donation is widespread, and modern technologies guarantee high quality. Active detection of infectious diseases is the key to effective prevention. An effective public health system is essential for the health of the entire family. The public health system supports lifelong health, fostering for active and healthy aging. Despite the war, we continue building a resilient public health system.
Yeah, perfect. Now we are starting with our first topic with Dr. Yaroslav Valihora. Dr. Yaroslav is the Deputy Head of the Unit of Healthcare Security at the European Commission, Directorate General for Health and Food Safety. At the same time, in the same directorate, he worked before on health research, rare diseases, cancer, nutrition, and physical activity policy. By training, he is a medical doctor, pediatrician, and a specialist in clinical genetics. He obtained his PhD at the Medical University of Warsaw. Dr. Yaroslav will be with us online, and he will discuss with us health security as the key vector of the development in the field of public health in the European Union. The floor is yours, Dr. Yaroslav.
Thank you very much. I hope you can hear me well and see my presentation. Good morning, dear ministers and ladies and gentlemen, dear chair. Indeed, as it was said, we will change now into more technical topic, which is health security framework at the EU level. And as was mentioned before by Commissioner Kyriakides, this is one of the very important parts of the policy, of the health policy at the EU level, especially after COVID pandemic. The Commission decided to revamp its health security framework, and the proposal of European Health Union was put forward, and this actually materialized in the new legislation which is now in place. And in my presentation, I would like to describe some of the elements which are now in place or are implemented, in this area at the EU level. I know that in some of those activities, Ukraine is already actively involved. In some others, will be most probably in the future as well. So it's important to understand how this system is built, because it's many of those elements, as I said, are new as well for the EU countries. The overarching element of this framework is a regulation on the serious cross-border threats to health, but it cannot be read in isolation, because I mean it is element of the bigger picture, a bigger puzzle, which includes as well mandate for the European Centre for Disease Prevention and Control, mandate of the European Medicines Agency, and last but not least as well, HERA authority, which was mentioned as well by Commissioner before. So, as I said, the regulation on the serious cross-border threats to health is an overarching legal element. When it's important to highlight, it is not only covering biological threats, but it's as well covering chemical, environmental, and even unknown threats to health. So the system we are now building is actually trying to cover all these elements together in a comprehensive way. Here I would like to show you a little bit how we see the interpretation of that system with the overarching regulation on the serious cross-border threats, but as well those revised mandates of the EMA and ECDC and HERA. There are some bodies which are active in this area in the peace mode, but as well some of them are active in the crisis mode. I will come back to some of them in my next slides. So first step taken after the entry into force of the regulation was obviously to organize the Health Security Committee, which is composed of the member states' representatives, and it's meeting at two different levels. So there's a senior level of the Health Security Committee and technical working groups. We have for the moment several of those, and they are meeting to address some specific aspects of the health security. Important to note, and this is novelty in comparison to the previous decision and the past health security framework, is that Health Security Committee has now possibility to adopt opinions and guidance. And these guidance and opinion, they are serving as a good background for the future and for the political decisions. The biggest part of the regulation is addressing prevention, preparedness, and response. And it is doing so both at the EU level and the national level. At the EU level, currently, European Commission, together with member states, is preparing a Union Prevention and Preparedness Response Plan. And this plan will cover capacities and resources at Union level, and in particular will address those cross-border integrational preparedness elements. At the national level, the regulation is supporting countries in the preparation and revision of their national plans. And there are two important processes which are in place now. One is related to the reporting by countries about their preparedness and response plans and elements in the public health sector. And the other one on the right side is related to the assessment of those, and this is done by the agency in Stockholm, which is ECDC. So these two processes are very much linked together, and the cycle of both of them is 3 years. The other big part of the health security is epidemiological surveillance. And what was clear after pandemic that the availability of data, timely availability of good quality of data is really a critical element enabling good decision process later on. So that's why this element is really strong in the regulation. And we have a huge support via direct grants from the EU4Health program to countries to improve their national surveillance systems. And as we heard, Ukraine is already part of the EU4Health program and can benefit as well from this support. Another element which will be changed very, very soon is a list of notifiable diseases and their case definitions. This is a very important part of this puzzle, because this is actually describing the obligation as well of public health authorities to inform other countries about not those diseases and outbreaks which are happening in their territories. This is all actually going to is covered already by digital platform for surveillance, and this platform is run by ECDC agency in Stockholm. There are other elements I would like to mention which we are currently building and supporting, and one of them is European Reference Labs for Public Health. The aim of those labs is to support national reference laboratories to promote good practice and alignment of the member states' diagnostic standards, methods, and tests to actually make that capacity available once there is an outbreak of disease or there is a other, for example, chemical or unknown threat which requires assessment. So there are already first 6 EU reference labs which are supported by as well budgetary from the EU4Health program. You have list here, and now we are working on the next bunch of labs which will be supported this year, and the focus will be this year on food and waterborne diseases. There will be more labs supported in the coming years. Early warning and response system, some of you are already familiar with that, because it is a system which is actively supporting medical evacuation of patients from Ukraine. So Ukrainian authorities are already actively using that system together with member states' health authorities to ensure swift passing of the health medical records of patients, and as well ensure that those patients are transferred to health care facilities in the EU member states. But in the EU, we are using this system mainly to inform other member states about the health threats, so to notify emergence of such a threat in one country in the case where this threat has a potential cross-border impact. But after such a notification, what is needed is a a proper public health risk assessment. And this assessment was so far done mainly by European Center for Disease Control in Stockholm, which I already mentioned. But now, when the scope of the regulation is extended to chemical, unknown, and environmental risks, that public health risk assessment needs to be as well much more comprehensive and must as well involve other agencies like EMA, agencies working on chemicals like ECHA agency, but as well agencies dealing with environmental threats, but and looking at health threats as well from completely different perspective. So the framework to ensure this risk assessment is available for member states, for health security committee, and as well for political discussions and decisions is now in place, and the agreement has been signed with the agencies to provide a risk assessment. What is as well a novelty in the health security now, there is a possibility for the EU to recognize and terminate a public health emergency at the EU level. In the past, EU relied more on WHO, but in that regard. But now, EU has as well possibility to recognize such a public health emergency at Union level. I have to say that it was never used so far, but this possibility is there, and it has as well some legal implications, and it triggers some elements which are in those legal texts which I mentioned at the beginning of my presentation and are related to European Medicines Agency, European Center for Disease Prevention and Control, but as well to HERA. And last but not least, I would like to mention another body which is a complete novelty, and in the case the EU is going to consider recognizing a public health emergency. There is a new committee which was just established. This is Advisory Committee on Public Health Emergencies. And this committee is composed of 44 experts from different sectors and economical activities, because as we know, public health emergency is not only about public health sector, but it's about a whole society, and response and as well implications are related to the whole society. So we have now in place such a committee which we can ask together with member states for advice on possibility to recognize and terminate public health emergency. So I will stop here. Thank you very much for your attention. And this was my last slide. Thank you very much.
Okay, thank you. Okay, thank you, Jaroslav. Very informative. And for the sake of time, we will move now directly to the second speech from Dr. Tatiana Skapa, Acting Director of the Department of Public Health of the Ministry of Health. Dr. Tatiana earned her medical degree from Dnipro-Petrovsk State Medical Academy, and then she has also a Master of Public Administration in Healthcare from Dnipro-Petrovsk Regional Institute for Public Health. For 10 years, Dr. Tatiana is working in the system of sanitary and epidemiological services, and since 2019, she has been working for the Ministry of Health of Ukraine. She was responsible for the prevention of non-communicable diseases, radiation safety, climate change, and the environment. She was partially involved in the area of antimicrobial resistance and the emergency response in the field of public health. Dr. Tatiana was at the forefront of the school nutrition reform and reformed tobacco legislation. Dr. Tatiana will take us further with the public health, the evolution of public health. The floor is yours. Thank you.
Thank you so much. Thank you so much indeed. And once again, warmest welcome to all of you, dear colleagues, dear friends, dear partners. This is quite an responsible role honor at the same time that I have to deliver, which is to have you updated on the accomplishments of Ukrainian public health system evolution, as you can see it here in the slide. This would be quite a difficult and objective to provide you with such an extensive coverage in short words, because public health as an element is ever existent basically in every corner of Ukraine in terms of geographical coverage, but also in every second of a human life of any Ukrainian citizen, starting with the moment of birth and down to the moment of death, including environmental safety, radiation safety, water quality and water safety, communicable, non-communicable diseases, and other elements that we are facing, interacting with basically every day and every moment of our life, starting with tobacco and down to physical exercise, training activities and everything else. So I do believe I am strong enough to take on the challenge and to provide with some update on the major accomplishments we have over these years. But as a starting point, let me suggest that we use the report from the European CDC regarding the system assessment of Ukrainian healthcare system, which was conducted back in 2016. As you look here in the slide, you will see the major areas, some of those areas which have been which were covered in that report. And starting there, we will take it step by step in terms of evolution of improvements regarding those areas. Starting with the management in prevention and infectious disease control. First and foremost, that would be outdated, even obsolete legislation with lots of controversial clauses and regulations. Here we have a major breakthrough, because thanks to joint efforts between the government, parliament and civil society, the public health law was endorsed, which is a fundamental document in the field of public health. Other pieces of legislation, including secondary legislation reflecting some EU regulations, were developed and endorsed, but there is more to do. Because legal acts by themselves, having as a legal basis and foundation, this is important, but they also keep changing, they also keep evolving, and we have to make sure that we keep up with our pace. Nevertheless, the law defines that there should be the stringent authority, clearly identified, and as well as the network of executive agencies, and thus we have the network of 25 regional CDCs. And then, flipping the page to HR capacity, on top of that legal foundation would be another challenging areas. And the particular challenge is the sufficiency of our HR capacity. First and foremost, looking into the findings of the report, it outlined clearly that HR capacity issue was challenging because our professionals were not fully compliant with the key requirements, which would be which we have to match in terms of quality of HR, including the capacity building education in field epidemiology, laboratory leadership. Remembering that here we have both master's program and bachelor degree program for public health professionals, which will develop our capacity to generate the new team of healthcare professionals, namely in the field of public health. Furthermore, HR motivational element in the area of HR would be setting the minimum salaries and wages, making sure that we have sufficient financial incentives for professionals to come into the health sector. So, looking to epidemiological surveillance, we also had a number of issues identified, and today we are trying to improve our legislation when it comes to epi-surveillance, and now we transit from inspections when it comes to epidemiological surveillance and respective compliance enforcement, to conducting epidemiological investigations and implement. Now we are evolving to looking into the causality assessments in order to better understand what are the drivers behind different events we are facing, in order to be better prepared to respond. And also having the fundamental regulations for epidemiological surveillance, the infectious disease inventory and notification identified. We also have defined requirements regarding the case assessment in case of infectious diseases, which would be fully compliant with EU legislation, which again takes our system closer to that functioning in the European Union space. When it comes to emergency response, we also mentioned quite extensively, including here today, that under the current circumstances that we are surviving at the moment, first affected by the COVID pandemics and then followed by the full-scale invasion of the Russian Federation, the capacity of our public health system to respond to such challenges is a very important factor, not only from the point of view of public health, but healthcare in general, because everything that we manage to prevent, respectively, does not become a burden to our healthcare system when it comes to response and service. And thus, when it comes to response preparedness, we have two functional systems: the system for civil protection, respectively, as well as the system for medical, sanitary, and epidemiological well-being, with the respective regulations. So both sanitary and epidemiological components of welfare are observed. And looking into those actions and interventions deployed by the Center for Disease Control and Prevention, as well as Ukrainian National Public Health System, we have established the so-called response teams, depending on the type of threat, whether it's biological, radiological, versus chemical. And these response teams would be also the first responders involved in the public health sector to respond to any emergency or contingency happening. Speaking of the health component, here we have the packages of health services which would be rendered by respective providers and clinical institutions, which have been designated as the cluster institutions to provide health services to the survivors of any emergency of any sort in case of any kind of threat. With that, going to laboratory research. Laboratory research, based on the findings of the report, were identified such as being sometimes provided in excessive manner, which is not substantiated by the respective needs. Also, we can see mentioning of the vertical integration of the systems, which do not have any horizontal links between them. Now, looking into the public health system, which defines both structures and functions of the public health elements, which should be constructed in a very strongly aligned in the vertical manner network of institutions to monitor both environmental factors but also any clinical elements during outbreaks of infectious diseases. Also, we have clear definition of requirements for external quality assessments, because namely the external controls when it comes to laboratory testing and research provides us with opportunity to develop, to build our laboratory capacity and have sufficient and verified quality of laboratory testing results. We also have clear definition of requirements regarding the reference laboratories, which should be involved what would be eligibility criteria and qualificational expertise who can qualify as a reference laboratory in order to serve for the needs of, among other areas of responsibility, also to provide for external control and quality assurance. Antimicrobial resistance, we mentioned that number of times, and that is a global challenge. This is not only a problem which is specific for Ukraine, but this is an international, even global phenomenon that we are facing. And in that regard, particularly remembering about this full-scale aggression of the Russian Federation, in view of which we had to elaborate how can we make an impact when it comes to emergence of antimicrobial resistance and infectious, how to better describe it, infectious disease, them in case of purulent wounds, in case of casualties and wounds among servicemen and civilians, which, among other causes and manifestations of AMR, is also an issue. In view of that, the respective action plan and regulations were endorsed, and I do strongly believe that such experience, when it comes to response to microbial resistance development, could be helpful, but we also hope and believe that the precedent like war will never happen in your territory, inducing you to look closer into that. In any case, we believe that one of the major solutions here would be implementation of electronic prescription tool when it comes to antimicrobials. Definitely, there is a lot of space for further development and improvement, but looking into our current environment and capacity, definitely with support from the partners, we can maximize our capacity to do our best to save health and lives. And now the non-communicables, this would be my favorite area and subject, which is close to my background and my heart in a professional sense. And starting with the findings of 2016, the non-communicable diseases as a sector were not considered at the same level of significance as, for example, infectious diseases. But looking to the recent years, we can see that the problematics of non-communicable diseases, I mean their prevalence among the population, has increased in terms of focal attention given to this area, as well as advancement and interventions implemented there, starting with the school nutrition program under the auspices of the First Lady, Madam Zelensky, as well as mental health program, national strategy to control cancer diseases. We also have a major breakthrough thanks to our collaborative initiatives among members of parliament, government actors, civil society actors in the area of anti-tobacco legislation. So again, once you touch non-communicable diseases, I can speak here for hours, but let me shortly emphasize that in fact it's a facet of the and element to many areas of human life and well-being respectively. And although we have some accomplishments here, we still have a very broad ground to cover. And in that respect, we do hope and believe that all of those initiatives which are springing out and evolving in that respect in collaboration with our partners will definitely generate some fruitful results into the future.
Just one small question. If I ask you to quantify the current gap between the findings of the report and the current situation, how many of the non-compliances were addressed? In percentage, maybe.
No.
Well, that's a challenge to do some maths and to have this percentage quantified. But again, looking into the realities and findings of 2016, I believe that at least 50 even more, up to 60% have been accomplished so far. But again, it depends on the area. Looking at the area of non-communicables, this area was not covered in the report. But while looking into the accomplishments we have in that regard, then I do believe that we have a lot to share with others, not only to learn from others. If you take school nutrition report, for example, we have learned a lot of helpful lessons which will be applicable not only in Ukraine but in other European countries and globally, because it's super modern, and that would be some rocket science indeed in action.
So now we move to the last presentation of this panel on the Ukrainian blood transfusion system reform. Actually, it will be presented by me. My name is Mohammed Farouk. I am a medical doctor specialized in transfusion medicine and human tissue and cells. I have like 25 years of experience in this area. Currently, I am the key expert for blood safety for the EU project of supporting Ukraine to develop a modern public health system. This project is implemented by a consortium of GFA Consulting Group and the Finnish Institute for Health and Welfare. I have less than 10 minutes to summarize a lot of stuff, so I will speak very quickly, and may God help the translators to catch up with the translation. But anyway, I am the moderator, so I can give myself like a couple of minutes more. So before I start, the blood transfusion, I would like to give like some background about blood transfusion, because blood transfusion process is more complicated than it sounds in general. The only source of blood is human being, okay? Only donation from a human being. And we start the process with the donor. We start the process with the donor, who is a completely healthy person, has nothing to do with the healthcare system. They have no obligation to deal with the healthcare system, and we need to work to recruit them and bring them in contact with the healthcare system to donate blood. And it ends with the recipient, who is usually severely ill or severely injured person in need for this blood. And in between the donor and the recipient, we have a long chain of activities of testing, processing, and producing the blood. And the blood always carried the risk of transmitting an infectious disease. Even if we did all tests, it still carried the risk to transfer disease. I tried to put the activities of the blood transfusion chain in another way to see how diverse it is. We start with the donor recruitment, which is a kind of public affairs and communication science. Then blood collection, kind of clinical medicine, testing, laboratory medicine, component processing, it's like manufacturing, storage, transportation, supply chain, blood use, it's kind of clinical medicine. And all this under the umbrella of quality management. So you can see that we are dealing with like 6 or 7 different disciplines, not related to each other. And this is the difficulty of blood transfusion. In an ideal world, the blood transfusion system should look like this. We have a legal or a statutory law managing the whole process, and then we have independent national blood regulatory authority that makes sure that this law is implemented and all players in the field are not deviating from the rules. And then we have the blood supply arm and the blood use arm. The blood supply arm is the establishments that collect, test, and process and issue blood. They can be centralized or decentralized. They can be governmental, private, or NGOs, whatever the configuration, but we need to have this blood supply arm. And the other arm is the blood use arm. It's a clinical transfusion department in hospitals that transfuse blood and monitor the patient after the transfusion process. So this is the ideal world. Okay, when we started our project in Ukraine and when I first came to Ukraine, I thought it's impossible, okay? Because we did an assessment and a lot of gaps were found, and actually they are, maybe summarizing them in some bullets is not enough because they are bigger than this. First, we had a complicated legal framework that was outdated, restrictive, incomplete, and does not reflect the actual practice. We will come to this later. Also, there was no regulatory authority at all for blood transfusion, and the blood service provision itself was very fragmented. We will come to this fragmentation point later also. Another big problem was the aging workforce. Most of the people it's not a discrimination, but it was like the blood transfusion field is not attractive for new generations, so they are not coming in. So we ended up with institutions with aging workforce resistance to any change. There was a reliance on paid donors who receive money to donate their blood, and this is very risky because those donors are high-risk group to transmit diseases to patients. There was no standardization of most of the technical operations, and limited or inconsistent implementation of quality management, a lot of financial and operational deficiencies. There was no one set of guidelines that are implemented everywhere. Each blood establishment was innovating and doing the blood transfusion process in their own way. And of course, the infrastructure and technology challenges were existing. Regarding the complicated legal base, before 2020, there was 107 different legal acts dealing with the blood transfusion field, which means that the initial acts are not sufficient, so you start to produce different acts and amending, and they're producing more and more acts. So you can imagine in a small field like blood transfusion, we have 107 different legal acts. For the fragmentation of the services, in 2014, there was 486 entities involved in the blood transfusion services in Ukraine. And this shows the complexity of the system at this point. We didn't have only Ministry of Health, some other ministries also run their blood services. Academy of Medical Science also had some involvement. There was no competent authority, and there was a lot of fragmentation and conflict between all these different entities working in the blood transfusion field. However, in spite of the complicated environment that is hostile to any development, we can add COVID also and the war. There was a vision of from the Ministry of Health to improve this system in many ways. I wanted to summarize also the achievements in this area. The first one was issuing the Blood Safety Law number 931 in 2020, and this law is largely aligned with the EU requirement, mainly Directive 98 for the year 2002. And then the second achievement was to establish a national structure resembling the model that blood services should work. So we have the competent authority, we have national coordination body, the National Blood Transfusion Center, and we have, it's still under development, the National Transfusion Committee. The system also shifted from paid donor to voluntary, non-remunerated paid donation, which is recommended by the EU requirement. And now I think the majority of donors in Ukraine are voluntary, non-remunerated. And also there was a focus on regular donors who not only donating one time, but they donate and then come back after a few months, and then after a few months and so on. Because first-time donors, the donors who donate only one time, they are usually risky. When they may be risky. Also, there was a big effort on digitalization of management and coordination functions, establishing the eCROV. eCROV is the information management system that manages the blood transfusion system inside the blood establishment, development of donor registries, donor scheduling system, and the blood establishment licensing registry. A new method of costing and pricing system for blood and blood component was developed. It is not implemented yet, but it is under the final approvals from the different government bodies. A lot of human capacities building activities were done. Focus was put on clinical use of blood and patient blood management. And the concept in this area, we reduce the need of the patient to blood as much as we can. So we do all other medical efforts so that the patient does not need blood or does not need a lot of blood. Because as we said, all blood transfusion will be always associated with some risk. So if we can prevent blood transfusion, this will be the ideal situation. Self-sufficiency was achieved in spite of the war. So Ukraine did not import any blood from outside countries. and this is a remarkable achievement. National blood standards, national licensing requirements, and quality management system requirements were developed in the area of blood transfusion. This is now how the blood transfusion system is structured in Ukraine. As you can see on the right side of the screen, on the top we have the Ministry of Health as the policy formulation body. They develop the policies, the regulation, the guidelines, the standards, and then we have on the left side of the screen the competent authority, completely separate from the operational activities, and the competent authority activities were assigned to the State Service of Ukraine on Medicines and Drug Control. And on the right side, under the Ministry of Health, we have the National Transfusion Center, which is the coordination body of the whole system in Ukraine. And under this National Transfusion Center, the regional blood establishment and hospital blood banks are working. They are not subdivisions, but they are coordinated by the National Blood Transfusion Center. And of course, we have the National Transfusion Committee, which is the advisory body to the Ministry of Health, technical advisory body to the Ministry of Health. It's still under establishment. One of the major achievements, as I said before, is shifting from paid donation to voluntary non-remunerated blood donation. And this was achieved through a big communication campaign. The reach of the campaign at the moment is over 2 million donors. And the objective was to promote voluntary and regular. So you don't donate only one time, but you donate, once you are a donor, you donate regularly. The campaign passed through many phases. The first phase was under the slogan, "Your blood can fight, become a donor," and then we shifted to the next stage. There are no holidays in war, your blood will fight, and now we are running the third stage of the campaign under the slogan, "Donate blood and bring a friend," to enforce the regular donation culture. The war, the full-scale invasion and the military aggression resulted in some lessons that we can learn from Ukraine, and we need to consider in any such comparable case. The first thing is the everlasting discussion about do we need to have a centralized or decentralized blood system. In fact, in a country with a small size, centralized will be very effective. But country the size of Ukraine in terms of population and surface area, the decentralized configuration was very helpful because regions were cut from each other at some points of time. There was no possibility to transfer blood from one region to another region. So because each region or each oblast has its own blood establishment, so this provided a lot of help in order to ensure that blood is available exactly in the place where it is required. The second problem that was faced is the shrinkage of the blood donor population. Not any citizen can be a blood donor. They should be with a specific health condition. They should be inside certain age group. And the problem is because of immigration, a lot of people, maybe more than 6 million, immigrated outside of the country. Other males in the blood donation age group were mobilized to the front lines. And the population pyramid in general in Ukraine, the middle part of the pyramid that should be the part that will donate blood is smaller than the top of the pyramid and the bottom of the pyramid. So one of the approaches to address this was to focus on the population segments that are still in Ukraine. So the focus are on females, to recruit female donors, and also to make sure that any donor who donated for the first time will be a regular donor. So he or she will donate more and more over the years. So using these techniques of focusing on females and regular donors helped much to ensure the availability of blood and blood components. Also, national blood stock management and coordination, they were nationally managed at the headquarters of the National Blood Transfusion Center. All data about the stocks of blood, raw materials, blood components were shared every day from all the country with the National Blood Transfusion Center. And then they have the vision to mobilize the ready blood units to different regions, and also to mobilize raw materials if there is one region that has insufficient supplies of raw materials. Also, one important point was the blood donor scheduling, because usually during emergencies, donors rush to donate under the emotional effect of some event, explosion, or whatever. This is very risky because blood has a shelf life, and if you have a lot of blood at small time, after 1 month, you will discard all this blood with no use. So this is the first importance of donor scheduling. So we don't want all donors to come at once. We want them to come like in just-in-time approach. When we need blood, you come and donate. And the second point was, if you have many donors at the blood establishment at the same time, there is a high risk if explosion or rocket hit this blood establishment, there will be a lot of casualties. So this donors scheduling system helped to make sure that any given blood establishment, the number of blood donors is not huge at a single time to avoid a lot of casualties. Also, Ministry of Health provided education to military medics who are not usually trained in blood transfusion. They were trained on how to withdraw blood, how to use the blood in cases of emergency, trained on using of some blood alternatives like lyophilized plasma, and the medics received such training. The last point that we can learn from Ukraine is the involvement of civil society organizations. Whatever the size or the capacity of the Ministry of Health, there will be always a defect in the resources required to reach a big population and mobilize them to donate blood. In Ukraine, there was a leverage of the number of the civil society organizations here that are working in the blood transfusion field, and they managed actually to promote the voluntary blood donation and mobilize a lot of donors to donate blood. Just a brief, this is brief about the blood safety component of our EU project on supporting Ukraine to develop a public health system. We have 4 main activities. We are working in the legal, supporting the legal approximation with the EU. We are supporting the Ministry of Health in restructuring and making functional the National Blood Center, the National Competent Authority, and the National Transfusion Committee. In addition to support in operational and the quality management activities, and finally support the emergency response in the area of COVID a couple of years ago, and now in the area of war. I would like to conclude by saying that blood systems are always evolving and dynamic. They change from day to day. So when we do efforts today, we don't stop. We need to do more efforts in the future. In Ukraine, a lot has been achieved in this critical field, and still a lot needs to be done, especially that the EU approved last June the new regulation on substance of human origin, including blood. So there will be another layer of legal adjustment. So a lot is still yet to be done, and the Ministry of Health should keep working in this area. However, commitment to continue system-wide improvements and EU alignment activities in spite of the war says it all, says that there is a political commitment to improve the blood transfusion safety. Because typically when the war started, we thought that the Ministry of Health will shift its, will change its priority list, will stop activities related to development and the alignment, but in fact, the ministry managed to work in the same directions at the same time, ensuring securing blood supplies during war, and at the same time continuing alignment with the EU and restructuring the blood transfusion system. With this, I come to the end of the presentation. Thank you very much for your time. Thank you.
Дуже дякуємо.
Thank you so much, Mr. Farouk. Dear friends, thank you for your attention. Now we have 20 minutes break, that's coffee break, and we expect you to be back in 20 minutes, especially those who are watching YouTube. Now it's going to be back at 12:15, 12:20. Please stay with us at the MOH YouTube channel. Thank you so much.
From my side.
Okay, you decided to do my job first.
Oh,
Okay.
sorry, no, we
Yeah.
were just chatting
I will
along, and that's
answer
what the
to have,
translator.
Так, у нас третя панельна дискусія.
So this is the third panel discussion, Medical Services, European Integration Achievements and Plans for the Future, and moderator Rainer Steiner, European External Action Service, EU delegation in Ukraine. The floor is yours. Thank you.
So, thank you very much for the introduction. Sorry for cutting your words. You will see the differences in a couple of seconds between her charm and my Germanic approach to moderating, which starts with a big thanks to the organizers, in particular Marina and Olha, for all these late night emails and message exchanges. We are very happy that you could align such a high quality of speakers. And now let's go right over to them. For the speakers, we have a lot of you, so please stick to the allotted time, which is 7 minutes. And I have to replace charm with something more powerful in this respect. I have some signs, so I will show you when the 2 minutes are arriving and when time is up. So, but we start also with an introductory video. So colleagues, can you please launch that video?
Healthcare in Ukraine is vital from birth. Reproductive technologies help families create life. Primary healthcare in Ukraine keeps the whole family healthy. Dental care remains high quality. Advanced surgeries, modern technology, and skilled staff save lives daily. Even during war, healthcare continues. Specialists tirelessly provide help where needed. We are unbreakable. Rehabilitation after injuries is vital for patients and the healthcare system, which recovers despite the damage from war. Ukrainian healthcare works closely with international partners. This teamwork improves medical services locally and globally. Ukrainian healthcare is always here, for everyone, for life.
Thank you very much. And to start the first block of this session, which is about the procurement of medical services in Ukraine, we will look at European integration achievements and plans for the future. And our first speaker is Natalia Husak, who I please ask to come to the floor, to the podium. She's the head of the National Health Service of Ukraine and is thus a very known and public face to all of you, I hope. Let me just remind you that in 2018 and 2019, she served as the regional coordinator for supporting healthcare reform in the Chernivtsi and Ivano-Frankivsk regions under the EU Lead with Europe programs. And as the deputy head of the Chernivtsi Regional State Administration, she oversaw healthcare initiatives and chaired the hospital council. So, nobody's better placed than her to introduce us into the topic. Natalia, please go.
Greetings, everyone. I thought my colleagues would join me here, but I'm sitting here all alone. Thank you, dear René, for this opportunity. I'm glad to be here with you. I completely support all the previous speakers, all dear colleagues, friends, in their words that Euro-integrational processes would be not just some simple processes which need to turn into certain documents. Well, for sure, that's important, but that's also our daily routine activities here and now for many, many years. And to tell you the truth, it's quite easy for me to talk about the Euro-integrational progress in Ukraine because we understand that when we were filling in the first questionnaire together with my colleagues from the National Health Service of Ukraine as we were preparing as the country in 2022 to apply as a future member of EU. In this screening questionnaire, we had an opportunity to mention a lot of progress which was achieved in terms of developing the procurement of medical services system as well as healthcare system in general, the market of the procurement of medical services. This was not something really common in the post-Soviet countries. Today, Olha Stefanishyna mentioned that Euro-integrational processes started in Ukraine after the Revolution of Dignity 2014, and we need to remind it to a lot of us. And I see a lot of partners in the room today, those who already started working on these huge changes which allowed us showing this progress in screening programs. And these great changes were related to the fact that we had the National Health Service of Ukraine established back then, the agency that procures medical services. And actually, thanks to partners, we borrowed all the best which is out there in the experience of our European colleagues as regards the creation of the market of the procurers of medical services and procurements themselves. And it's worth mentioning that on the way to European integration, our country had faced not just challenges of war, but also challenges of pandemics, which actually ended as the full-scale invasion started, and it influenced us as the procuring agency and our partners, providers of medical services. And actually we abandoned the post-Soviet system not long ago when the financing mechanism was based on other indicators and on other notions rather than medical service. But it's worth mentioning that already now, as we started implementing the program of medical guarantees, PMG, we can mention that everything that was being built based on the patient-oriented approach, and as soon as we started working on universal coverage and all the payments are shaped up according to the e-health system, this actually something that the European counterparts of ours have. If to speak about the key principles of procuring medical services in EU countries, we need to mention that they are very simple, and they are related to the fact that we need to ensure, whenever procuring medical services, competitiveness, transparency, and quality-orientedness. If to speak about the competitiveness, let us think back about those times before the healthcare system was transformed. We couldn't even dream about state procuring the medical services from the private institutions. Equal opportunities were granted, and I know that at this panel there will be representatives of private establishments from whom we procure medical services and state-run institutions. And just imagine for a second in what way this common approach helps us changing the system. We already have communal institutions which are really compatible compared to private centers. And also we have private clinics that are providing services free of charge to the citizens of Ukraine because they've signed all the appropriate agreements with the state. For sure, on this slide I would like to tell you that this short path starting from 2021 helped us overcoming all the challenges, and we continue walking this way, and we keep on achieving the results. You remember at the very beginning we were saying that as our European colleagues, as the transformation of healthcare was launched, they were changing the structure of the market of medical services and providers of medical services. Today I showed just the primary medical care, and a lot of speakers were mentioning about the primary medical care, that's the basis, the foundation of medical care, and have a look in what way the structure changed within these 3 years. So the principle of transparency is also ensured by the National Health Service of Ukraine through several elements. So, as our colleagues do in EU, this would be health that was mentioned several times today. We can actually share the best practices with our colleagues. That's monitoring, that's publication of the agreement conditions, clauses, which was something inachievable, was perceived as something inachievable before. And digitalization, for sure, it's important. It's not just about comfort, it's about transparency as well, and it's about the comfort of each and every Ukrainian whenever we are... When we actually become the member of EU, we will be getting services through integration of the medical documents. Then quality-orientedness, for sure. Here we've achieved, for example, procurement of services following certain conditions, qualification of healthcare providers, and feedback from patients. Sometimes I was pleasantly surprised as we were having consultations within the framework of our cluster, in the framework of preparing for the drawing up a report on Euro integrational achievements, when colleagues from the European Commission were highlighting necessity of such things as strengthening the interaction with the clients, welcoming their complaints, getting their feedback. I'm wrapping up. Speaking about working with complaints, well, a lot was done in this regard as well, and we understand why we are doing this, not just for the sake of the not just solely for the process of looking good in the eyes of our colleagues. That's important for us because you've heard repeatedly from the speakers today, integrational processes are important in the first place for us, for every Ukrainian, for us to feel that actually every person gets certain result in the form of high quality, free of charge, accessible medical care. If to speak about plans for the future, for sure it's important to be more sustainable for our partners. That's important for attracting investments from our international partners, which is why we are now using mid-term agreements in the area of medical procurements. We ensure transparency of the use of funds through verification. That's important because our partners are doing so. And we keep on being oriented at monitoring. That's very important as well. And for sure, within the framework of developing the medical services, today my colleagues will share some insights. This would be some new services which previously were not procured by the state, but they are so important that today in every report of our colleagues we heard about them. That's new quality of rehabilitation, that's reproductive technologies, that's focus on mental health. This will all ensure the situation when Ukrainians have got high quality medical services, those which equal to the EU services. Thank you so much. René, I've coped with that, no?
Thank you very much, Natalia. Sorry for being harsh with you, but don't worry. You don't only look good as a system, but the figures show that you are. So can I now ask, please, Alexandra, Oleg, and Sergei to come to the podium and use the time to give another round of applause to Natalia for sharing so much important information in such a short time. Thanks a lot. Now we are going to the second block, which is the potential of Ukrainian healthcare providers in the context of cross-border medicine and entry into the EU's common healthcare market, and in particular taking into account the unique experience of Ukrainian doctors gained during the war. And we will start with Serhiy Chernishuk, who is the medical director of the Okhmad National Specialized Children's Hospital, a function he has held since 2021. His CV includes all the words that no moderator wants to pronounce because he has been a pediatric anesthesiologist with 20 years of work experience. So, Serhiy, The next 7 minutes are all yours. Thank you very much.
Дякую, Рене. Вітаю.
Thank you so much, dear René. Greetings to everyone. Thank you for this opportunity to participate in such an interesting event. So, few figures from me that display what way our hospital was functioning since the moment of the full-scale invasion. Why are these figures important? Because one of the messages of those slides I'm going to show you would be, regardless of these difficult conditions Ukraine is finding itself in, we are not just stopping, but we are moving forward. We are developing because we understand that our citizens require high-quality medical assistance right here and now, which is why you see that in this a bit more than 2 years, through our hospital, more than 500,000 patients, when they got the consultations, more than 25,000 surgical interventions were conducted, 122 cases of military trauma. Unfortunately, that's a new area of expertise we are developing at our children's hospital. And unfortunately, this figure is growing daily because we keep on getting new and new pediatric patients with military trauma. Almost 50,000 hospitalizations or admissions, and among these services we are conducting highly specialized interventions, organ transplants, bone marrow transplantation, and bone marrow transplantation would be one of the areas within which we are the leaders in Ukraine as of now. Apart from keeping on with our work, we introduce new methods because we want to move hand in hand with time. We are heading towards Europe, and for sure, when we officially become part of the European Union, we would like to be a full-fledged partner, the partner with whom it's interesting to cooperate and implement joint projects. Within the recent 2 years, we've introduced such investments as launching reference laboratory of advanced neonatal screening, a very important project for our country. Active use of ECMO program, which is rare for Ukraine among hospitals which do not provide cardiosurgical assistance. Development of telemedicine and robotic telemedicine. We cooperate with Charité Clinic. We discuss overcomplicated cases with them. High-tech neurosurgery surgeries, which became the possibility thanks to the fact that in 2022 there was a full-fledged launch of our new building of Ohmedit, and we procured the state-of-art equipment. Yes, not everyone is mentioned here. Actually, Latvia is supporting us in the process of developing, colleagues from UK, from other countries, and I can tell you that cooperation with Royal Hospital that was mentioned, with Karolinska University Hospital mentioned by Madam Ambassador. Now we have actually interns who are getting their internship there at Karolinska University Hospital. They have an opportunity to ask questions and to develop. That's a powerful support of our hospital. Also, our experts who deal with orphan diseases are involved in ERN project, which enabled us supporting patients who had to relocate in February, March, April 2022, and it was vital to refer them to those centers which could support them and which could ensure the continuous nature of their treatment. Also, multidisciplinary work. Members of our team are associate members of ERN, which allows us getting access to the database, and that's important for our orphan patients. And actually, whenever we have this access to the pan-European database, this helps us boosting the level of our knowledge, developing our competences, and gives us an opportunity to have consultations with our colleagues from the EU on certain complicated cases. And apart from borrowing something from our European colleagues, I believe we can be interesting for our European colleagues as well, because we have a lot to share. I've highlighted 3 key areas. For sure, that's scientific research, because we are one of the biggest pediatric hospitals. I'm wrapping up. And for sure, the number of patients with overcomplicated cases is high, which might be interesting for our partners. Then educational programs. Actually, one expert can see a lot of overcomplicated surgeries in one place, and that's something which is not that easy to find in European clinics, where all the patients are disseminated all around various establishments. And the medical assistance, I would like to highlight 2 key areas. First of all, very important motivational component for our citizens to come back to Ukraine, because they will if we have this high quality medical assistance in the country, and for sure support of our European colleagues as regards certain areas where our competences, where our assistance and our expertise can be interesting for our colleagues, because I believe that actually we can treat patients from European countries in our hospitals. Thank you so much.
Thank you very much. And for me, it's particularly heartening to see that despite all the challenges that made the name of your institution a worldwide household name, you haven't given up hope, and you have the energy to continue. And I hope that the young people in the audience who are at the beginning of their career will have watched very carefully to see that if you want to work with high technology, if you want to work in an environment that allows you to thrive and prosper, they don't have to go abroad. You can find this here just a couple of kilometers from here. So thank you very much again. Now, our next speaker is Oleg Samchuk. He's the General Director of the Lviv Territorial Medical Association, which is a multidisciplinary clinical hospital of intensive care and emergency medical care. He's a urologist and transplant surgeon with 16 years of medical practice. Under his leadership and with his participation, posthumous organ transplants began in Volyn and Lviv. After a long pause, this gave a new impetus to the development of Ukrainian transplantation as a whole. And he performed a kidney transplant as part of one of the most complex operations in the world, a simultaneous pancreas and kidney transplant. Oleg, the floor is yours.
Добрий день, шановні друзі, колеги. Дякую за
Thank you so much, my esteemed colleagues, my dear friends. Thank you for sharing this floor to present on behalf of one of the best Ukrainian clinics, and actually association of clinics, which was developing in the course of the recent 4 years. So now we have a number of facilities forming an association, including St. Bartholomew Clinic, servicing adults, St. Nicholas, which is specializing in pediatric care, and on top of that, number of polyclinical facilities, St. Anna Polyclinic, which is maternity care, and the Unbroken Rehabilitation Center. They used to be a rehabilitation center alone. Now they represent the entire rehabilitation ecosystem, providing rehabilitation care in a comprehensive manner to the survivors of war. So let me provide you with some basic insights, because our clinic has a record set, which is 1.2 million patients over the period of this war. Over 18,000 injured from war have been admitted to our clinic, including servicemen and civilians, adults and children. We do not distinguish between them. We accept everyone to provide them with care. We also performed a number of surgical interventions. The number is 138,000 interventions. Back in 2020, we had only 12 surgical theaters. Now we have over 80. Earlier, we used to have only 12 emergency intensive care patient beds in our resuscitation unit. Now we have more than 120. Prosthetic care, that is an innovation, and you can see the number, which is remarkable enough. And these 400 plus prosthetic devices, these are state-of-the-art devices, sometimes those designed and manufactured abroad, but installed here in Ukraine, based at our St. Bartholomew Clinic. Also, speaking of rehabilitation, we admitted over 6,000 patients to full course of rehab, and over 14,000 patients also were provided with mental health support, including PTSD counseling care, as well as other types of emotional distress and mental health disorders, which are quite prevalent in Ukraine because of the war. Also, our clinic wanted to get a piece of market share in the field of transplantation, which is rather challenging, highly competitive, but ambition is there, and there are more ambitions in Ukraine. And once we started conducting that operation, we decided to go further and broader despite the war. The most of this was another record-setting effort and accomplishment. As of today, we have 406 organs transplanted, including 311 kidneys, 45 livers, 45 hearts, and 3 lungs. Also, unique complex transplantations such as kidney and pentastric and heart-lung transplantations. So we're building new teams, we're building new knowledge, we're developing our experience and work record. And looking at our clinic before the war, our main objective was to stop patients going abroad and instead invite international health tourists to come to Ukraine, instead of Ukrainians going to Poland, to Israel, to European Union countries, including UK and USA. But because of the war, the borders were blocked, and thus we decided that we have to develop internal operations in area of transplantation. Also, when the war broke out, everybody was startled by the rapid development of that situation, and there was no certainty about the future, but now this future has come to many of our operations, and instead of harvesting international experience, we are generating Ukrainian experience that we are happy to share with the rest of the world. And today we have a lot in terms of international capacity building, cooperating with Charité, Harvard, Oxford, Illinois, Munich hospitals, university-based clinics, and many more countries. You can see most of them listed, but this is not the full list of our partners and friends. Annually, we have a special program for capacity building and development of the human capital, covering 400 residents. So these are healthcare professionals who go abroad for learning and then come back. And here, in this slide, we can see only the biggest, I would describe them as global missions, coming to our clinic, sharing their experience free of charge and teaching our clinicians. And this would be part of our mission, which is to share those lessons amongst the rest of the Ukrainian cohort of clinicians, making sure that this is strengthening capacity of the entire health system in Ukraine. Speaking of our plans, we are ambitious enough to establish patient-centered and patient-friendly environment, appreciating that unfortunately the territories in the east continue suffering from the shelling and bombing, and many patients, they do migrate westwards to the western part of Ukraine. And that's why we are establishing the new patient spaces, not by means of recovering the Soviet-style facilities only, but also inviting international investments, and one of such projects would be building such patient accommodation center with 6-story buildings. One of them has been erected recently, and we have also received a big grant, which is 19.5 million euros coming from EU, and that will be invested to make sure that such accommodation centers and the clinics would be fully functional. I believe you remember this picture. This would be the old building occupied by the Unbroken, and that would be the major rehabilitation center providing support to the victims and survivors of war. And 2 more blocks are coming to enhance our patient bed capacity, making sure that we can accommodate a greater number of patients at a time, because our ambition is to become the biggest, the strongest, and the best care and support center for Ukrainian patients. Looking at the waiting list for rehabilitation patients, now we have about 300 patients on the waiting list. I do understand that time is also precious, but let me emphasize another precious development we are undertaking following the receipt of grant which was provided by the Japanese Red Cross Society and GIZ International Development Agency and our friends from Lithuania, who are investing in building another rehabilitation center in the neighborhood of Lviv, if you remember the name, Brukhovichi, because that will be another brand new center equipped with the top-notch technology to service Ukrainian patients. Another important highlight included into our association, also utilizing some donor funding, this would be a real estate piece of property which was donated to our association, and now we received 5 million euros for rehabilitation and reconstruction and refurbishment of that center to provide care to servicemen. 3, maybe 4 months will be required to finalize another project that we are collaboratively implementing, utilizing the grant worth 1.7 million euros. This would be the Center for Helping Victims and Survivors of Torture. Unfortunately, their number is great in Ukraine, and we will have this center working in Lviv, but accepting patients throughout the rest of Ukraine, those who are coming from Russia imprisonment and being subjected to torture. Another 2 million euro project, building the new center for the patients who experience PTSD. Total space will be 1,000 square meters, and by the end of this calendar year it will be functional. Another global project, which is part of our dreams and we are working hard towards its implementation, would be construction of the new surgical block. Design work has been finalized, and I believe by the end of this year, maybe realistically speaking, beginning of the next year, we will start the construction. Another important project together with the eDrive company, and this will be co-investment with Ukrainian funds, and Danish government will be donating another 50% to construct the emergency care department, which will be merging into our facility in the future. So once again, we don't know whether this war ends today, tomorrow, or 1 year from today, but that doesn't stop us from developing and building our capacity to strengthen our resilience, to provide good quality care and rehabilitation to our patients who deserve the best. With that, let me humbly thank you for your kindest attention and invite you to share our efforts to build our healthcare system capacity in favor of Ukrainian patients and the rest of the world who need that.
Thank you also in particular for underlining that international cooperation is not a one-way street, but that you are willing to share the experience that you're gaining in these hard times with partners all around the world so they can be better. And we have colleagues in the audience who work on hospital partnerships, so there is enough for the lunch break to discuss. But for the last speaker of the second block of the session, we turn to Alexandra Mashkevich. She's the Chief Medical Director of the Dobrobut Medical Network. She has experience working in the National Health Service and the Ministry of Health. At the National Health Service, she worked on secondary care reform and facilitated the first contracting with specialized medical service providers in 2020. And at the Ministry of Health, she recently headed the Department of Medical Services, ensuring the continuity of the healthcare system in the country during the war. Please, Alexandra.
Дякую, Рене. Колеги, всіх вітаю.
Thank you so much, dear Renee. Thank you, my dear colleagues. And today I would like to start by saying that I have some difficulties representing the private sector here today, especially being here at the same panel with my colleagues representing municipal, regional and national healthcare operators. But the important thing is that despite the type of ownership, we all work in the shared health space, providing care to all of those who need health services. And today I'd like to focus in my presentation on describing who we are and what do we mean by the network of Dobrobud facilities. We have a network. We have two major hospitals located on two different banks of the Dnieper, both the left and the right banks of river. We have also 15 polyclinical facilities across Kyiv, which have pharmacies on site and have signed respective contracts with the National Health Service and taking part in the national reimbursement schemes. Also, we function 24/7. We're providing routine care as well as urgent care management. Today we have 10 ambulance teams, and before the full-scale invasion we had 23 ambulance teams with respective vehicles, but we as a company decided to donate 13 ambulance vehicles for the benefit of the defense sector. So now, in terms of assets, the number of vehicles is smaller. Nevertheless, our ambulance care service is productive enough to service our patients. Also, we have more than 257 patients, unique patient cases who selected our network, and respectively, we provide them with comprehensive healthcare services. Every year we conduct over 1 million outpatient counseling sessions and examinations with the patients, having the team of 3,000 members of staff, including 1,200 clinicians. Most of them are fluent in English, and thus we can also service international patients coming from other countries. We also cooperate with health insurance companies, also servicing foreigners in Ukraine and beyond. And also I would like to emphasize that another important feature of our operation is business orientation. Because business has to run business, but they should be transparent and fully accountable business, which would serve as a marker for making Ukraine attractive for international investments and investors. If you look at these numbers, I believe they speak for themselves, describing that over the course of the recent 5 years, we totally paid more than 1.5 billion hryvnia of taxes, including over 90 million hryvnia since the start of full-scale aggression. And once you look at the dynamics, the total revenue that we've contributed to the national budget, you can see that only half year 2024 would be almost the same amount as full 2023, which means that business not only functions but develops, and we are growing in terms of quality and numbers. And both of our polyclinical facilities continue servicing both civilians and servicemen. Moreover, both polyclinical facilities located in Irpin and Brovary, even at the time when they were occupied during the Russian incursion, they still were fully operational. And also we are providing not only commercial health services but also free of charge services, including donor support, who covered some of that, but we are also committed to provide care to those citizens, to those patients who require immediate, high quality, sometimes innovative healthcare services, not even being able to afford it in financial. And we are also continuing to support our members of staff who have been conscripted to the active duty. We do not only reserve their positions on the payroll, but we continue remunerating them additionally to the salary they received while being in active duty. Also, we have the Dobrobut Academy, which is kind of a private higher education university in the field of medical sciences, making sure that we can breed and develop the new generation of healthcare professionals and making sure that health education, medical education in general, is upgraded to the highest possible standard, not only in public but also private sector. Looking to our progression, developing together with the state, then back in 2023 we also started a mental health center, which is a totally field of expertise but highly promising, and we have provided over 8,000 counseling sessions to our patients in the field of mental health, and that number is growing. Recently enough, we have managed to pull together a team of 30 counselors in the area of mental health, in full compliance with the respective Ukrainian legislation, which is based on some of the EU directives. Accountability, humanity, and legibility would be our fundamental principles when it comes to both inpatient care, outpatient care, and mobile care services as well. And also another program that we are particularly proud to be part of, because that's an excellent example of public-private partnership, which is having the effective contract with the National Health Service of Ukraine when it comes to reproductive health technologies. And we have already developed 159 cycles. They are at different stage of completeness. Some of them have been completed, but we have quite a substantial number of couples in our success records who managed to give birth to the new generation of Ukrainians with 44.7 success rate in our infertility management programs. Definitely most remembering that gestation term should take full 9 months to see what the ultimate outcomes are, but we hope they will be not only promising but productive as well. So that is to reiterate that private sector health services, medicine, would be equally potent, attractive and transparent and responsible enough. And most importantly, that we can see that the example of our Dobrobut clinic, working in collaboration with the Ministry of Health, Ministry of Finance, Ministry of Social Support, can serve as the success story to be replicated and now used in learning for the most advanced technologies for implementation of the health services into the future, and also serves as the area and platform for collaborative initiatives on top of that.
Alexander, for the impressive figures, but also now with a reference to the last session of the day, showing our young colleagues in the future colleagues in the audience that skills that you acquire in the public sector can be very much used in the private sector and vice versa. Because this is one of the things that we always forget, that there shouldn't be silos, but there is one health sector that needs all hands on board. With this, I would like to ask the audience to give a round of applause for our speakers and ask them to leave the podium, because now we will need the full screen for the last block of this session. And it was already mentioned before, we will speak about the European reference networks as a cross-border mechanism for providing medical care to patients with rare diseases. Our speaker online will be Nicola Larkins, who is the Deputy Head of the Health Monitoring and Cooperation Health Networks Unit in the Directorate General for Health and Food Safety of the European Commission. Nicola joined the Commission in 2019 to work in the Crisis Management and Preparedness in Health Unit. And to speak about transitions, she originally holds a BA in Arabic and Geography and an MA in Public Policy and International Affairs. Nikki, over to you, please.
Thank you very much, and good afternoon, everybody. I hope you see my screen and you can hear me okay?
Yes, all fine.
Perfect. So today I will say a few words about rare diseases and the European reference networks. I will start with providing a broad overview of work on rare diseases, and then I'll zoom into the European reference networks, looking at their legislative framework, their activities that they're doing, the financing, also the evaluation system, and then a few comments on cooperation activities with Ukraine, and a few examples of practical work which is undertaken in the networks. So first of all, this slide serves to highlight the broad range of activities with regards to rare diseases. So it includes research activities, Orphanet and OrphaCoding, the EU platform on rare disease registries, the European Health Data Space, the medical devices legislation, also the pharmaceutical legislation, and then within this we have the 24 European reference networks. So the ERNs are cross-border networks that bring together experts to discuss cases and provide advice on diagnosis and treatment. They now allow knowledge to travel and not the patient. So now if we look at rare diseases and the ERN legislative framework, which packages the ERNs, the Union's legal framework on rare diseases is underpinned by three important elements. The 2008 Commission communication, followed by the 2009 Council recommendation, and then the Directive on Cross-Border Healthcare of 2011. The 2009 Council recommendation proposes several areas for Member State action that you can see on the screen. Then when it comes specifically to the ERN legislative framework, we have, as I mentioned, the 2011 Directive on Cross-Border Healthcare. This is where the creation of the European reference networks comes from. Following this, there are implementing legislation which put for the establishing and evaluating of the ERNs, and also the criteria and conditions to join, and then a follow-up amendment in 2019. So altogether, this provides the legislative framework for rare diseases, and specifically the ERNs. So, the European reference networks. These were set up in 2017. They currently comprise 24 networks with more than 1,619 specialized centers across 382 hospitals in 27 EU countries and Norway. Here, this slide aims to pinpoint some of the main activities that the ERNs work on. So of course, there's coordination and monitoring of the networks. The networks vary in sizes, some with 40 members, some with up to 105 members. They also work on virtual consultations through an IT tool called the Clinical Patient Management System. They also work on rare disease registries with up to date more than 50,000 patients. There are training courses and also clinical practice guidelines. So these are the main activities undertaken within the networks. So the funding then behind these networks is provided by the EU. Very recently, we've finished with the last grants for the 24 networks, covering a period of 4 years with a total budget of just over 77 million. In these grants, we have what we call impact indicators to help measure the work of the ERNs, and also to align the activities that they do, mandatory work packages. So on the coordination, on the clinical patient management system, registry, and so forth, as you can see on the screen. I would also like to highlight with this slide that the ERNs also undertake evaluations. So this is aligned with the legislation on the ERNs, where every 5 years they're evaluated. We recently completed the first evaluation of the networks at the end of last year. So 24 networks were evaluated and 836 members. Overall, the evaluation was very successful, concluding that the ERN ecosystem functions very well. In concrete figures, 100% of the 24 ERNs obtained satisfactory results, 88 of their healthcare providers obtained satisfactory results, and only 4% of the participating healthcare providers saw their membership terminated. So as I mentioned earlier, this after post-evaluation, we now have 1,619 specialized centers in 382 hospitals across the 27 member states and Norway. I also wanted to highlight a few activities of cooperation which are ongoing with regards to the European reference networks and rare diseases in Ukraine. So we have a joint action called Jardin, which focuses on the integration of the ERNs into national healthcare systems and also to ensure their long-term sustainability. There's several different activities which I've highlighted on the slide with you, but also to mention that Ukraine is also participating in this joint action. So the Ukrainian Ministry of Health is an associated partner, which allows it to follow the development of the joint action and also its deliverables. And the Ukrainian Hub for Rare Diseases is also included for capacity building. Alongside the work under the joint action, the ERN grants, which I mentioned earlier, also provided the opportunity for the ERNs to put forward activities for cooperation and support to Ukrainian competent authorities and healthcare units. This could include, for practical examples, translation, educational material, training, as well as also best practice guidelines for patient care. Alongside this, an administrative arrangement was also set up this year that will help facilitate Ukraine healthcare providers to seek advice on Ukraine rare or complex disease patients from the members of the ERNs. And with my last slide, just to give some ideas of some of the practical activities of the ERN, on the left you can see this is from ERN R&D. They've put together what they call patient journeys. So 5 are currently available, 3 more are in development. And the idea is that it's a handout which is given to patients newly diagnosed to show the journey. We also took the opportunity to highlight under the ERN EpiCare, focusing on epilepsies, their work in the Emergency and Crisis Response Task Force, which was set up by the International League Against Epilepsy. With that, thank you very much again for your time, and I will stop sharing my slides. Thank you.
Thank you very much. Can you please have a round of applause for Nicola? Unfortunately, she couldn't be on site today, but if you have any specific question, please turn to me and I'll transmit them to her. So, shukran Niki Ilalika. With this, we are ending, which was hopefully for you a very exciting session. I would like to thank you for your attention, and if there are any follow-up questions, please don't hesitate to address the speakers in the next break. Until then, there is another exciting session up, and I'll hand over to the moderator, this time not sidelining her.
Thank you very much for your great moderation. You did your best to keep up timing. Thank you very much, друзі. Дякуємо. Чудово.
Thank you, dear friends, and thank you to the great moderator, René. Now we proceed to panel 4, transformation of the Ukrainian pharmaceutical sector to the European market. And I invite the moderator of this panel, Yevhenia Pidubna, head of the committee of the Association of Ukrainian Entrepreneurs or Businesses and Healthcare from Pharma Company, Miss Yevhenia. Yes, please take the place of the moderator and now moderate whatever's happening on this scene. Thank you so much. Hello, dear colleagues. Our panel is dedicated to transportation of the pharmaceutical sector and its compliance with the EU regulations. We are going to have 4 presenters. The European speakers will tell us what are the expectations as regards Ukrainian medicines, and also we will speak about critical alliance of the medicines, and then the Ukrainian side we will assess whether the regulatory system is ready for European integration, and we will speak a little bit what pharmaceutical business of Ukraine can give to the EU. Our first speaker is going to join us online. I'm going to switch to English for us to better understand each other.
Will be on pharmaceutical products in the EU, main requirements before integration. And we will be having Dominique de Becker speaking, and she represents Directorate General for Health and Food Safety, European Commission. Dominique has a background in languages, has been working over 20 years for the EU Commission in DG Health and Food Safety as a policy officer for public health in the EU enlargement countries. And since 2018, she has been working in the field of quality of medicinal products. And prominent thing about her is that she contributed a lot to Croatia's preparation to the EU accession in 2013. So, Dominique, are you with us? No? Okay. We will switch to another speaker, and if she is online, we will come back to her. Then I would like to welcome on the stage our other speaker, Borisa Falatar, who is the representative of European Health Emergency Preparedness and Response Authority, European Commission. And we will ask Borisa to tell us a little bit more on how it was created and why actually Ukraine can contribute to it and in what ways. Thank you.
Very well. Just to check if the slides are ready. Yes, thank you. Good afternoon. I realize that I'm standing between you and lunch, so I'll try to be brief. I also will be standing to energize us a little bit after the speakers before me. My name is Boris. It's a great pleasure to be in Kiev. I was lucky enough to live in Kiev for 3 years. And walking today, I remembered the COVID lockdown because I used to walk around the Botanic Gardens a lot. I left Kiev not willingly, just after the full invasion started. So it's really great to see how beautiful, again, the Kiev is, how resilient the people are. And professionally, also, since I'm now in Brussels, to see how ambitious and how much drive Ukrainian authorities and Ukrainian people have to integrate the European Union as soon as possible. So I work at the Health Emergencies Preparedness and Response Authority, which is the newest kid on the block in the EU. We were created 3 years ago as a Directorate General with a very clear mission to keep Europeans safe, to prevent, to detect, and to respond to cross-border health emergencies by looking at one specific thing, medical countermeasures. But while we're focusing only on medical countermeasures, we're looking at the full life cycles of the medical countermeasures. So development, manufacturing, procurement, and distribution. And here you have medical countermeasures. It can be vaccines, therapeutics, diagnostic tests, gloves, masks, etc. So we work closely with EU member states, which are on our main body, the HERA board, where Ukraine also sits as observer. But we also work strongly with industry, with researchers, with civil society, and relevant stakeholders. We have two modes of operation. One is the preparedness mode, which we are currently now in, and the crisis mode, which enters into force whenever there's a public health emergency declared at the European level. So, as I said, preparedness mode looks at identifying threats, prioritizing them, looking at do we have enough adequate medical countermeasures? Do they exist, or do we need to invest into research and development? And we invest almost 4 billion euros into academic research through the Horizon Europe program, where Ukraine is also a participating state, and also in late-stage development of medical countermeasures through the EU for Health program, which again, Ukraine is a participating state. Then we do production capacity for MCMs, where we have reserve capacities. We're investing 160 million euros every year to have ever-warm production capacities, which enables us to produce at scale 325 million vaccines in a year in case of emergencies. And these can be protein-based, mRNA vaccines. Then we do stockpiling we have invested over the past 2 years 1.2 billion euros into rescEU stockpiles, which are distributed all around Europe. They are financed through the Union Civil Protection Mechanism, which again, where Ukraine is a participating state, so Ukraine can also benefit from these stocks. And then we're also investing into knowledge and skills and capacity building workshops for public health officials, where we always invite Ukrainian officials. Whenever there's a crisis mode, it enables us to step up a gear and to coordinate response. We can activate those reserved capacities, etc. I will not go into this more, because last year we were created to face pandemics and CBRN threats and antimicrobial resistance. But last year, the Commission and the whole European Union realized that one of the main threats is the shortage of critical medicines, which takes place throughout the world and which was particularly acute right after COVID. So a year ago, almost a year ago, the European Commission issued a communication on medicine shortages in the EU. And you heard my colleagues speak about communications, etc. This is basically the policy document which the Commission issues and which often leads into a legal document. So the communication identified the EU as a global leader in pharma production, which contributes heavily to our GDP. Pharma sector employs 800,000 people in European Union. We specialize in R&D, research and development, and in innovative medicines that require skilled workforce, high-tech infrastructure, sophisticated processes. At the same time, over the past 20, 30 years, we've seen a change into a pharma landscape in Europe, with generic producers of generic medicines moving out of European Union. And yet, at the same time, at the EU, 70% of medicines which are distributed are generics, which are produced outside of the EU. And this creates supply chain vulnerabilities. Because of inadequate planning and coupled with demand spikes, it can lead to a shortage of medicines. And particularly when they're produced far away, the time that it takes for a signal, demand signal to go all the way across the world to a producer and then to come back, it creates shortages. We have low prices, which are negotiated because governments want to, maintain the low prices of medicines, which means that it's not profitable for certain producers, which means that they stop production and leave the European Union. We have parallel imports, we have quality and manufacturing, which is often a problem when you have one or two producers. And then we have dependence on third countries and low number of producers. As a consequence, in the European Union, pharmacies at the EU, in the EU, spend on average 10 hours per week managing shortages. We have 69% of generics consumed in Europe, which have fewer than two, so two or one supplier only. And you can imagine the supply chain vulnerabilities linked to that. We have 26%, so a quarter of generics which were produced a decade ago are no longer, have disappeared from EU. And in general, withdrawals far outpace the launches of new generics over the past decade. So as a consequence, what the communication recommended is short-term measures, having a voluntary solidarity mechanism so that EU member states can exchange medicines when necessary, deploying rescue stockpiles, which I've talked about, of antibiotics, having a European Union list of critical medicines, which was done last year, forecasting supply and demand, etc. For medium and longer term measures, they have suggested the creation of Critical Medicines Alliance, which I will talk about, and also the Critical Medicines Act, which would be a new legislation, as well as strategic partnerships with non-EU countries. So let me talk briefly about the Critical Medicines Alliance. It's a body which was created to formulate and develop recommendations for industrial policy, coordinated among various stakeholders, industry, member states, civil society organizations. It will focus on a limited number of critical medicines which were identified in the Union list of critical medicines, and we would perform a vulnerability analysis linked to these medicines. So this is what the current composition of the alliance looks like. As you can see, we have both private sector, international organizations, but also national public bodies, both from health sector and also from industry. Many member states have members from both, Ministry of Health and then Ministry of Development or Ministry of Industry. We have both EU-based members and also non-EU based. Ukraine is well represented. We have a Ministry of Health, which sits on the alliance. So one of these ones is the Ministry of Health of Ukraine. And we also have 6 pharma companies from Ukraine, which are non-EU based, which are in the alliance. The alliance has a steering board, several working groups of particular importance to us and to me, because I'm involved into the second working group, which looks at the international dimension of solving critical medicine shortages, how we can diversify supply chains, how we can develop international partnerships with strategic partners. The first working group looks at EU manufacturing capacity, how we can reshore and invest into strengthening EU capacity. Let me also discuss the Critical Medicines Act, which was, if you remember, I mentioned it was first introduced in the communication. It has been now introduced as a priority of President von der Leyen and the new College of Commissioners, who have specifically in their mission letter that they would introduce a new Critical Medicines Act to address the severe shortages of medicines and medical devices. The act would look into identifying cases of over-reliance of supply on a single third country, and in some cases, on average, 60% of APIs are coming from one single country in the world. For many critical medicines, it's more than 80%, sometimes 90% of APIs come from a single country. It would also identify causes of over-reliance of supply on only one manufacturer. So it's even worse. You have one company that produces that you depend on. It would identify structural market failures to supply a given member state. And this would be on a continuous basis through a critical medicines board. So it wouldn't be just a one-off case, but it would be continually assessed. Once the vulnerability is identified, it would then look into both demand side and supply side to act on both national, EU, and international level. For us, it's for the time being, it's quite interesting, the international level, looking at the supply, where partnerships with like-minded countries, mainly the countries who are facing similar problems that are at a similar level of development, such as the US, Canada, Japan, Korea, etc. But also partnerships with non-EU countries who have manufacturing capacities and that could help the European Union ensure the diversification of supply. And we're looking particularly at candidate countries such as Ukraine, Moldova, and the Western Balkans. So Critical Medicines Act would be an enabling framework which would support both member states, but also companies, and also which would help with the strategic investment with EU support. Now, where does Ukraine come from? As you've heard this morning from our outgoing commissioner, the European Union has made a firm commitment to support Ukraine in every single aspect for as long as it takes. So Ukraine is our priority partner. We talk with the health attaché very often, more often than any other member states. We have a very strong and close relationship. Ukraine sits on the HERA board. Vice Minister Ihor Kuzin is our member. We have regular meetings with other senior leadership at the Ministry of Health. Ukraine is a participating state of EU for Health, Horizon Europe, and UCPM, which are the three main programs which are funding HERA in the first 6 years. And it's also a member of the Critical Medicines Alliance, as I said. Now, looking at the manufacturing capacities, Ukraine is also very, very interesting partner because it's from among the accession countries, it is one with a relatively advanced pharma industry. There is 113 domestic manufacturers who are producing a volume of around 1.4 billion and are particularly strong in generic medicines, where Europe is no longer quite strong and yet is a big producer. So the Working Group 2 of the Critical Medicines Alliance is now looking into identifying priority partners and of course is looking at Ukraine with a particular interest. We're also today, actually, it's a coincidental, but today we're launching a mapping study, which will be a 6-month-long study mapping the pharmaceutical production capacities in Ukraine and the Western Balkans, but in Ukraine, looking at not only what resources Ukraine has, what manufacturing capacities they have, what they're producing, but also what you could be producing with the right investment. So what are the possibilities of diversification? What are the logistical steps that could be addressed? What are the regulatory aspects that could be addressed? So the study is launching today. It will go for about 6 months, and it will feed then into the proposals and recommendations that the Critical Medicines Alliance will give to the member states and to the European Commission. In all, it's a strong partnerships, and you're one of the working with Ukraine has been personal and professionally very rewarding, and we are looking forward to continuing the strong cooperation. Thank you very much.
Divaris, thank you very much for such a deep dive in what is going on in Europe. So actually, it's not only Ukraine who is going through transformation. There is a kind of transformation in the European Union in terms of approaches and fighting vulnerabilities of the system revealed by the pandemics. And Ukraine is happy to be, we are already enrolled, but we will be happy to perform the roles, and our last section will be devoted to what we actually can offer. And it was really nice to be called the relatively advanced industry, called by the European Commission representative. It sounds good to us. Thank you. And we can go back to Dominique De Becker. She's online. I remind you that Dominique is the representative of Directorate General for Health and Food Safety, European Commission, and she will be talking about pharmaceutical products in the EU, which are the main requirements before integration. Dominique, the floor is yours. Thank you.
Thank you very much. Sorry, I had some technical issues earlier, so glad to be here with you. So let's start with my presentation, in which I will provide you, I hope you see it on screen, Yes, thank you very much. I provide you information on the main requirements for EU integration for Ukraine as concerns the domain of pharmaceutical products, and I highlight the EU Commission support to Ukraine to prepare for this integration. The focus in my presentation lies on medicinal products for human use, and I would like to refer to the earlier explanatory meeting that took place in April this year, where a presentation was made on the complete EU pharmaceutical acquis, consisting of the medicinal products for human use, medical devices, and veterinary products. For all these domains, the same principles apply. The EU enlargement policy stipulates that the condition for membership to ensure that new members are admitted only when they are fully able to take on the obligations of EU membership. And this includes, of course, compliance with all the EU standards and rules. And since Ukraine became a candidate country in June 23, preparations for EU integration have started. To accomplish this, DG NEAR has divided the different responsibilities, the different areas of the acquis into the different DGs areas. So for us, we'll be focusing on public health and food safety. Public health is our chapter 28, and chapter 1 basically is focusing on free movement of goods, and only the transparency directive on pricing and reimbursement is part of that chapter. The EU integration process is a very intense process. It runs over several years, and it's based on the following key steps, basically. The first requirement is the full alignment with the EU acquis, which is basically a huge job to accomplish. After that has well advanced, then the implementation of the EU acquis can start, and that is only possible when the building and the strengthening of administrative capacity to implement the acquis is taking place. So all these need to be managed, all the regulatory aspects need to be managed via sustainable pharmaceutical supervision system based on adequate financial and human resources, and I'll come back to that in a later slide. I think we're a bit too advanced. Maybe we can go back a bit to the previous slide. Sorry, I'm not managing this myself. Okay, otherwise I'll just speak like this. I had a slide on the EU acquis for medicinal products, in which it stipulates that EU legal framework for human medicines sets standards to ensure high level of public health protection and quality, safety, and efficacy of authorized medicines. It also promotes the functioning of the internal market, free movement of medicinal goods within the EU, and measures to encourage innovation. Now, what's included in the Pharma acquis? There's the medicinal products for human use, there's the same for veterinary use, and there's the medical devices legislation. On the other hand, the EU pharma legislation does not regulate price and reimbursement of medicines. These remain national competences, and according to the treaty, member states are responsible for the organization and delivery of healthcare services and medical care. EU candidate countries are required to align with the Directive 89/105 EC, the so-called Transparency Directive, that contains all the measures regulating the prices and reimbursement of medicinal products. It requires that the member states have objective and verifiable criteria in place on which the pricing and reimbursement decisions are placed. Then I switch to the legislative proposal. Thank you for that. This is the right slide. Just a brief snapshot Yes, thank you. Just a brief snapshot in to show you what the Commission is currently working on. On 26th of April 2003, so basically last year, we adopted a proposal for a new directive, a new regulation to revise and replace the existing general pharmaceutical legislation. It contains a proposal for a new directive and a new regulation that replaces some of the existing general pharmaceutical legislation, but however, it will take time before it will get adopted. So the current acquis still applies. For the moment, there are council discussions ongoing and we have no foreseen adoption date. The revision, aims to achieve the following objectives, basically. Make sure that patients across the EU have timely and equitable access to safe, effective and affordable medicines. To enhance the security of supply and ensure that medicines are available to patients regardless where they live in the EU, continue an attractive and innovation-friendly environment for research, development and production of medicines in Europe, make medicines more environmentally sustainable, and address, as we heard in an earlier presentation, antimicrobial resistance and the presence of pharmaceuticals in the environment through a One Health approach. Then I'd like to turn to the next slide, please, where we speak about the alignment, the different steps in the EU accession process. They are managed by DG NEAR. Basically where we stand right now for Ukraine is that the explanatory screening meeting on chapter 28 and chapter 1 were already organized around April this year. Then I think we had a written exchange of replies to Ukraine's questions. We'll have furthermore a technical exchange on specific areas of the EU acquis that will be scheduled on the 22nd of October. And like this, I think the process that we are looking at is to continue alignment with the EU pharmaceutical acquis. So whenever, and Ukraine is very much in the driving seat here. I know that you're working on plenty of legislative acts to harmonize with the EU acquis. And we would like to suggest to you, once the legislative texts are considered aligned with the acquis and before adoption by Parliament, to share this draft to us. And to also feed us back an update of the tables of correspondence. But we very much like to recommend you to only do that whenever you think, the alignment is more or less complete. We will provide you feedback on the state of alignment, partial alignment or full alignment, and then you can proceed with the adopting process of the legal acts. The next step that's planned for early next year is the bilateral screening. I think it would be taking place around February 25, organized by DG NEAR. And we will be looking forward to hear in how far you are currently meeting the EU acquis requirements, and to hear about your plans for any future reforms. Then I'd like to maybe it's good to also look into the future. Very much future, I would say, that usually for any candidate country, we also plan a fact-finding mission in the country to really issue our recommendation on where to improve the system. This can be kind of compared to the usual audit system that exists for EU member states as well. So every 5 years, we tend to look at how their system is doing and to also make any recommendations for improvements. After the bilateral screening, I think DG NEAR will also start at a certain point in time to draft the screening report. So that's also something to look forward to. And then the next slide, please. We look into the implementation of the EU pharmaceutical acquis. Of course, to be able to implement the acquis, you would need to establish an adequate administrative and institutional capacity, and to strengthen, therefore, the capacity in the relevant administrations and institutions. An adequate number of experts is needed that are knowledgeable or trained specifically about the implementation of the pharma acquis. And of course, based on a harmonized national legislation. Training is a key element to reach this goal. I mean, what we have provided to Ukraine so far is that Ukraine experts have been invited to trainings organized by the European Medicines Agency for EU enlargement countries. There was earlier this year a specific training on Annex 1 guideline on sterile products. And there will be one, I think, at the end of this week at the European Medicines Agency, a training on antimicrobial resistance in the framework of the veterinary medicinal products. Furthermore, there's the EUNTC, the so-called EU Network Training Center for EU medicines national competent authorities. That could be access to a certain degree. I think our colleagues are working to explore to further open it up. And also there's a possibility, since we closely cooperate with PICS, the Pharmaceutical Inspection Cooperation Scheme for trainings, and Ukraine is a member since 2011, to also take advantage of the trainings that are offered there, and they mostly focus on GMP standards and quality systems of inspectorates. Furthermore, we could recommend, and as we have seen in earlier presentations, cooperation with other EU authorities is key. So expert study visits to other EU medicines authorities to learn to implement the EU acquis is very much favored by us, I would say. It's also like an easy communication, peers to peers, and a great source of knowledge to help forward or progress the implementation. And then finally, I think there's also the participation in the EU Health Programme, which was also mentioned before. For us specifically, I would like to refer to IncreaseNet. And in the scope of the substances of human origin acquis, to the GRACE project. EU experts are also participating as an observer in the GMDP Inspector Working Group that is taking place 4 times a year at the European Medicines Agency. Then I would recommend, since not all experts can participate, especially in face-to-face meetings, that an effort is made basically to the multiplication of acquired knowledge and experience by the participants in EU meetings. It will greatly help to harmonize, having the same affinity with the EU pharma acquis, and to also gain experience as respect to implementation, I would say. Then this is the right slide. EU support for public health reforms. We very much support the twinning project that Ukraine is preparing for, and that focuses on the establishment of a single regulatory body to implement the national medicinal products policy based on the pharma acquis, and to create thus a sustainable pharmaceutical supervision system. including, that's at least the twinning project draft I've read, that would include supervision for substances of human origin as well, which is very great. In this context, we can only emphasize the importance of I know that you have already started exploring cooperation with other member states, either one or a consortium of member states. So I think this is really the way forward. They will guide you and support you, throughout the process and share their personal or national experience with you. And of course, the objective is to have a sustainable pharmaceutical supervision system that focuses on alignment with the EU acquis, to establish the state control authority, and to also focus on the training of the workforce, and furthermore to also look into the benchmarking exercise as a competent authority. In that respect, I think it's important to know that the European Medicines Regulatory Network, which is composed of the European Commission, the European Medicines Agency, and the medicines regulatory authorities of 30 countries, EU plus EEA, they're really recognized as WHO listed authorities. So that means that they're fulfilling the highest level of regulatory standards and practices for quality, safety, and efficacy of medicines and vaccines.
Dominique, I really hate myself right now, but I have to tell you that we are a little bit limited in time, and if you can finalize, it would be great.
Only. Yes, okay. Thank you so much. I understand. So I would like to say that, the EU is here to support you as a candidate countries with training, the twinning, and the implementation. Just mentioning the fact that we will track progress, or basically our colleagues from DG NEAR will, through the annual meetings, subcommittee meetings, and that feeds into the annual enlargement packages. And then I think, what more did I want to say? I think all these efforts, basically, they will greatly contribute to advancing the progress of Ukraine with all the EU requirements as a candidate country. And I would really like to wish you good luck with all the challenges ahead. And be sure, the EU authorities, other international partners are there to support you. Thank you.
Dominique, thank you so much for these insights and for outlining the major aspects. We know there is still a huge path ahead, but we are moving, and this is something that we will have our next discussion about. Переключаємося на українську мову, будемо трохи прискорювати.
With that, I'm afraid we'll have to speed up our proceedings, having two more sessions ahead. Now inviting our next panelists to discuss regulatory policies. And with that, I'm happy to invite Marina Slobodnichenko, Deputy Minister of Health in Affairs of European Integration, Asino Company Anna Sarkaleta, and Suram Arterium Ltd representative. Good afternoon, my dear colleagues. Madam Marina, please be invited to take the floor now. Our colleagues from the European Commission have outlined our objectives and the field for deployment, so can please elaborate on that in greater detail. Thank you, Evgenia. But my elaboration will be concise in details, because all those insights provided by the European Commission colleagues are highly valuable and even precious to all of us, especially those who are involved in pharma sector, clearly understanding how scrupulous is the European Union scrutinizing everything that we have and do in this area. And in order to strengthen our regulatory policy, namely in field of regulations of the pharma sector, we're also taking an active stance in that respect, making sure that we can deliver on those expectations that European Union has. And thus, having studied the pharma regulation concept and consolidated key, we also developed our Ukrainian vision in that respect, starting with implementation of harmonized legislation, reform of pharma sector, which has been initiated already in Ukraine, and establishment of the respective regulatory authority. Very big focus on local manufacturing of products to strengthen Ukrainian economy here in real time. I also can't fail to explain why we're conducting such reforms, making sure the drugs are accessible to the patients. And looking into antimicrobial resistance, we also have a place for that as part of our vision, because that is one of the markers of success. Clinical trials. We didn't mention that today, but development of clinical trials as a sector is critically important, not necessarily limiting that to the pharma sector only, but remembering that this is a very broad field which should be involving international companies, making sure that the number and extent of clinical trials grows in Ukraine, since we have an extensive clinical base to do so. Digital integration with different EU countries. Also, here we have advanced significantly, and I will dwell on that in greater detail, and accessing European markets. Thank you, Borisa, for describing this ambition to do the mapping of Ukrainian space, which should become a very potent and powerful element, and also a reliable element of support to supply Ukraine manufactured products to EU market. But now let's see what we have done so far. As of today, members of Ukrainian Parliament have emphasized how important was the respective development and endorsement of respective legislation. Hope that will come soon enough. We also implemented the regulation on cosmetics. We also prepared the respective baseline legislation and executive on decrees of the Cabinet of Ministers for medical commodities. We also developed the partnership project with ECTD. Soon it will be made compulsory, but first we'll be launching a pilot. Of course, we have the GMPs as well as JDPs functional in Ukraine. That's not an innovation. We're just trying to keep up the pace of European counterparts. Labeling and branding requirements have been updated in Ukraine, making sure that we can be synchronized with the similar systems functioning in the European Union. And also Ukraine has electronic prescription mechanism, and Ukraine is one of the rare examples even in European space, because some of EU countries still don't have that advancement. Speaking of our reform, when it comes establishment of a stringent regulatory authority, Dominic and previous speakers also referred to the twinning projects regarding establishment of such authority in our country, and indeed, step by step, we are coming closer to that being accomplished with support from EU as well as support from other EU member states. And just a couple of comments regarding the respective reform. As of today, regulatory system in the pharma sector of Ukraine is combining three elements: Ministry of Health of Ukraine, State Expert Center, and State Service for Medicines. So we would like to bring them to one authority in order to establish that as a fully competent and potent authority, which will be taking over some of the competencies and functions from the ministry, making sure that accessing the market will be sustained respectively, while the State Expert Center will be looking to health technologies and the entire functionality of the Ukrainian Medicines Agency will be under the umbrella of this new authority. And this would be the roadmap, the timeline, I would describe it, describing what will happen here and there. Maybe I'm casting some shadow on these numbers, so let's take a closer look here. In January 2025, voluntary ECTD will be launched to make it compulsory by August 2025. Also, time between 2024 and 25 will be sustained to finalize all of the respective regulations, and in 2026 we believe the twinning project will evolve eventually with some spring initiatives springing out this year today, inviting different EU member states, different experts and expert communities to collaborate on that, and also taking advantage of this time available to strengthen our systems. Later in January 2028, our plan is to finalize verification of medicines to decoding will be enforced. So as you can see, ambition is there, but accomplishing that ambition would be impossible without your support, without support of our partners, and thus merging our capacities and efforts and ambitions will be productive. So thank you, dear European partners and international partners as well, for standing with us. Thank you, dear Marina, for being so concise, but making sure there is a lot of content in your presentation. And with that, I'm happy to hand over to Alla Sarkoletova, PhD in medical sciences and expert in pharmacovigilance in Ukraine, and also representing a pharmaceutical company which is represented in 60 countries with the entire globe. Headquartered in Zurich, Switzerland, but also you have a manufacturing plant in Kiev as well as the regional office covering 12 different countries in the region. So, dear Madam Alla, you are well familiar with performance in European market. So what would be specific about the Ukrainian market performance? Are there any gaps, or are we covering and bridging them? Warmest greetings to the esteemed audience and the panel of speakers. I'm happy to be part of your team, and thank you, dear moderator. And today, here, I really have a dilemma. Should I be speaking on behalf of an international company or a local manufacturer? Because I've seen a company in Ukraine with its history starting here back in 2015, when a Swiss company came to Ukraine via acquisition of a local national manufacturer, which was the PharmaStart Ukraine. This manufacturing plant, it's full manufacturing processes for solid medicines. And starting with 2019, I heard a lot reference to different transformation processes, so I'll have to use that term because transformation in our understanding means the ongoing process of improvements and development, because our company ever since has been developing in Ukraine as well by means of further investments into Ukrainian manufacturing capacity, because the PharmaStart was one of the leaders of Ukrainian pharma manufacturing, and we are manufacturing generic medicines used in care of such diseases as mental health, cardiovascular diseases, gastroenterology, and other areas as well. And thus, European integration as a policy in our company has been initiated back in 2015, and we have invested a lot, and not only in terms of funding, but also making sure that all those improvements, transformational by nature, they were validated by the European GMP certificate, which was awarded to our manufacturing plant in 2019. Also, many speakers mentioned about the importance of quality. Quality, in our understanding, is not quality of medicines, but also the quality of processes, and designing the quality of culture in a pharma manufacturing process. I believe this is not a secret to anyone when I suggest that pharma sector is one of the most heavily regulated sectors of economy or business, and thus managing our business in full compliance with European standards is not only the way to transformation, but that's our lifestyle, corporate lifestyle. And today, I've seen in the slide number of acronyms such as standing for international regulations and guides, which are being implemented or have been implemented in Ukraine. And for us, this is the current day reality, because our manufacturing site in Ukraine is working in full compliance with those standards, including GMP certification. Also, once I mentioned that, despite the fact that today we are in the middle of full-scale war, but in July this year we had a recertification exercise done, and we are looking forward to have our extension of certificate from the European Regulatory Authority. So quality is part of our lifestyle and part of our life. But at the same time, we have to make sure that most innovative, cutting-edge technologies and techniques are requiring some people to use them in order to have implemented in action and practice. With that, I'd like to emphasize that starting with 2016, that would be the confidence-building exercise, our Swiss office made a very challenging decision, which is to delegate some of the fundamental functions in the field of regulations, oversight, and drug safety monitoring, and also transferring some of the manufacturing processes to Ukrainian side, speaking of localization again. So that is something that our Swiss partners were bold enough to do. And thus, starting with 2017, we have a functional center which provides some oversight, supervision, and regulatory supervision as well, filing the dossiers and the registration materials here in Ukraine. But all these documents are developed for submission to those markets where other branches of our company are located, and that number includes 60 countries globally. So this is about confidence, recognition of our expertise, and our academic capacity, because we have our own research and development laboratory. We are not only manufacturing, we are developing the new drugs as well. Again, remembering the full manufacturing cycle. But speaking in the context of European integration, I'd like to emphasize that this pathway is quite complicated if you look at regulation alone. But this is the area where dialogue is helpful. For example, we have three key partners to cooperate: Ministry of Health, the Ukrainian Medicines Agency, and the State Expert Center. And we have constant dialogue with them. And this is critically important, remembering that all of those experts who are involved in manufacturing sites and processes, they are bearing precious experience, which is particularly useful when seeking further improvement. And thus we are strongly committed to the dialogue, to sustaining the quality, not only quality of products, but also quality of processes, and also making sure that all these standards that were mentioned here today and those that we have in action would also be part of our lifestyle. Thank you so much, dear Madam Allo. Now, next speaker will be Serhiy Sur, Arterium Ltd. Director, and he has very interesting kind of experience because of his early involvement and exposure to regulatory authorities, following which he advanced his career to the Arterium Ltd. Company, which is one of the leaders in the Ukrainian market, and I believe that could be interesting also for our European markets. That would be the leader in manufacturing distribution of antimicrobials, which, as I can understand, are quite short in terms of supplying the European market. My question to you, dear Sergey, what would be your vision and understanding of this transformation? Where are we standing as compared to Europe? is there a border between us? Thank you so much, dear Evgenia. Happy to see all of you, my esteemed colleagues. Let me start with my first talking point, reinforcing how close we get between Ukraine and Europe, because over 60% of Ukrainian manufactured products are packaged and labeled locally. In terms of financial value, that would be about 40%, so 60% would be the gross production. So this would be kind of a damping stock, buffer stock, which helps Ukraine when it comes to epidemics, to the war, to have the respective stockpile capacity to provide Ukrainian population with the products they need. Another important factor is that we have very constructive cooperation with our policymakers, regulators, Ministry of Health, and we do benefit from having a very strong but clearly articulated political will, which is also reinforced by the Ukrainian government, clearly striving towards European integration, which is fully in line with the willingness and preferences of Ukrainian pharma manufactured. And this is another area where we benefit from productive dialogue and fruitful cooperation. Thirdly, back in 2022, the new law on medicines was approved in Ukraine, which has a number of highly productive norms which taking us closer to the European regulatory standards and norms. The problem, although, being that in 2022 some of those norms were listed with particular deadlines for implementation, including the ECTD, which would be August 2025, as Madam Marina was suggesting, 2D coding and first exposure would be 2028 respectively. But majority of these norms would be endorsed in 30 months following the end of the martial law, which means that as of today we cannot forecast when that date will come, and this is critically important for our legislation developers, just like Madam Stefanishina emphasized in our opening session, to make sure that we have specific deadlines indicated to keep us moving forward.
And the most important regulation of the new law would be creation of or establishment of a new regulatory authority, which was mentioned by Ms. Marina, and I believe this is the key topic which will allow us moving forward in terms of implementing all the mentioned topics, areas, and work with the support of the EU. Ms. Dominik mentioned at the previous session. I believe now it's very important to make a decision as regards establishment of this body, appoint a head of this very body, and actually have a project manager who would be dealing with the development of all the regulations and the agenda of interacting with the European partners. And if it's not done, then we will lose time and we will lose the tempo and the optimistic forecasts of our government, of Verkhovna Rada, that up to 2030 we must be ready for accession into the European Union. Maybe this deadline will be postponed, or maybe we will be in a rush in 2027, 2030, but that will lead to possible mistakes. So I would like to express my gratitude to all those present for all the activities on European integration. Let me mention that Ukrainian pharmaceutical industry is an ally of all the stakeholders, and I hope that our cooperation is going to be a success. Thank you. Mr. Serhiy, thank you for your expert opinion. Thank you so much, dear representatives of this part of the panel. A round of applause. Thank you so much. We still have the final part where we would like to show you, to tell you what Ukrainian pharmaceutical industry can give, the Critical Alliance and the Alliance of Critical Medicines, as well as become possibly a member of the supply chain in the EU. And I would like to invite our three final speakers Last but not least, Mr. Mykola Fedько, Pharmachim, Serhiy Onyshchenko, member of the supervisory board, Darnica Pharmaceutical Company, and Taras Savchuk, Biopharma Plasma export director. This part of the panel is dedicated to potential of the Ukrainian pharmaceutical industry in the EU market, strategic autonomy. But before we start, please let us have a look at this 2-minute video we've shot with our colleagues, because it's always better to see once rather than to hear twice. If we have such a technical opportunity, let's watch it.
Evolving through crisis, constantly transforming and strengthening the healthcare system. State-of-the-art production sites, advanced research and development laboratories, and thousands of highly qualified professionals work to ensure access to quality medicines, new methods for effective patient treatment. Modern medicines are produced in all therapeutic groups, covering a wide range of forms such as tablets, capsules, ointments, suppositories, and injectables. This diversity strengthens the global competitiveness of Ukrainian pharmaceutical industry. Key pharmaceutical manufacturers in Ukraine release to the market around 20 new products per year on average each. Ukraine is focused on the production of quality generic and biosimilar medicines, including narcotic drugs, painkillers, anesthetics, as well as blood and plasma-based medications. Manufacturing is carried out in accordance with the EU GMP standards. Pharmaceutical industry is one of Ukraine's largest investors in research and development. It is expanding into new markets, forging partnerships with international research institutions, and constantly raising its standards of work. Its expertise in contract manufacturing and technology transfer from international pharmaceutical companies reflects the readiness to meet global demands. 5 Ukrainian manufacturers have already joined the EU Critical Medicines Alliance. Ukrainian pharmaceutical industry is ready to integrate into the EU supply chains to contribute to the resilient healthcare system in Europe, offering productions of generic drugs and APIs, localization and technology transfer, contract manufacturing, joint research and development across Ukraine, Central and Eastern Europe, Caucasus, Central Asia, and the MENA region. We are committed to building a healthier future for Ukraine and Europe.
Thank you so much. So, what Ukrainian pharmaceutical industry can give to the EU? In what way it can strengthen the supply chain? Let us start with the very beginning. That's production of active ingredients. Mykola Fedьko, Director General, Pharmachim Company. Pharmachim is the biggest manufacturer of API in Ukraine, from intermediaries to active pharmaceutical ingredients and in bulk products. Mr. Mykola is involved in supply of the raw materials. Thank you so much, Mr. Mykola. Yes, so the opportunity of producing the medicines and their quality depends on the presence of active pharmaceutical ingredients, API, and this would be the active substances which are part of the medicines. So we can see there are certain problems with APIs in the EU, and the key problem would be great dependence of the European producers from the manufacturers and suppliers of APIs from China and India. And as it was mentioned, I have the same figures, like 60% of APIs used in the EU would be from Asia, of Asia origin. Also, I have this example. The previous week there was a CPHI exhibition, annual one, and the participants of the exhibition, which offered intermediaries APIs, there were 1,117 from 33 countries, but 52% were companies from China, 21% from India, from Europe just 15.5%. Meaning 73% of companies that offer APIs and intermediates would be the companies from China and India. This situation was witnessed for extensive period of time because outsourcing of API production was taking place for extensive period of time, and this led to dependence on these regions. And also we see an increase in the interruptions in supply chain. Now reshoring is offered. That's bringing back pharmaceutical production, including the manufacturing of API, back to Europe. Our company joined the Critical Alliance, and Alliance clearly identifies the problem with the APIs. We've analyzed the list of the critically important medicines of Europe of 2023 in order to assess whether we can produce these APIs in Ukraine. So actively the list contains 249 active ingredients, something like 40 other products of chemical synthesis. They are produced in China and India, and at a limited number of companies. Synthesis of this substances is also possible in Ukraine. Farmhim company I represent is the greatest producer of APIs in Ukraine, and our processes, as Evgenia mentioned, would be multi-tiered chemical synthesis. We've got 2 sites where we produce intermediates, and separately the production, the manufacturing of APIs is licensed according to GMP. We have more than 120 reagents of chemical synthesis, and the manufacturing up to 200 tons of the finished pharmaceutical products, and we are exporting to many countries. So we can claim that we can produce all the substances for the production of critical medicines for the EU. Also, we have experience when at the beginning of the Russian aggression, our company speedily, rapidly started manufacturing certain substances which were procured from Russia before the full-scale invasion. That's 12 substances, out of which 80 trademarks are being produced. And speaking about intermediates, I would like to mention that they are used to produce active pharmaceutical ingredients, and they are produced at the chemical and factories, and then don't require very strict regulation. Usually they are Chinese origin. Even India, which is introducing APIs, is procuring the intermediates from China as well. In Ukraine, the chemical industry was historically developed. We have a lot of chemical enterprises, and our company, our pharmaceutical enterprise, was also created on the basis of the chemical reagents factory. And a lot of these factories have got good sites, good engineering potential. They have great practices of waste management, and they have opportunity to produce a lot in the regions. We have good experts. We have training institutions in order to train people. And I believe all these factors can enable Ukrainian enterprises becoming quite close, transparent, and reliable source of supplies of active pharmaceutical ingredients to European Union. Thank you. Thank you so much, Mr. Mykola. This is really of vital nature. I see Mr. Boris was putting something down. That's important for us, right? That was our goal. So now we will proceed to finished medical products. Serhiy Onyshchenko, representing Darnica Pharmaceutical Company, which was created in 1930. It represents 180 brands. Focused on pain management, cardiological diseases, and leader of pharma market in terms of producing packaged medicines. Thank you for this great advertisement. Let me add a few more words before we go to lunch. I have a big speech, but I'm going to shorten it a little bit. So today we had several references from the speakers when the euro integration started. Somebody was thinking back about benchmarking researches in 2016. Somebody was thinking back to the times of the Revolution of Dignity at 2013, 2014. But for those producing finished pharma products, the euro integration started 20 years ago. The first GMP certificate was obtained by my company in 2003, and Pharmak obtained it in 2005. And actually, we started adhering to the standards back then, because this is something vital in order to ensure our customers with affordable, high-quality medicines. Since then, the leaders of Ukrainian pharma invested and keep on investing significant amounts of money. And this is not just in equipment, but in technologies as well. You know, equipment and technologies would be something serious. This is not procuring from AliExpress, right? This would be serious providers of high-tech, innovative pieces of equipment from Italy, Switzerland, Germany, and we do that. And on an annual basis, our capital expenditures are quite high, but that's not a secret, right? So, also, I'm thinking back, you know, when you say innovations. Recently, my kids watched this video on YouTube in what way this robot would be doing something on Amazon, delivering all these boxes, and they were like, oh, that's so cool, that's so nice. I watched it on the internet when Amazon introduced their robotized line. It was in 2011, but Darnica did it in 2008. We were ahead of Amazon by 4 years. You know, we eat innovations for breakfast. And yet another fact, what's the most innovative now? AI. Nobody spoke of AI today somehow. Artificial intelligence, hot topic 2022, GPT chat breaks into our homes. But Darnica in 2021 was already creating its budget, or checking at least its budget, with the use of AI. So, Ukrainian pharma is about innovations, and the same pertains to all the top manufacturers. In Ukraine, we have 113 manufacturers of pharmaceutical products. This is just licensed, right? I can't speak about each and every one, but if we have a look at top 5, top 10, this would be those that are not just relatively technologically advanced, but we can compete with the best manufacturers of US and Europe. And the confirmation to this would be our recent registrations we are doing with our generics. And we are registering and selling them not just to European countries, though, because they adhere to GMP, and this confirms our capacity. We also register it in New Zealand, in Australia, in other countries that have got very serious requirements of entering their markets for the residents of these countries to be getting high quality medicinal products of ours. And I'm very happy that our authorities, our parliament, our ministry, the National Healthcare Service, we are all adhering to this way of European integration. We support this choice of Ukraine, and we are very glad that we will gradually achieve this target and we will be fully integrated. And if time permits, just one thought, if just one thought remains in your heads, let us all know and let us all understand that Ukrainian pharma would be not something produced in the garage somewhere there next to the highway, but that's about quality, that's about something GMP certified, reliable, affordable medicines for Ukrainians as well as for Europe. I'm very grateful to you, European partners, for your standing support. Thank you, and glory to Ukraine. Glory to heroes. Thank you, Mr. Serhiy. And we have to wrap up because it smells great from behind the door. So, we still have to discuss what's cool in Ukraine in terms of manufacturing blood products and blood plasma-based products. And, as far as we have the full-scale war, we understand to what extent it's important to have our own producer, which is why I would like still to give the floor to Taras Savchuk, who works in Biopharma Plasma for more than 16 years and for 5 years is heading the export department. Biopharma Plasma is the regional leader in production of immunobiological products from blood plasma. Taras, tell us about the situation in the world, in Europe, and what can we offer to the world, and in what way can we show to the world that we are great and resilient. Thank you so much. Evgenia, you gave me the hungriest audience today, right? Yeah, I'm not going to talk for ages, but let me just highlight the key things happening in the industry because they are very specific and characteristic. With the beginning of the full-scale invasion, a lot of healthcare areas had this stress test for resilience. Somebody coped in the best possible way, somebody was still struggling, but as far as we are the only plasma-based producers, albumins, etc., we actually have to do a lot with the emergency medicine, critically important assistance, and our albumins were used whenever there was a severe blood loss. There was huge demand for our albumins, and we actually managed to meet this increased demand, but also to have the strategic backup stockpile of these albumins. How did we manage to succeed like this? Well, for dozens of years, we are developing not just our pharmaceutical factory, but also the processes of plasma collection. Can we have a look at the slides? Sorry. Yeah. So, collection of plasma is critical because not all the countries can arrange this significant scope of plasma collection. And actually, this is a stunning statistics. It mentions 65% of all plasma in the world. Actually, 70% of all the plasma in the world used for plasma-based products is collected in US. 70%, as you were saying, like 70% of API of drugs. They've got more than 1,200 plasma centers all over the country, and this process has got the commercial nature. More than half of this plasma then is brought to Europe, meaning Europe buys this plasma from United States in order to produce plasma-based products. Europe, as of today, is not capable of collecting sufficient amounts of plasma for their needs, to meet their needs. Just 4 countries of the European Union can arrange this commercial private collection of plasma. That's higher than average from among other countries because this allows the private companies to kick into this very competition on plasma collection. That's Austria, Czech Republic, Germany, and Hungary. And from among EU countries, Ukraine would be country number 5. That's it. Which is why Mr. Boris mentioned really correctly that in critical moments of time, it's very important to really shorten the supply chain implementation times to get the raw materials in a timely manner. In what way is our case successful? We've managed to ensure the closed subsystem which would be functional here in Ukraine. We have our sites of collection, our sites of procession, and actually the EU suffers because they don't have this process well arranged. In a lot of countries, this is quite an archaic system, and they don't want the commercial companies to be dealing with this due to various reasons. So in the first place, we can surprise Europe with our products and with our model that had proven itself in a critical situation to be very successful. And we will gladly share the experience with our European colleagues if needed. And, well, we are ready to do that. And in the future, we are ready to show our approaches to collection. This shall not necessarily be a private model. It can be a public-private partnership, and we are working based on this model in Cherkasy and Sumy Oblast. We collect plasma there, and we are ensuring hospitals with blood components as well as healthcare system in general. And for sure, we are ready to cooperate, and we would be great to present our products to Europe. Well, inspectors are not really in a hurry to visit our pharmaceutical manufacturing sites, but we are ready for any kind of inspections of our production manufacturing sites and our plasma centers. We strongly hope as soon as the border opens up more broadly, we will be welcoming more inspections. Thank you. Thank you, Mr. Taras. This would be it speaking about our pharmaceutical panel. Thank you so much for your attention. Thank you, dear speakers. And Miss Evgenia, thank you so much for great moderation. A round of applause to Miss Evgenia. Dear friends, we are changing the plan a little bit. Lunch is coming, and you are really tempted by the smell. And very soon we will start with the summary, with the participation of Mr. Viktor Leshko, Health Minister of Ukraine, and Viktor Radutsky. Thank you. We start at 3:30. And joining us after visiting Verkhovna Rada of Ukraine today, Mr. Viktor Lyashko. So what's Ukraine's progress on its way to European integration in terms of healthcare? Thank you. Wish you good health. And let me start with the words of the President of Ukraine, who today presented the victory plan. The first clause was about geopolitics. And there he mentioned the need to invite Ukraine to NATO, and Ukraine has to become part of NATO. And in this clause on geopolitics, it was clearly mentioned Ukraine will become the member of EU. And the rhetoric now does not include what, when, how. It will be the member of EU. But the next question would be when, and it all depends on each and every one of us. Trust me, you can't be now personally expecting that somebody would do something instead of you. For you. No, it's all up to us to do everything needed in order to become part of the European Union. And we need to look not just at mere directives, but we need to actually rethink where we are and what we currently lack in order to be a member of the EU. Don't expect that passing of some law, regulation, order of the MOH will bring us to EU. Only thorough work in order to ensure the success is needed. And we are all working tirelessly for everyone in need of healthcare to have accessible, high quality, and free of charge medical care. This would be three key pillars. And if we have a look even further and dig deeper, I believe, you've discussed it all at today's conference, and you were profoundly looking at all the areas healthcare has anything to do with within the framework of Euro integrational process, and what we do now, what we'll do in February, what we need to have in each proper shelf. We have these major blocks, and within these blocks, like public health, in public health, we were thinking we would be just solving our internal problems, but no, there are global challenges, and these global challenges are further more complicated by the war in Ukraine. When we speak about public health, we speak about epidemiological surveillance, transporter threats, safety of blood, and then some agent shows up, and we all reconsider our response plans. And actually, the most global challenge would be antibiotics resistance. And a lot of people are mentioning this now. In Ukraine, we were quite arrogant recognizing antibiotics resistance. Actually, when we were speaking about prescription antibiotics, people thought that was some limitation of their rights. But if we don't discuss this problem, if we don't discuss it in our families and don't explain why it's so important to use antibiotics following the prescription of the physician, believe me, trust me, all the other regulations, directives won't give us the ultimate solutions. When a person is coming to the drugstore and is not being sold antibiotics because there's no prescription, this is not about limitation of the right to access to treatment. No, this is about restraining the threat which can actually deprive a person of an effective therapeutical method in the future. And it doesn't matter how much we do at the national level, we need to invest in education, because education is about changing the mindset, the approaches. Quite often children come after school to the university and then they end up at the institute. Nobody tells them why we have this word university, because university is about self-education to the greatest extent. And actually, you just deal with something you couldn't understand during self-education, and you just discuss it with the lecturer. We got used to just coming to the lecture, putting it all down, and then passing a test. And then we've got problems. This is not about education. This is not about European integration. And as I'm mentioning, the key fundamental things shall be changed, and that's the key task for ourselves. for today. We have to understand and perceive what European integration is, what are we planning to change. Just to have a document that Ukraine is full-fledged member of EU, or changing the mindset and rejecting whatever was dictated to us by the Russian Empire within the most recent decades and centuries. This is about what we have to do. And don't expect that... Okay, the Committee of Healthcare will do this, right? Because these guys are responsible for the healthcare acts and bylaws. No, it all depends on each and every one of us. Today there's going to be a panel dedicated to youth in healthcare. That's also your role. We are creating the future of Ukraine. 10 years past and you will be the core of the healthcare of Ukraine. And now you have to actually get proper education to change Ukraine's future. No one is an expert on everything, right? No one can ideally understand each and every topic. We need to learn how to hear each other, how to have polite discussions with each other, how to find compromises and move forward. Because quite often we get too concentrated on the problem, we don't find any compromises, and we keep on standing our ground, failing to achieve the ultimate goal. You know, as they say, perfect is the enemy of good. So instead of making the first step in the direction of creating something good, we are still striving to achieve something ideal. So for me, European integration is a vast notion, and this is not just about the number of laws which would be harmonized to EU acquis, but actually the most recent discussions with the European Commission had shown us that we will have our own path. We cannot borrow the experience of any other country like Croatia, right? Because when they were joining EU, there were not so many regulations, and as now we are in this process, we need to implement much more directives into our national legislation. There are more and more regulations nowadays, and we understand why it's happening, because there are more and more challenges out there, and the policymakers are responding to those by limiting something, by developing this directives and regulations. And you know, I believe there will be some regulations on AI in healthcare at the moment we are joining the European Union, and we will be reformatting it all again. That's the challenge, but we need to accept it. Thank you. Mr. Victor, tell us, what reforms are you most proud of in the Ukrainian healthcare system within the recent years? Not to offend anybody. So, you know, this is quite an interesting issue. When we speak about a reform of medical services, let me call it like this, let us think back about the year when those reforms were actually practically implemented. You remember the legislation was passed in 2018, but then there was the first program of medical guarantees, PMG, what problems we faced and in what way we were balancing throughout all those problems. And actually, we didn't go back to subvention, right? But we've managed to succeed gradually. So the reform happened, actually. This is something to be proud of. And then the question would be not about reforms, but about the outcomes of what was launched. I'm proud of the figures. I was not preparing to show you some figures, but I can tell you about the number of heart strokes. I became minister in 2021. In 2021, in May, we actually had a look how many heart strokes cases are being brought to those hospitals which have got the contracts with the Healthcare Service of Ukraine. Then we had a look at the thromb extractions and thrombectomy cases, and then we saw some terrible results. You know, there's this European plan of countering heart strokes, and I saw the figures, you know, but actually we were succeeding something like 60% as regards following the route of the patient. 40% of patients were getting to the hospital where they potentially couldn't treat this patient properly. We did mapping and we had a look at how many hospitals which were treating heart strokes, they could actually identify whether that was hemorrhagic or ischemic stroke. And for that purpose, for sure, they needed the appropriate piece of device. And the situation in 2021 was dire. I can show you for the comparison, for benchmarking the data for 2024. We have already followed the European plan of countering heart stroke. We can show you the data on thrombolysis. It's being conducted whenever the patient within the therapeutical window. And we understand that now we need to be dealing with the problem of awareness, that for people to understand that they need to recognize the stroke symptoms and address for medical care, because sometimes people are calling too late and then we can't do the thrombolysis. And actually now we are coming to 5% indicator of thrombectomies. So we've launched this program in Ukraine. We're dealing with thrombosis of the veins, and angiographic equipment was installed that helps us significantly. And also I can tell you about the number of stents installed. And go to any center which treats heart attacks and have a look at all these stents and their stock. This is something that really saves lives, lives of people who get to healthcare institutions. Mr. Victor, thank you so much. I would like to ask our audience, because we've all eaten up, relaxed a bit. So tell us, please, who is using the state-funded medicine? Okay, good. I just want to support you from... Oh, you want to ask what else is being used by those who didn't raise... you know, you are very young. All the people are very young. Prevention is the key. It's too early for you to be using... Mr. Victor didn't raise the hand. No, just for prophylaxis checkups. Did you raise your hand? Okay, believe me. In 2019, I became a deputy minister of health, and I've selected the physician at this communal healthcare institution, Brovary district next to Kyiv, and only then I was coming to my family doctor just for prevention, some immunizations, etc. I want to add a little story from my own experience, speaking about state guarantees, because previously I didn't face the public medicine because I had medical insurance, but my elderly relatives had some severe disease and I was asked to bring this person to the state-run hospital. I was actually surprised that a lot is covered. If you really follow the protocol of treatment of a severe disease, everything is done electronically, everything's covered. They are not asking you for money. But you know what's bad, Mr. Victor? Those elderly relatives of mine, I have to tell you that they are sure that everything is so great just because it's me who brings them to the hospital, but not because they are just common citizens of Ukraine and they are entitled to all these great approaches and changes. You know, Homo Sovieticus kicks in. You know, there are still some challenges. Namely, this week we had a meeting with the representatives, heads of oncological centers, and Athens organization was conducting this survey. In what way patients are getting oncological treatment? We were comparing the dynamics within the recent 3-4 years as regards getting free of charge assistance, admission to the hospital, chemotherapy and other things. And we see positive dynamics, yes, but it's still yet not zero, if to speak about absence of some informal payments required from the patients. We know about this problem. This is already half of the solution. That's great that we know about this problem. And the key thing about oncology would be really access to free of charge diagnostics. Speaking about tomography devices, we have them more than we had digital X-ray machines in the country before the pandemic. So I'm frank here, but actually not everyone can get free of charge tomography still, and we need to deal with this somehow. And that's what I mentioned at my introductory remarks. There is no regulation which would oblige the head of the unit, of the department, to conduct for fee tomography examination. And this is really our task, how to persuade, how to make it so that patients get free of charge assistance. I believe doctors are not really asking for money, but patients are sometimes not ready. They don't understand the concept that they can come to the doctor without paying anything, right? They feel discomfortable. Yeah, we have to be rewarding physicians. Thank you so much, Mr. Victor. Mr. Mikhailo, during the first panel, we heard from Olha Stefanishina that actually now there are all these changes related to European integration, and you have to be considering all these changes, So a lot of laws can't be changed before the war. And, what we see today. Well, in the first place, let me say this. Today, the team of the president, and that's the parliament, the committee, the Ministry of Health, that's the presidential office, we don't have any other approaches, any other thinking that we need to select some other ways for ourselves. No, we've selected Euro integrational path, and all the laws must be checked whether they comply with the European acquis. And in our committee, namely, Olha Stefanishina is the head of the subcommittee by our committee, and they are checking whether Ukrainian legislation meets the requirements of the European legislation. So what are we facing here? Well, what have you just mentioned? Homo Sovieticus. Believe me, unfortunately, our colleagues are also still Homo Sovieticus, the Soviet-style mindset people, right? And sometimes the medical community doesn't want to perceive some things. And whenever we are passing a law, we are facing a problem that the professional community is not ready for these laws sometimes. And all the physicians are saying, we are not slaves. But when the government, together with the committee, offers them a law about self-governance, we are giving them freedom, just stick to the law of Ukraine, then they are resistant to that. They require some strict regulations, and trade unions are losing some leverages. So we have offered this approaches. The same happened to legislation pertaining to all the related issues. Very often Ukrainian patients, Ukrainian donors, international partners want some changes, but then all of a sudden this resistance, how come we don't pay to donors? Europe is not paying to donors. This is not business. This is not something you have to thank donors for paying them extra. What happened to transplantation? Well, when Skabeyeva is commenting on it, the pro-Russian journalist, about depriving our deceased service persons of their organs and selling it to the West for profit. Well, all this crazy propaganda, right? That's one thing when we hear it from Skabeyeva, but that's a pity when we hear something like this from Ukrainians. Skabeyeva is from the error country, but when it's happening here in Ukraine, speaking about vaccination, there was some resistance. But the law on transplantation prohibits transplantation of organs from a deceased service person. Oh, Miss Marichka, people are reading just the headline and they are not reading the text. Speaking about medicines, nobody is really reading it all. Implementation is very difficult. For example, the law on legalization of medical cannabis, I believe that's European, Euro-integrational law. But actually, me and Mr. Minister were mentioned that we're trying to arrange the second Afghanistan here. Afghanistan, Colombia, terrible things. This all happened. And today they are telling us, where are the regulations? The same people are yelling us, the same people who were coming to TV shows saying, how come, why we need immunization, we need just the foil caps. And then they say, how come you didn't procure COVID vaccines? So, Homo Sovieticus is everywhere, unfortunately. We can't be saying this just in regards of our patients. And speaking about your relatives and actually your recognizable face in Ukraine, it really works as well. When I am calling to the Institute of Neurosurgery, they are telling me, no, everything's free of charge. And then the military are telling me that they were asked money for their prosthetic appliance. That's a global problem. And I want to support Mr. Minister. He mentioned correctly that passing a law, it's one thing, but that's not the end of the story. We are not yet in Europe. We need to have the European mindset. Go in Warsaw, in Brussels, and get something without a prescription. Just try it. And as we've introduced the prescription for antibiotics, you remember what was mentioned even by some associations. How come Nemesil can be just prescribed now? Nemesil harms in the first place, especially when you use it without any control. There's this problem of Mr. Minister, of the First Lady. We often communicate with various hospitals in order to sign partnership agreements between Ukrainian and foreign hospitals. And they are welcoming a lot of Ukrainian veterans there. And as you ask them what's the biggest problem, they say that the biggest problem would be that we can't be using antibiotics of 5th generation in your veterans, in your military, because it doesn't work on them. You mean when they can't deal with infections, right? They are placed into the separate boxes. Yeah, because 5th generation antibiotics are not working. That's an evil, How come? And Mr. Victor mentioned correctly that one of the key challenges would be antibiotic resistance, because there's no medical product of choice. And okay, we've heard a lot about emergency contraception. Homo Sovieticus is out there, unfortunately, not just among the patients. It pertains to everybody, to doctors, to MPs, to representatives of the government. But nevertheless, speaking about the reform and Euro-integrational approaches, let me put it like this. Today, for example, the medical procurements would be used as a good example in European countries.
The fact is that this is the first time ever in human history that we were using the ACAT units for irradiation of the patients, which back in 1993 was pending recognition as a device for torture. But now we have 5 linear amplifiers procurement, and with some savings we're procuring even more, with the pricing which admitted to my in my personal communication that they would not be selling even in domestic market at the price that they charged for Ukraine. And again, that is something I was also declaring back in 2019. That was my mistake, and I admit my mistakes. But today I say it loud and clear. If it were not the reforms that we implemented, we would not have survived COVID, not to say the war. If we didn't make all those changes and reforms, which, thanks to our efforts, to the President, government and Parliament, all of that working together, because indeed we had to make some U-turns. This was difficult, this was challenging, this seemed impossible, but we made it, and it had the effect. And today, indeed, we have the most difficult stage in our reforms, because we have one health space, and we are inviting forcefully, literally, we invite some agencies in a forceful manner to join. And the least we can do, and can have, would be some complaints. Open claims and complaints addressing the President, please come and save us. But that is something for us, not only to resist and survive, but also uptake and survive, and making sure all of us clearly understand why we are doing that. Thank you so much on that. But let me also ask a technical question. How about seasonal influenza vaccination? Is it too late already? Not. Conditional to that all of the people in attendance come and get the immunization shot, because the entire Parliament did that 2 weeks ago. I have not been immunized against influenza this season yet. No. This is my principal position as the Minister of Healthcare. In one of our briefings, when there were some bureaucratic processes involved, I had to say, I will not be immunized, but if I fall sick, this will be your fault. Up until the time when you cure the situation, allowing for vaccines to be sold in pharmacies. When that happens, I believe each and every one of you and us, instead of going to an immunization center in a local clinic, will go to the closest pharmacy, get a shot, and get immunized, like you should do being a European citizen. Also, since you, Your Excellency, mentioned the pharmacies, I would like to emphasize that today, working together with the committee members and the ministry, we are preparing for a fundamental reform of pharma manufacturing sector, including distribution, logistics and everything else. And respectively, our cooperation with DG Santé, which has a subcommittee on health, and also all the lines of communication, including Bundestag, for example, we will have a joint hearings in a couple of days with our German counterparts. And just like you mentioned, speaking of your relatives, we feel like they feel the impact of those reforms and changes in the health sector, and that is something we would like to hear in the next conference to be discussed. Accessibility of drugs, affordability of drugs as well. Excellent. Thank you, Your Excellencies, Viktor Leshko, Mikhail Reshko. Please feel free to join the audience in attendance. And with that, we have time to start our panel number 5, and I'm happy to invite Jarno Habicht, country representative of the World Health Organization country office in Ukraine. And we'll be talking about financial investment opportunities in the field of healthcare with his moderation.
It's conclusion after conclusions, but it has been many good discussions, and it's great to see so many of you still in the room. So thank you for staying. And we just heard from Viktor and Mihailo about some of the issues related to mindset. We talked about the topics about the pain points which are in Ukraine, while in the morning from Marina we heard about what are the areas that needs to be addressed in the EU accession. And also we had the colleagues here, we had Stefan here from the European Commission, the delegation here talking his vision as well. We had the World Bank here. So while I'm moving forward more to colleagues who are knowing where the money is, then my chances is to facilitate some of that discussion before we go to the final session, which is together with youth, and that is also very important. So my name is Jarno Habicht. I'm the WHO representative for many years in Ukraine. It's my 6th year here, and I was just reflecting that I remember the time when Estonia, from where I'm coming, the life before EU and after EU, and I'm still alive, so it's a good thing. So I can recommend. It's a good pill in medicine. So, and it has many different elements, as Victor also mentioned. Many areas are regulated. So, but before we go to the panelists, when we have 4 great speakers who have presented few slides, I know that Marlene Madsen wanted to be with us and present, but we have one presentation coming from European Commission. We have our colleagues from DG NEAR, which means the DG about neighborhood and enlargement negotiations. Many friends of many of us who have been supporting Ukraine over years, time of COVID, at the time of war. And I have a friend, Fernando Fonseca, who is there. So I hope he's connected. So he's not Marlene. We got Marlene. It's even better. So we have Marlene. You never know. You have a name on the screen and you don't know who is coming on the screen after. So I hope that we can get Marlene to our connection. Hello, Marlene. It's great to have you in Kiev. I know that you wanted to come to Kiev, but next time I see more and more EU colleagues all the time in Kiev. So it's great to be all together. And I would like to invite you for the presentation and tell a little bit more about, from your side, what are the tools available, especially financial tools. We have been discussing the whole first half of the day about all the troubles, problems, what we want to do, what we want to achieve. So we hope to find a key, at least in terms of resources from you. Over to you.
Well, thank you very much. I hope you can hear me clearly in Kiev as well. So, dear Jarno, dear Minister Liashko, dear colleagues, ladies and gentlemen, indeed, it would have been much preferred had I been able to be with you today in Kiev. I am actually in Ukraine almost every month, but it is at this point in time extremely busy times here in Brussels with preparing for the next commission and also with all the bilateral screening meetings we're having with Ukrainian authorities these days to try to ensure that the enlargement process is on track and moving forward. But indeed, I would like to just give a few words on how we're supporting Ukraine on both financially, but certainly also very much on the reform agenda and reform issues, because as we just heard from the two previous, from the minister and from the other colleague, then the importance of reforms and a well-functioning healthcare system is really absolutely vital for Ukraine today, and certainly from any country, but not least with the challenges faced by your country these days. So let me start with just first a bit of the support that we've had ever since the full-scale invasion 2.5 years ago. Since the beginning, we had a 120 million euro grant for Ukraine for budget support, which was assisting the government in strengthening civilian crisis preparedness and management at central and local levels. We should never underestimate the huge importance also of the central and local level when it comes to addressing the challenges posed in the area of health in your country these days. This contributed to the continued delivery of the basic services, including the medical assistance to the most vulnerable citizens. So we have continued with that. That was the first scheme we had. We had a huge partnership with also UNDP to support Ukraine's recovery efforts. But we've also been focusing continuously with all our technical assistance projects in Ukraine in the area of health sector. And in particular, we've had 7 areas that we've been trying to target so far with that programs with those technical assistance projects. So one thing is really the resilience of your health system. It's also with the approximation of the EU legislation in the field of public health, which is absolutely vital, as you also mentioned yourself. It's building the capacity of the Ministry of Health, because they need to also have the capacity to lift this daunting challenge that they're faced with. But it's also supporting the local authorities and communities. As I said, these are playing a crucial role, both as providing the services needed, but also to address the challenges arising from the internal displaced people and the effect of the full-scale invasion, also when it comes to trauma and to psychosocial issues. We've also been focusing on the medical equipment, but also the capacity of the medical procurement agency, and finally also on medical rehabilitation, where we've got a 10 million contract through the WHO that can help support in this field. But so through the EU through WHO, which is a very close partner of ours, we're supporting Ukraine with emergency needs, strengthening the health systems, but also we're also working very much on other areas, as I just tried to mention. It is vast, all our projects, but it's so far been rather small projects in various areas where we thought we could target some of the most urgent needs. But investment alone is not going to address your challenges. It has to be combined with reforms and the further integration into the EU. This was also mentioned by the minister, and it should not be underestimated, the huge importance of speeding up the integration with the EU and strengthening your system. For the help with the reforms and the strengthening of the administrations, we've also been providing a lot of TAIEX support and trying to find the best practices from member states around the EU and bring that to the authorities in Ukraine. But since 1st of March this year, we've had an even, should we say, bigger and stronger tool that helps us provide support to you and with these endeavors, both when it comes to the financial and with the help of the reforms that is so needed. So since the 1st of March this year, we've had what is called the Ukraine Facility. It is bringing together all the different, should we say, pots of money that was around in the European Commission and into one scheme, and even bigger. We got backing from member states to increase our capacity to support you. So the Ukraine Facility is in total 50 billion euros over 4 years. Now, the vast majority of this is budget support. And it is because the most important thing is to ensure that you have a well-functioning government, that you are also able to provide the services to your citizens, not least in this area. It's absolutely vital. So in order to help your administration also in preparing and prioritizing these efforts over the next 4 years, we have that the Ukrainian government submitted a Ukraine plan earlier this year. And on that basis, member states of the EU agreed on how to disperse these budget support over the next 4 years. And I can say that already this year, so even if it was only adopted 1st of March, then already by this point of the year, we have already dispersed 12.2 billion euro in budget support alone. The Ukraine plan is having these conditionalities built in to ensure that reforms in various areas are also carried out and to bring this further integration into the EU together. It's also a way of helping the administration really prioritize also in the area of healthcare. But in addition, we are making sure that We are also working in the context of enlargement. So we've already opened up what is so-called screening exercises, where we are looking at all the legislation in various areas, so also in the area of healthcare, and how that maps with the EU acquis in the various areas. And we have already started this. This will be a very important tool as well. And for the area of consumer and health protection, these very important screening meetings will take place already in February next year. So we're working very closely with your administration to ensure that the best possible next step in the enlargement process in also in this crucial area. And this technical assistant that I mentioned in the beginning, we have further resources now, and we're making sure that this is also then plugged in so that we can help you the best possible in preparing also for the enlargement and the vital reforms you need. For the more, should we say, traditional investment, we also have in this Ukraine facility that I mentioned a so-called Pillar 2. So even if the by far biggest part is the budget support that I mentioned, then we have another part of the facility, which is called the Ukraine Investment Framework. And under this, we are able to also, through partners, provide more, should we say, targeted investment into areas, also in the area of healthcare. So the objective really is to mobilize investment for the modernization, but also of the rebuilding of your country. This is a combination of blending, as we would call it. So it's in form of, we have investment grants that will have a co-financing element. We have technical assistance, and we also have financial instruments for around 1.5 billion for these 4 years, and a guarantee capacity of around 7.8 billion euros, directed to both public and private sectors, which can lead to this. It could lead to, with this leveraging in of other investment, to hopefully something around the area of 40 billion euros of investment in Ukraine over these 4 years. Healthcare is, of course, only part of this, but the Ukraine plan provided by the Ukrainian government, which is also demonstrating the huge importance of healthcare, has already mapped out that this is one of your priority areas. So certainly this will also be built in. Now, what is very important to understand in this Ukraine investment framework is that the projects and the prioritization of projects is something that is carried out by the Ukrainian government. The EU then provides, should we say, a kind of a mapping exercise of trying to find the donor, the donors, to try to find the investors and the IFIs that can help build these projects on the ground. But the project itself has to come from Ukraine. It's not something that the EU is doing. We are, however, providing support to the Ukrainian administrations to help in building good programs and methodologies for selecting such projects and for carrying out, should we say, this kind of prioritization that unfortunately is needed as long as there are both, should we say, administrative and financial limitations. And while the money sounds large, and they are, and I know the Ukrainian authorities are doing a fantastic job in also ensuring the capacity to deliver everything that is needed these days, then the challenges, the needs are so massive these days. So we have to ensure that what we're doing is also feasible and doable, and therefore we need to ensure this sequencing, and we need to ensure that we do it in a way that we can deliver successfully good investment projects, good prioritization of areas for the delivery of the support. So this is in very brief terms what we are doing in our support, both the financial but certainly also the targeted to the national administration, which has to play a key role in this as well. So it cannot be done just by us coming with money. It has to come bottom up from Ukrainians and the Ukrainian administrations, from the central level, the local level as well. Maybe just one final word. Our technical assistants will continue to map, as I mentioned, to really be able to deliver these very important strategies for the next 4 years. But also we should really not underestimate the huge importance of also the accession process, the enlargement discussions, and also just that to know that the moment you become partners and members of the European family, you will also automatically become members of the EU agencies. And here in particular in EU, we have 2 agencies that are very important in this area, the European Medicine Agency and also the European Centre for Disease Prevention and Control. These you would be members of, immediate full members when accession has happened. But until then, we will continue to cooperate closely and we'll be there to help and support you all the way through to the best of our abilities. Thank you very much.
Thank you. Thank you, Marlene, and thank you really joining with us and drawing the additional information for those here in Kiev in the room, but also those who are following us in the web and following the discussion. So big thank you, Marlene. And with this one, before we go to the panel, and because Marlene was mentioning also about the Ukraine facility, and that within the Ukraine facility we have also health sector, which has been prioritized. We, together with organizers, decided that it would be good to have here also Minister of Finance, and I hope that we have somewhere Dmytro Mansurov. Yes, I see. So he agreed to do a bit of the presentation to us, what Ukraine facility is, particularly for the health sector. So please, the floor is yours.
Thanks, Jarno. In this regard, just Marlene, nice to see your familiar faces here. And in this regard, I just want to say briefly regarding the Ukraine facility instrument that was provided by EU, started launching this year. So let's just try, yeah. So Ukraine facility is financial instrument for support Ukraine for 2024-2027, and it's about 50 billion euros during next 4 years that will be directed by EU for financing state budget, stimulated investment, and also technical support. So the program goals is strengthening macroeconomic stability, create basis for future economic growth, and bring Ukraine close to the EU membership. That also we discuss all day today is what we should do. So if we just looking on the structure of the Ukraine facility, we see that here are 3 different pillars. Pillar 1 is direct support to the state budget. It's the most funds going through these pillars, about 38 billion euros for next 4 years, as I already mentioned. And this support will be provided by concession loans and by grants. Also, it's necessary to emphasize that most of these funds should go to this budget or after when we make a good progress on implementation of Ukraine plan. So Ukraine plan was adopted by the government on 18th of March this year, and already some of about 20 different actions we are already done. So the next pillar is the Ukrainian investment framework. Marlene already mentioned it about that. It's nice to emphasize it on this stage that this is a special investment tool for stimulating and attracting investment in priority sectors. Ukraine will not receive directly this money from the EU. These investments will go through the different international partners like EBRD, EIP, and other international organizations. And on second pillar will be some technical and administrative support on our way to be a membership of EU. also to create a capacity building in authority on national level, regional, and also local. So probably just jump to the second slide. It's regarding the financing and structure. So as I mentioned already, the general funding by Ukraine facility is 50 billion. On the pillar one, it's 38 billion euros, and part of them we are already received in this year. So already we received 12 billion euros, and some of that was a grant, and we are waiting for received the last part in this year is about 4 billion euros. Probably I'm not go deeply on figures on this issue. Just want to say that in 2024 we expect to receive in general 16 billion from under the Ukraine facility. In next year it will be 12.5 billion euros. In 2026 7.2 billion euros and 1.2 in 2027, and last part will be in 2028. So. If we're just going to our reform agenda on this stage, I also want to say that Ukrainian plan is not all our reforms that Ukraine should be implemented this year or next year. So we have a lot of different programs with international partners, also enlargement report. We are waiting now for an update enlargement report for 2024. I hope that it will be this week, but unfortunately it's a little bit delay. But we are ready to work on that and implement it fully before next screenings on the enlargement report will starting. So the probably we go to the next slide regarding the Ukrainian plan. Ukrainian plan consists of about 69 reforms that are implemented by 150 different reforms. The Ukrainian plan was developed in close cooperation with the EU. Marlene also have a big part of this plan. We are working more than half of a year on this document, and already in March it was adopted by the government, as I already mentioned before. So just to see that sorry, yeah, probably we just stay on these slides that we have different three blocks. It's first one is the basic reforms that are created based on accelerate economic recovery and strengthening institutional capacity. Second block is economic criteria on reform necessary for developing our economic and improving welfare and citizens. And third one is the key sectors. The priority areas, the rapid development of which stimulate comprehensive economic growth. Also on human capacity, that part of which part is healthcare, also are on this in this block. So probably go to other part of our Ukrainian plan. It is investment indicators. There are 16 different investment indicators in order for fulfillment necessary to continue a program related to the development infrastructure, the mining, energy, support small and medium enterprises, and other things. And in this regard, I just want to say that one of the most big part of these indicators is the indicator on healthcare. So around 400 million should go through the Ukrainian plan to the different areas on healthcare. It's laboratory equipment, shelters and safety measures in hospitals, healthcare infrastructure and facility, IT system database. It's already mentioned today all day that we should synchronize our IT systems with EU systems and other create different programs in our hospitals. So in this regard, probably I just want to emphasize also that Ukrainian investment framework that also I mentioned and Marlene, it will be background on our single project pipeline that will be financed by will be financed by our partners, should include also healthcare part. So to modernize our hospitals by equipment and other things. Probably that's all. Thank you for your attention, and I'm ready to have answer for your question. It will be.
Thank you so much, Dmytro. And I think organizers said that there is this networking session after the final session, and I think everybody knows now you by face, because I think you will be very popular talking about that 400 million as well. Thank you. And with this one, because I just wanted to put that 400 million also to the context, because from one hand, we talk here about the future and how we move forward, but I just want to say one number, which is $873 million, and that is only the recovery needs for this year because of the impact of war. So what is important that we need to address this impact of war that we have learned in our rapid damages and needs assessment done by the World Bank, European Union and UN together, then we want to move ahead with the reforms where we need to do investments as well. But then we have many other friends around, and that's why I want to bring now 4 colleagues here, and they will have very short interventions as well. But I want to ask Thomas Kergel here, and he will come here from the Council of European Development Bank. I know that he has been missing Ukraine for years because of the war, and finally he got from Paris here. So good to have you in the panel. He just arrived yesterday, so it's good to have you in Kiev. Then I would like to invite here also to Vincent Viel, who is the friend of many. I don't know who doesn't know you already after you have been here a few years, and he's coming from Expertise France, having many initiatives, and will share what they are doing and how to move forward. Then I would like to ask Raffaella here, who is coming from Italian Agency for Development Cooperation. And they are also, I will not tell what they are going to tell, because otherwise their short interventions will be already told. But they are here, and it's great to have actually colleagues here from your side as well. And then also I like to ask Dirk here also, from also one of the newcomers to the city, and but from Annabelle of Belgian agency as well. So we will have a bit of the interventions from their side to give us the flavor of other colleagues and other initiatives which are available, because we have here in the room many new generations who will lead the health sector in 10, 20, 30 years. We have private sector, we have current leaders and others. So I would like to go first, Vincent, to you. And what are the efforts that you are taking forward? What financing tools are available? I know some of them, but there are many great stories, but few of them, please.
Thanks, Jarno. Thanks, everybody, and special thanks to Minister of Health, Marina and her team. It's been amazing to work with you. So I'm talking today on behalf of the French Development Agency Group, which is a number of agencies. I'm not going to explain one by one because I've got 3 minutes literally. But in short, to explain how it works, using project cycle, you have Expertise France, my agency, and the French Development Agency that can actually formulate projects together with you. We will do the studies, and actually the AFD will fund the studies. The studies being completed, it's going to go to financing by the French Development Agency, which is a development bank, and Proparco, which funds businesses. And then the project will be implemented, and Expertise France will do either the implementation or the monitoring of the implementation. That being said, we want to talk about financing, and so we've been talking about the pillars, we've been talking about the facility. In terms of LAFD, I wanted to say that the group strategy in terms of health is actually aligned with the priorities both globally and also internally of the European Union, which is key. And what we want to do is to actually strengthen the systems. And there's a lot of words, I'm not going to have time to go through it, but a lot of things that you will find as the priorities of the Ukrainian government into actually being able to cope both with the conflict ongoing, the war, but also strengthening, reforming the systems in order to align with the European Union policy. So you can see digital transformations, you can see workforce policy, capacity building, and many others. Now, going into financing. So one of the things that is key is that the French Development Agency is a pillar-assessed facility, meaning that it can actually support you in accessing the funding from the second pillar of the facility. And that is one of the key points of this. So there is many ways to do this. We talk about blending, we talk about guarantees that we can discuss later in the dinner. Just to say that you can actually access funding from the EU through the French Development Agency. There are other funding mechanisms that we use, including on the mobilization of expertise in order to support Ministry of Health and others into actually aligning their policies with the European Union. And just noting as well that the French Development Agency is a financing institution, so as such can actually do concessional loans. Actually, it's up to 400 million for the next 3 years, so again, another 400 millions. And all of this is accessible to healthcare, and healthcare is one of the key pillars that the FD is going to consider into financing. And as well, we do donation, grants, and through those grants, we're actually trying to support Ministry of Health and the Ukrainian partners in Ukraine into aligning their standards and reforming the systems. So we do a number of work. We work, as an example, with our colleagues from Superhuman, the national NGO. We finance activities as well as we try to create specialties in Ukraine. So we're talking about maxillofacial surgery becoming a specialty through the work that is being done with France, mobilizing surgeons from Paris into Ukraine and Ukrainian surgeons into France. We talk about educational programs together with Ministry of Health, doing university diplomas on cancer, on emergency medicine and other topics. We talk about the financing of hospital cooperation within the International Medical Partnership Program, where we have currently about 16 Ukrainian and 16 French hospitals cooperating. So we try to mobilize all of this into actually trying to frame the way hospitals are working, aligning with French and European standards. We are talking about the deployment of technical experts with Ministry of Health of Ukraine. We will talk about it. And the last point is that we're engaging now with Medical Procurement of Ukraine, who would like to model actually their procurement system on the French standards. So this is also going to be quite a lot of work. So it's been 3 minutes and a pleasure. Thank you very much.
Thank you. Thank you. And I think what is the aim of this session is really to show the various different initiatives, various ways of how funds are flowing, and give you a little bit of inspiration as participants. I think we could dedicate the whole conference only how to finance reforms, EU accession, etc., etc. But I think it is important that, as we discussed in the first half of the day, also various technical areas, we also need to think how to finance that. And with this one, Raffaella, I think Italian agency is relatively new and young in Kiev. I remember years ago talking to your ambassador around 5-6 years ago that you are going to open an office, and thank you for the bravery that you are opening the office at the time of war. Please.
Thanks to you, Jarno, and thanks, Marina, for asking us to be here. Yes, it's true, the agency is present in 20 countries, but here in Ukraine, it's only almost 1 year that we are working, we are operative. The agency is the technical and practical branch of the Italian cooperation and development. So what we do, we work, we do assessment in the countries, then we do call. Normally we work through tenders or through direct contact with the line ministry, and then we evaluate what we finance. I have to say that we work on 3 years plan. So we are now still finalizing the 22-24 plan. And regarding the health component, I have to say that we have facilitated the access to integrate healthcare services. We have facilitated access to mental health service, to psychosocial support. We have provided trainings on healthcare workers. And we have also provided some medical equipment to different hospitals here in Ukraine. Then regarding the new, let's say, planning, 2024-26, we are planning to, and it will be out in the next months, for the organization of civil society, Italian organization of civil societies that works with the local, with the Ukrainian organization. We will publish a tender in the next months, and then we have concessional loans for health, and we are still working on it. And we provide to do some to buy some medical equipment.
Thank you.
Thank you.
Thank you. Thank you, Rafaela, and also giving an opportunity. I think you mentioned also civil society has an opportunity. So I think that's an important that we take away also from this discussion, that there are opportunities for various different stakeholders. There are opportunities for business. There are opportunities also for civil society.
Yeah. We strongly we work for the Italian civil society, but we strongly support the Ukrainian organization of civil society. So they work together. Actually, all the coordination, the practical work is done by them. So we couldn't work without them.
Exactly. Thank you so much. Going now, Dirk, to you. I know that in the past year you have traveled a lot across Ukraine, finding different projects. You have selected a couple of oblasts, probably. But what Enabel has been doing really here in the last few months, and what are the plans for the future?
Thank you very much, Arno. Thank you very much as well for having me in this panel. Enabel's Belgian Development Agency, we have a long-standing tradition in working in the health sector, but a very short experience in Ukraine. I must say, Ukraine for us is the first time we work in a country that is working at the same time entering the EU and also having to confront a war. In the meantime, we signed a number of MOUs, one directly with the Ministry of Health. We also joined the initiative on internationalization of medical initiatives and networks. Our Belgian ministry is in discussion to sign also, as was mentioned in your presentation, a partnership with the Ukrainian Ministry of Health. But I think one thing comes out of it all, to simplify, 2 points, is one on the hand is continuing working on the resilience in this time of war. And secondly then is the EU integration. And what does it mean for us? Well, maybe from the first point for me is we need to really invest in coordination. And for me the point is really starting to work together with WHO, USAID as the lead development partners for the health sector, but also with the Ministry of Health in how to coordinate, because we're very many. I mean, when I came here at the EU delegation and I asked which EU countries are here, I got the answer, it's easier to say which country is not yet here, and that was Luxembourg, which was also coming, and Malta. So there's only one country still missing, Malta, if I'm correct. And that means in the context of war, I think, because the ministry is already, each of us is knocking on the same door. I think we really need to streamline, and that's part of the first thing I think we need to do. Secondly, initially in our instruction in February from our ministry was, yes, support the reconstruction of damaged health infrastructure and integrating that energy efficiency. But now in discussion with Ukraine, in fact, the first thing we're going to do at the level of infrastructure is winterization. And that is really, we are now tendering out, it's in fact one of our first tenders is mobile heating systems for the health sector, because it's crucial to overcome this. But secondly, we will not so much invest in damaged by the war infrastructure, but more in health infrastructure, in modernizing it and helping it somewhere in adapting the infrastructure towards the new EU vision on more patient-centered approaches. And in that, keeping in mind also that we should not invest too much in infrastructure because we want to deinstitutionalize, so we should keep a good balance between outpatient services and in-hospital care. And that brings me to, in fact, to the third part of our element, because at the national level, I think at coordination, we have a relatively flexible instrument we want to keep open to respond to requests for support on EU integration, legislation, transformation, the best practices which are mentioned in the past. But as the Minister mentioned it a moment ago, reforming legislation is maybe the easy part. Changing mentality in the way of working is the more difficult part. And there we have chosen indeed, well, I wouldn't say chosen, it was somewhere a choice made by our ministry, is working in Kyiv region, Kyiv city and Chernihiv, to work with medical facilities, but also with the regional authorities, with Ukrainian civil societies, to work on the whole pathway of patients, from trauma treatment to rehabilitation to reintegration in society, to be treated in their homes. And for us, it makes a link with what we want to do at the level of education and skills development. We therefore see a specific window for people who are living with disabilities to be reskilled and to re-enter the job market. So that would be a bit of our streamlining there. At the level of instruments, and I think we see a lot of recognition between the other EU members. We want to invest a lot in twinning. And it was mentioned before, Ukraine has, unfortunately, due to the war, learned a lot on the level of trauma due to war. But I think we can anyway continue to learn a lot. But for us, the twinning is also a long-term investment. Because Ukraine is becoming part of the EU family, we need to create linkages between institutions within different EU countries and Ukraine, also for the longer part. So this twinning is not only short, but also long-term. And for us, the twinning will not only be at the level of hospitals, but also for education. And then when we look at medical faculties, and it's very much linked with the transition we would like to support at the level of rehabilitation, where a more multidisciplinary approach we want to support in training ergotherapists, kinesiotherapists, because it's not only a doctor, it's the whole network that has to be improved, and the human resource constraints are there in every part. And what I think is an important element to integrate there is we see, in the few months I've been here, there's a lot of initiatives already between Belgian and Ukrainian institutions, but often carried by an Ukrainian working in an institution in Belgium. And there's a huge diaspora for the moment. And I remember in the conference for the first men and first ladies, the Minister of Health mentioned our first challenge after the war will be demographic. And I think, therefore, we also, as EU member states, have an obligation to see how can we continue linking an Ukrainian diaspora with Ukraine so that they can contribute also to the reconstruction and the reintegration. Somebody mentioned to me the word circular migration. I think it's part of integrating, keeping people. It will be difficult. Somebody starts getting a job in a European country, getting back, but to create a linkage where they can work on both sides so that we can we can contribute to this challenge. And then maybe a last window, which is also very much linked with the European fund, is we were thinking about Ukraine has a strong pharmaceutical sector, but I also noticed, and that is very different from all the countries I've been for, there's a huge interest from Belgian private sector to be in Ukraine. So we want to create a window to pilot innovation in private sector through call for proposals for private partnerships between European private sector and Ukrainian private sector in everything related to medical equipment, medical supplies, and to stimulate innovation there. So in the end, well, I would say we're in our starting blocks, so we have a lot of ideas, and at the same time, we are also aware that in a context of war, we need to continue integrating flexibility to be able to continue to adapt.
Thank you.
I look forward to it.
Thank you. Thank you. And I think next time, Marina, we need to have all EU member states here. I have seen wonderful jazz players from Malta in Kiev as well, but not yet in the health sector, but Malta seems to come as well. So I think these are very important comments, that there is so much support and solidarity with Ukraine from various member states. And I think what you said also, the importance of institutions to resilience, recovery and reform, because I think all of our financial support to Ukraine depends that there are institutions who are in the lead. And this is important for the member states, But I want to lead to Thomas also. It's not only the member states. There are various other institutions like the CEB. And what is your thinking? Because you are looking at from the other perspective. We had a World Bank here in the morning. You are coming from the institution more related to the European Union.
Yes, Jarno. Po pierwsze, ja хочу podziękować.
In the first place, I would like to express my gratitude for inviting me to this very conference.
Thank you. I have somebody representing the CEB in the room that can do much better over there. Katerina, please. Indeed, CEB has been, in fact, invited to contribute to the HEAL framework project that is led by the World Bank. And in fact, I want to thank the World Bank people here for this opportunity. In fact, it comes all the way back from our first meeting in Rzeszów 2.5 years ago. You were asking, drawing on CEB's experience with supporting other countries. In fact, we are actually larger than the European Union. As you know, we belong to the Council of Europe. So we have 43 member states. The latest being Ukraine, who joined a 1.5 years ago. And in fact, our experience builds on EU and non-EU countries. Non-EU countries that have been going through also similar transitional changes. And I could quote the work that we do in Moldova, which is neighbor, or in Serbia, in the Balkans. That are going through very similar challenges because they come from a similar Semashko type of healthcare system. So how do we see the key lessons from those countries that went through similar changes, but also from others? I think I was telling you yesterday, Jarno, that it's not only the experience that Poland has, for instance, or Slovakia, but it's also countries that joined the EU even before, such as Spain, for instance. I'm working a lot in Spain with Spanish regions, and I have seen all the steps that those regions have accomplished since joining the EU in 1981. With the decentralization of healthcare responsibilities to the regions in 2003, and since then building the capacity within the regional administrations to respond to the needs of the population in the health and social care sector. I was visiting the hospital, the University Hospital in Salamanca, which is no less good, if this is something that can be said, no less good than any other hospital in Northern Europe. It's actually even better than other hospitals in Northern Europe. The hospital next to where I live in Paris is in shambles, with a lot of challenges, emergency unit where you have to wait 10 hours before being treated. So I think that experience from the CEB is actually quite useful, and this is what we are ready to provide with to Ukraine in terms of their path to the accession, their path on accession to the EU. I mean, this is the topic of the day, and you know, we're really working at CEB with both type of countries, those that have been integrated the EU 30 years ago, 20 years ago, and those that are now working on accessing. So, you know, when the bank works with those countries, it really tries to bring added value. It's not about bricks and mortar. It's not about just tendering infrastructure contracts. It's really about trying to bring the state-of-the-art expertise that in a way was tested in other places. There is no single model, as I think the previous speakers were saying, the minister was saying, Ukraine will have its own path, but it probably can pick up from the experience of other countries. In fact, you know, Homo Sovieticus is not only in Ukraine. It's also in France and in other countries. So you also have resistance to change in those countries, even if they have a different background. So the idea for CB is really to bring this added value that makes an investment responding to the needs of the people and not only to the needs of the stakeholders. And it's during the process of the investment, meaning the contracting process, for instance, the use of FIDIC, yellow, red, or turnkey type of contracts. It's really the adaptation of procurement rules. I always hear in countries in the Balkans that they don't want to use national procurement rules because it's a promise of failure with all the claims of contractors, and they want to use CEB rules. CEB rules are national rules, in fact. So we have to work together to make them successful and able to respond to the challenges of the private sector when they claim some supposedly misprocurement. But it's also the added value in terms of bringing, upgrading those infrastructure within the functional space inside the infrastructure within the delivery of medical services. And here I'm turning back to Jarno because this is what we are trying to do with WHO here and WHO Europe in Copenhagen, really trying to find I would say the crossing point where investments, capital investments, investment in infrastructure is also responding to the need to, I would say, transform and change the way medical services are delivered. And I must say it is really a challenge because, you know, I'm working in a bank with bankers. I'm always torn in between the public health management aspects that needs to be taken care of and the constraints of delivering, being able to sign and disburse the loan. So, as you know, in a loan agreement, we have disbursement conditions. The challenge is to make sure that those conditions will not stop the loan from being disbursed and the investment from being carried out, but that those conditions will allow also to progress on all those soft aspects of the operation. And I think I'll stop here because it's been more than 3 minutes.
Thank you. Thank you, Thomas. And thank you really for the panel, because I think what was the idea in the afternoon, and it's always difficult to be in the panel in the afternoon when everybody has had wonderful lunch here in the room, or if you follow us in the website, you might have even 2 lunches but you have a coffee at least when you listen us. And but the idea was really that we inspire and to bring in the different financial tools, first of all, which are there for various stakeholders. Because we are followed today in the conference by private sector, by civil society, by local authorities, by many in Ukraine who want to take the reforms further. So when we discussed this conference with Marina, the idea was to inspire. We didn't bring you all the tools, but we brought you the menu of different tools available from European Union, and I like to thank also from the presentations from Marlene and Dmitro, because that gave us the framework also on Ukraine facility. So first, there are various tools available. The second, I think what came out from here and has been here also in the corridors is the importance of coordination, because there are many different stakeholders now, many different financial tools. The coordination is the key, because we want every euro, dollar, whatever currency is coming to Ukraine really to benefit everybody, the Ukraine population, to the maximum extent. And for that one, we need to have a coordination, some that the Ministry of Health, WHO, US government is doing together under the sectorial working groups, which is there put in place exactly to stakeholders to have a platform available for that coordination. And the final, I will not dive into all the topics we could invest to and areas, but I think in addition to the primary health care that the World Bank was mentioning also in the beginning and we all believe in, I think a topic to take away, at least for me, is to think how we really invest to the human capital, because that will be the future, because I have seen too many hospitals, especially in the East, where we have only every fifth doctor available. We have many primary care settings which actually are empty. We have seen more than 2,000 attacks on health, and they are continuing. And we need to, at the same time, work on the responding and recovering all the time. And that's actually part of Ukrainian resilience, but we do it only because we have a human capital. We need to think about the future doctors, future public health experts, future nurses. So I hope that that will be part of the recovery conference also as we are moving to 2025. So I will stop here. I like to big applause to the panelists. Thank you. And while talking about the human capital, the next session is really about the next generation, various experts who we have around. So I need to hand over, I think, the chairing back to you. Thank you.
Дуже вам дякую за чудову модерацію. Дякую.
Thank you so much for great moderation. But before we proceed to our final, last but not least, inspirational panel, I would like us to watch a video from Sandra Galina, Director General on Health Care and Food Safety of the European Commission, who will summarize everything that was mentioned at this conference by our European partners, and not just European partners. Please attention.
Thank you for inviting me here, with your discussions. Ukraine has opened a new chapter as an EU candidate country and is making significant progress. This is an immense achievement considering the war that is being waged by Russia and the hardship that it has caused. Congratulations to you and to your courage. Coming up next February, we have discussions between the Commission and the Ukrainian authorities, and they will focus on public health chapter, as you may know. Here Ukraine will present its progress in aligning with EU public health legislation. It will outline possibly the steps it's taking to prepare its institutional capacity for EU standards. But in the meantime, the Ministry of Health has signed a cooperation agreement on health with us in the Commission. This happened in June last year. It identifies 7 areas of common interest, and amongst them I can quote mental health support, which is very, very important, displaced and refugees, the support to them in the healthcare, the work on rare diseases, and the funding through the EU for Health program. Now, plans are underway to support an assessment of Ukraine's cancer program to identify where tailored support may be needed. I want to say that Ukraine is also part of the fight against antimicrobial resistance, AMR in the acronyms, which is taking place through a joint action where Ukraine participates alongside the member states. This is the largest action on AMR ever funded by the EU, 62.5 million euros. Now, all this work will help build capacity and will help share knowledge. Dearest, I would say, friends in Ukraine, the road towards integration is long and it's intensive for every EU country. It has never been easy for anyone. The Commission is guiding Ukrainian authorities as they try to incorporate EU requirements into national legislation. We have also made significant financial commitments to strengthen Ukraine's national structures so that it can implement and enforce EU public health standards effectively. As you heard today, since June 2023, Ukraine has been engaged with developing new legislation to start aligning with the EU pharmaceutical acquis, which is a huge one. Ukrainian experts are participating in training that is provided by the European Medicines Agency to build capacity in the pharma sector, capacity that is compatible with our, I would say, setup, and I thank the EMA for this. Soon, a twinning project will begin where the EU authorities will provide support to establish a state control authority in the pharmaceutical sector, which is indispensable to participate in the EU. This work will help pave the way for Ukraine's integration once EU requirements have been met. Now, the Commission is also engaging with Ukraine to address other health challenges, as Commissioner Kyriakides was telling you this very morning. Again, as you are an associated country to the EU for Health programme, I would like to encourage you to keep making the most of the funding possibilities there. To close today's discussion, I would say has reaffirmed again that the European Commission is there to support Ukraine's health sector. And as it continues on the path to EU accession, the Commission is fully committed to supporting Ukraine with guidance and also financial aid. We stand united with Ukraine. Together, we'll make sure that its health sector does not only endure these attacks, but will be even stronger in the future. Thank you, and Slava Ukraini.
Героям слава, дякуємо пані Сандрі.
Thank you so much, and with warmest compliments to dear Sandra, we are stepping up to panel number 6. And this will be youth perspective and the vision of the future of Ukraine's healthcare sector. And now I have the pleasure of inviting the panelists to approach to this stage. And we will have another moderator who will have the pleasure and honor of inviting the rest of the panelists. I do understand how difficult this could be to be the final speaker. Thank you so much, dear Marichka. Thank you, dear ladies and gentlemen. Let us have some movement, because I believe we deserve some energizer. The more so that we have young people who will keep us awake. But let me also follow with words of appreciation to organizers, ministry, our guests and friends from the European Union and other partner organizations. This is excellent to hear that EU directives are not just words on paper, but in fact these are long-term initiatives and some KPIs suggested for us to abide by into the future. Speaking of human capital now, as we all remember, when we discuss demography and respective changes, we all have to ask ourselves a question: who will be doing the European integration in the future? We hear oftentimes that discussing the future of Ukraine without Ukraine is a mistake. But how about speaking and discussing of the future without young people? Isn't that a mistake as well? We heard about the victory plan presented to the parliament. Respectively, what kind of plan can be presented by our young people in that context? But I don't want to answer that question. I'd rather invite some young people who will produce answer to that question, because they will have to be integrated. They will have to make sure this is taking place, starting with Natalia Bidmorniak. Ukrainian Medical Student Association, non-governmental organization. Then we will have Katerina Topoluk, chief of the Student Self-Governance Organization at Kharkiv National Medical University. Konstantin Gnatyuk, a student of the IT faculty at Taras Shevchenko National University. Dear Kostya, please approach. Yegor Chufitsky, head of the Student Self-Governance of the National University of Pharmacy. And we also were expecting Polina Trishchenko, but instead we have Anastasia Bakalets, who today represents communication and sector of the EU delegation. And with you, consent, I will stay up and approach to be as close to you, the young people, the future, and also to make sure that I can handle with a microphone for each of you to speak. So, again, speaking of the youth vision for the future, but reflecting on what you've heard and remembering the messages suggested by the Minister Lyashko, what would be your vision regarding European integration? And also, what would be your ideas that you are formulating before making your decision whether to start your career in private sector, in civil service or anywhere else? Let me suggest that we start with Natalia Podmurniak, and just in the same sequence as you approach this stage, each of you will have microphone for a couple of minutes. Excellent, and thank you. Thank you, esteemed all members of audience, those who decided to survive and stay this late just to hear the voice of youth. Reflecting back on the question raised originally at this stage, is integration a timely process at this particular moment? I do strongly believe that this integration is not an extra item in the agenda, but it's a natural process which should be integrated at every level, and it's not a unilateral initiative. This is a collaborative effort between Ukraine and EU. Since I'm a resident clinician, I'm not a politician, and I have just graduated a couple of months ago, and so I do agree that that is something that we should start learning even being undergraduates. On the one hand, appreciating that European integration is important in general terms, but on the other hand, clearly seeing where and how are we going and advancing. Also, this is quite important to establish some academic culture. What I mean is that the students, young students, should think of academic career and continue advancing there respectively. Today we have such an extensive experience in terms of rehabilitation. Our health system is resilient, and that's a very interesting and helpful piece of evidence. I have just came back from the Berlin Health Summit, which is the platform for pioneers and leaders in healthcare, both public and private sector. And one of the key messages and areas for discussion would be mental health, digitalization, health and AMR. Today we were referring to all of these areas, which means that we are not a standalone market somewhere outside Europe. We are part of the shared space. And just as a wrap-up comment to my intro, we as the young people are ready and making ourselves even better prepared for a productive dialogue. So this is a matter of everybody else to be open for the dialogue with our involvement. Excellent. In that case, we'll be audible and visible along with you, and we appreciate how important it is to have the youth voice heard. Dear ladies and gentlemen, you've seen the announcement regarding our panel, and we'll be talking about the new vision of Ukrainian healthcare in the European Union context. So I'd like to hand over the floor to Katerina Topolyuk from Kharkiv National Medical University, but also mentioning that Polina Trishchenko, she is here. She's a graduate of the International and European Law at Yaroslav Modry University. So pardon my mistake and please join us. And with that, handing over the microphone, and please let me invite you to a brief statement. My dear colleagues, thank you so much and warmest welcome. Let me start by saying that indeed this war shows how important it is to be united. Being united means uniting with youth and having youth involved in different processes, including EU integration processes. As youth representatives, we understand why that is important. First and foremost, because that helps to a strong negotiating positions which will take us into the future. Today we share two main objectives. war and response to the challenges of war, and ongoing improvement and development. Our unique experience among Ukrainians is that we are able to balance everything and also generating bright ideas. Naturally, this is not limited to young people alone, other categories of population included. But why such a strong emphasis on young people in particular? The fact is that we are demonstrating why and where we are so productive, and there's growing confidence, namely in young people. Looking at Kharkiv, over 60% of the level of effort delivered in Kharkiv hospitals in the early days of the war, that was done namely by the young professionals. And now, looking into some of the regulations and fundamental principles in European protocols, we clearly see how important that is to provide for diversity of age categories and professional occupation categories to be commonly involved in addressing different challenges. And with that, let me immediately jump to artificial intelligence. Remembering that do no harm rule also prevails. Young people are actively involved in respective deliberations. And speaking of the Kharkiv National Medical University student, we all took a 9-day course on the role of artificial intelligence techniques in the health sector. Thus we joined the pool of students from 26 countries, thus being exposed to the most advanced techniques in this respect as well. Speaking of our university clinic, we are reviving this kind of performance, like in other cities of Ukraine as well. But looking into the example of Honeywell University Clinic, which is not only serves as clinical base for mastering skills of the students, but also developing the most advanced techniques in prosthetic care, amputee support and rehabilitation, and other innovative techniques. And equally important, not only mental support and mental health services for patients, but also for providers, which is critically important now in Ukraine and can be shared with other European countries. And in that respect, we also can conduct additional capacity building activities, conferences, webinars, where delegates can be exchanging and learning from each other, and thus making sure that all of us can access state-of-the-art technologies and tools, and also making sure that European counterparts are not only exposed but can utilize some of the techniques designed in Ukraine in the context of war. Equally important would be the TACMED. One of the most important areas for the future would be standard setting and unification of clinical guidelines, approaches and techniques, including some hands-on training and field operations, making sure that anybody, starting from a combat medic and up to faculty members at universities and academies, can work together in order to develop robust technologies. And there are some success stories in that regard. We have a training center for technical medicine where we have regular trainings in different areas, but most importantly, based on the results of such trainings, we are designing different customized training solutions which are now used everywhere in Ukraine. And another interesting and practical example, our university student association is also very extensive collaboration with international counterparts, including Ukrainian students who left the country and now have entered different academic institutions elsewhere in the world. And looking to the most prevalent questions for discussion in the social media among the students in the original days, This would be the question how to leave Ukraine, but now we can see the prevalence of the questions about the difference and minimizations, mitigation of those differences between European School of Education and Ukrainian, and how and what our counterparts from abroad can do to improve this system in Ukraine. There were a number of helpful solutions and ideas suggested today, proving effective and productive in each and every case that I used, and some other examples we were referring to. Namely, involvement of young people is critical, because we do care about our essential and quintessential problems, but at the same time we are strong, young and ambitious. Most importantly, we are Ukrainians. Thank you so much. We do have the delegates to be nominated to the Parliamentary Assembly and ready to produce some speeches and making statements. But since you mentioned about Ukrainian students abroad and remembering the different student exchange and residency programs, and also looking at that as an opportunity in the context of European integration. So remembering which, before I hand over microphone to Kostya, by the way, please pay attention that we have two males within the community of our panelists, which violate some of the fundamental gender equity principles. But the fact is that due to different demographic risks, the number of male students is substantially smaller than the number of females involved. In any case, setting that note aside, Kostya, before you have the floor, maybe you, as well as other speakers, could elaborate on awareness of Ukrainian students about potential career making in the European Union. How are you learning about those opportunities? Just Googling for it? Or relying on some reference materials provided by the ministry or some other official platforms announcing such opportunities, including the EU platforms. So how are you learning about that? Is that a trend? Well, first of all, let me present my personal opinion in that regard. As you've indicated, I'm an IT student. So speaking of awareness about different events, news and new trends in the health sector, I have to emphasize that all of those informational resources created by the Ministry of Health and other government actors, they are advancing. For example, my parents, when they were my age, could not have access to such avalanche of information pouring every day. Looking at the UI and other systems, including those designed by our professionals, not outsourced, but made by Ukrainians, they are really productive. So, in other words, let me say it this way. This volume of information is not only accessible, but also acceptable and digestible for Ukrainian students. So earlier, rare opportunities for international residency, for example, now become more and more accessible. Indeed, there are different resources which can provide you with that information. So in other words, your digital literacy is important prerequisite for European integration in the future. Absolutely. Excellent. In that case, a couple of words to you, Kostya, to present your vision, your key bullet points regarding the future of European integration in Ukraine. You know, we've been mentioning a number of times in this conference today an ideal performance of Medical Procurement Agency. And myself, as a third-year student of the IT course, I had an opportunity to go for active practice session. So I joined the IT team, meeting different experts, and I really loved the commitment of the entire team. And again, maybe you don't know, but that will be development of ME data, eStock, and other platforms. These are the products referred to, and I do feel a lot of confidence about such sector when speaking Medical Procurement Agency in particular. Well, it's not exactly what I meant. My question was, you as a representative of the IT sector, and your vision respectively. Maybe you would be interested in deploying or exploring some capabilities of the artificial intelligence tools. So is it actually a tool, or is it the lazy service? Well, before we start discussing artificial intelligence, we first have to agree about the utilization technique, because clinicians speak of artificial intelligence in some earmarked interventions when it comes to patient care. But when you ask that question, in my case, as remembering I'm an IT expert, well, student so far, I'm referring to a broad database and use of datasets about all clinicians, all patients, that we have to analyze, to use some machine learning and artificial intelligence on top of that in order to extract information about some trends, some interdependencies which could be used to forecast, for example, an epidemic which could happen in the future, but maybe not, depending on your assessment results. Okay, with that I'd like to hand over to Yegor, who's representing the National Pharma University. And since we have some changes in the sequencing of our speakers, Pauline will be next one to speak. Excellent. Warmest greetings to the esteemed community. Let me start by saying that European integration is the standing key priority, and integration of Ukraine into European Union will not only provide for the stable development of the future, but also will foster improvement of the standards of quality. But in order to be compliant, we have to continue implementation of the European acquis in the context of the healthcare sector reform based on the best European practices. And thus, we as the health sector representatives have to be committed to approximate our healthcare system to the maximum possible extent to the European systems. Health sector reform in Ukraine started back in 2016, but it's still ongoing, and it should be noted, and I'm particularly proud to plead that our national health sector has successfully survived the pressure of 2019 epidemic of COVID and continues its development. But still the question is, what is our future? I strongly believe we have strong capacity in the health sector. And today we heard a lot about the quality. So myself, as the future clinical pharmacist, I do care a lot. I believe that quality should start with planning. And in case of healthcare system, that would be planning HR capacity, looking to the residency, changing fundamental approaches to undergraduate and postgraduate training, and full transition to multidisciplinary care model, providing us with the fundamentals for insurance-based medicine. Speaking of pharma sector, in the recent years, in majority of the conferences and high-level forums, including those held by the WHO, there are two key items for discussion, serving as mainstream: multidisciplinarity and respective approach, and AMR, antimicrobial resistance. Looking at the multidisciplinarity, usually tend to forget about the pharmacists, who should also be involved in patient care, especially clinical pharmacists, which is quite a persistent problem nowadays. Speaking of AMR, we also have to recognize that the war has increased the acuteness of this problem, and here we need new synergies, establishment of new multidisciplinary teams who will be bringing together professionals from the pharma and clinical aspects. Remember about the clinical pharmacists again, because namely academic tuition will enable them to become the game changers when it comes to antimicrobial resistance in the health sector, and also contribute to development of such solutions as telepharmacy and the Institute of Family Clinicians, the more so that we have respective universities to train the pharmacy professionals. With that in mind, conditional to having the respective level of support, future development of the pharma sector is only the matter of time, especially when we are prone to initiate such stronger development of the market in this respect. And very active promoter of student self-governance, because that will be also the driver of change, especially in close collaboration with central and local self-governance authorities to be generating the best advancing ideas in the health sector. And looking to the future, I can see the importance of having annual student summits, where we would be building networks, opportunities between the employers, government representatives and the students, with strong support from the Ministry of Health and our international partners and stakeholders, providing for our involvement in the mobility programs for the students within the health sector and beyond, remembering how talented young people in Ukraine are. And I'm fully confident that once you cooperate respectively, you can have the dividends.
So, summarizing, healthcare of the future would be a successful implementation of all the stages of medical reform, compliance with the EU acquis, the full-fledgedly created teams of specialist involvement of youth to all the processes, and this would be the key to achieving success. We believe in the bright future. Let's shape it together. United and diversity. Thank you so much. A round of applause. Investing in youth and involving youth. But Yehor, if you are not too shy, could you show your report to the camera? Actually, the Word file. Because Yehor was sitting behind me and he was actually introducing multiple corrections after he heard something interesting from the speaker. Well, that's the sign of leadership, all right. Okay, so please, you as the representative of Yaroslav Mudry University, what's your opinion as a young expert who is already involved in the process? Polina, so what really requires changes right now? In what way youth is already influencing the decisions made? And a question to everybody, have you got vaccinated against influenza, as Marichka Padalko was asking? And what's your actually attitude towards the directives of WHO and MOH? In the first place, greetings to everybody present. I would like to start mentioning that my vision as a young lawyer would be that reintegration is not just about highest standards, values. It's in the first place about constant development, constant improvement that covers all the areas, including the area of healthcare. And Euro integration for Ukraine is an important driver of reforms that is being strengthened and supported by the European institutions. European Union is constantly improving the policies in healthcare, and for lawyers this is a unique opportunity to look at these norms, introduce them into Ukrainian legislation before adapting them. And actually we shall not be stopping just on strengthening of cooperation, adaptation of the best European practices. In general, that's opportunity of ours to shape up common policies, join the consultations, discussions. This is the opportunity to influence some common measures in the healthcare through the programs implemented by EU. And an example of such cooperation could already be InfoHealth program. Ukraine joined it already as the candidate country. Also, speaking about development, it's not necessary to just perceive it as the development of healthcare, but also professional development of us as experts in a narrower sense, because Euro integration opens up great opportunities for internship in European institutions. That's an opportunity to participate in European conferences. That's valuable experience. That's exchanging experience with European partners. And what's important would be that European partners, European countries walked a long path in establishing and improving their healthcare systems, which is why And they have valuable experience, and they have great algorithms of dealing with the feedback and the challenges they faced. And this is a valuable resource for us. We can adapt it in Ukraine. We can improve the quality of our practices and boosting the level of development of our healthcare system in general. My opinion would be that Euro integration for lawyers, for youth, for young experts would be about real opportunities in the first place and active participation in creating the new up-to-date system oriented at European standards. Thank you. Thanks. It's very interesting to hear these rhetorics from students of various departments. We heard pharma, we heard IT today, we had lawyers, and each and every one of them has their own role in Euro integration, but creation of certain organizations which are going to deal with, so to say, bringing Ukrainians back would be not the primary task, but the primary task is preserving the human capital we have. A round of applause. And this voice of youth we hear today, I would like a representative to do this, the representative of the delegation of EU. In what way EU is creating this common European future of Ukraine? The floor is yours. Thank you so much for inviting me, and I'm very grateful for inviting me to this panel today. I have an honor to be the representative of Press and Information Department of the delegation of EU to Ukraine. And let me highlight this other angle, in what way Ukraine and EU are creating the common European future right now. I'm very grateful for the topics you've selected for today, and namely the mobility of students, which is of paramount importance, as well as the topic of to what extent Ukrainians shall be changing their mentality to the European one. And thanks to the projects EU is supporting and funding in Ukraine, we really have an opportunity to start working on better understanding of Europeans, understand their mentality, value also ours. May ask you to proceed with the slides. Yep. And the next one. So, I would like to tell you about the projects which are currently out there for youth. Maybe for somebody it's not going to be a novelty, but I would really like our youth to know about these projects and actively participate in them and urge their friends to also participate. So, Erasmus Plus, that's one of the most well-known projects which are out there in EU. I want to highlight on the mobility of Erasmus Plus, meaning the cultural exchanges of youth between EU countries and Ukraine, but also Erasmus Mundus. Have you heard about this program? Please raise your hands if you did. 9,172 persons used this mobility program. That's a cool indicator. Yes, I'm proud of everyone who is ready to go and study abroad in order to come back to our country and implement the best European practices. And Erasmus Mundus is an opportunity to get a master's degree abroad in several European countries. And currently, this is very relevant information because right now they are selecting people for this program, and over 20 master programs are there available in biology, chemistry, psychology, physics and medicine, which is why one of the EU programs for you. And you can have a look about EU in figures. As you've mentioned, almost 10,000 people used this mobility program. 138 internships were granted, and over 40 higher educational institutions from Ukraine created alliances with 25 higher educational institutions in Europe. Let's proceed. Also, I would like to highlight the program responsible for development of skills. That's vocational education. I'm not going to dive deep into the topic, but if to be brief, European Union is funding the institutions which are providing professional technical assistance, education, vocational education. They are also providing the textbooks. And the next slide is also related to this. That's safe educational environment, that's support to online schools in Ukraine, not to have the educational gap, and especially this gap is dangerous if we speak about education. Also, I would like to tell you about eTwinning program. I really like it because it's about integrating Ukrainian educators and Ukrainian youth to the European youth. And this eTwinning program would be about community of cooperation of Ukrainian politicians, educators and civil servants responsible for education and educational reform in Ukraine. It helps them integrating into European communities thanks to mobility, exchanges of experience, training tours, and it allows them understanding in what way it all works in Europe, as they say, on the field, on the ground, what it looks like in reality and in what way the European practices are being implemented in real life, and to bring the best practices back to Ukraine. Then, a bit about EU networks. This would be those networks which will be very relevant for Ukrainian youth, for better understanding of European values and European integration, what it's all about. Informational centers are functional in 25 universities in the majority of oblasts of Ukraine. There you can learn more about policies of EU if you are interested. If you would like to learn about EU values, these centers are important for as many people as possible to learn about opportunities of European integration. And also this is the great opportunity to get new knowledge about the programs and about opportunities of development. My dear colleague here mentioned that mobility in the universities would be something available to privileged, and we would really like this to be something very common, something routine, and for as many people as possible to have an opportunity to use this program of mobility, and information centers are out there to inform people about all the opportunities which are out there, and these programs cover a lot of areas. Then career days, this would be yet another project of EU. That's an opportunity of communicating to representatives of various areas and make this first step towards your future career. That's an opportunity to listen to trainings, both online and offline, participate in them. As regards creating your CV, and it covers a lot of European standards, because in Europe, Europath is a very well-known approach, and this way you can orient yourself in what way to access this labor market. And briefly about two more projects, EU Study Days. I hope you heard about it, because this is a very well-known project which has got more than 3,000 graduates, and a lot of these graduates are working in authorities. This is the project which provides education about EU, and yet another stage of this project would be the European integration for youth. So we have lawyers, healthcare professionals, future IT specialists here, and that's important to have this common grounds and understanding of the EU policies and key elements of European integration. And the final project I want to highlight here would be Euro Clubs. This is the project for school children. We can skip it. And the final one would be Ambassadors of European Youth. This project is really special. We are proud in the EU delegation to Ukraine because this is about visiting universities and telling your colleagues, your peers, about what EU is, what the EU programs are about, and this peer-to-peer exchange. When peers are exchanging their experience with their peers, this works really well. And namely, these ambassadors of European youth are ensuring great knowledge about European Union and opportunities of development. Yet another one, Euroquiz, if I'm not mistaken. This is a very interesting project and initiative. That's the project which allows, in the format of tests, the website learn more about European countries, about law, policies of EU, and currently it covers a lot of areas, including healthcare, which is the great format of combining, this playful format, but at the very same time provides very important information. Thank you so much, and I believe this would be enough for me. A round of applause. Thank you. May I just add that it's important to highlight that EU is very open, and my colleague here mentioned united in diversity. Well, I believe, and we see this in practice, that European Union is ready to support youth from all the areas with various backgrounds. Please join us, the EU delegation to Ukraine, in social media, because we are making public all the announcements there in our social media. The projects we support are also present there. I want more and more people to know about this. Anastasia, thank you so much. Round of applause goes to you. I believe today's panel underlines again that not just youth needs this. You need it. You people who are shaping up their future, human resources policies. So your task would be to really think about it all comprehensively. And as Olha Stefanishina is mentioning, once Euro integrator, always Euro integrator. So that's a very logical crowning of this very conference. We will have selfie with youth. And that's the reminder to ministers that competitors are growing up. Selfie with you guys. Thank you, and take your seats, dear friends. And we invite Marichka. Thank you for great moderation. Thank you, dear participants. We continue, and the key word is Prosecco, but not just Prosecco, but also networking. For you to communicate, please don't be in a hurry. It's the rush hour now. Just stay with us for yet another hour, and then you'll get home, okay? So this is time for networking in an informal atmosphere, and see you soon. All the best.